Committee will come to order. We're meeting today to consider 25 bills that address critical issues facing our nation today, and I would now recognize myself for 3 minutes for an opening statement. The 25 bills continue this committee's commitment to putting consumers first, strengthening our economy, combating climate change, and ensuring all Americans have access to affordable and quality health care. We'll put consumers first by addressing annoying robocalls and dangerous consumer products. The American people are fed up with robocalls. Who can blame them? An estimated 47 billion robocalls were made last year. That's outrageous. Today, this committee will provide some much-needed relief by considering the Stopping Bad Robocalls Act that I introduced with Ranking Member Walden and Ranking Member Latta and Subcommittee Chairman Doyle. And this legislation gives consumers control of their phones again. We'll also consider 6 bills that will protect American families from dangerous products, including some that should no longer be on the market. We'll combat climate change and strengthen our economy by considering 5 bills that invest in energy efficiency programs in communities across the country, programs that create good-paying jobs, save consumers money, and reduce the amount of greenhouse gas pollution emitted into the air. And we'll also discuss legislation that will make our nation's energy infrastructure more secure by addressing cybersecurity. And finally, we'll continue our work of ensuring all Americans have access to affordable and quality health care by reauthorizing and strengthening critical public health and Medicare programs. A number of these programs, including funding for community health centers, will expire at the end of September if we don't act. And we will consider a long-term funding agreement for the Medicaid program for the U.S. territories that is long overdue. We'll also bring more transparency to the prescription drug pricing process. The Metric Act includes 5 bipartisan bills that will ensure consumers have access to more information about how prescription drugs are priced and why prices are increasing. We'll also tackle the issue of surprise bills. The days of patients receiving surprise bills, sometimes as high as $100,000, must end. We'll consider the bipartisan No Surprises Act, which I introduced with Ranking Member Walden. This bipartisan legislation will protect consumers from surprise bills. Patients must be held harmless in situations where they're not aware, through no fault of their own, that a provider is not within the insurance network, and that's exactly what this legislation does. And finally, I did want to mention that we had planned to mark up legislation to reauthorize the Federal Pipeline Safety Program, but we're going to hold that for a future markup. And I want it to be a bipartisan bill, and that's my intent. And one way or another, we need to get this done early this fall because that also expires, I believe, by the end of September. So I want to commend all members and staff for their work in helping to get the 25 bills ready for markup today and hope that they receive strong bipartisan support. And with that, I would recognize Ranking Member Walden for 3 minutes for an opening statement.
Well, thank you, Mr. Chairman. We appreciate the markup today, and I'm pleased at the bipartisan progress we've all made, all the members on the committee and the staff, our incredibly talented staff, on a number of key policies under consideration. As you've said, today we will consider bipartisan legislation to address a challenge nearly every American with a telephone faces, and that's illegal robocalls. Through the Stopping Bad Robocalls Act, I'd like to thank Chairman Pallone, Mr. Doyle, and Mr. Latta, especially for their partnership on this legislation to protect consumers from illegal robocalls. We're also moving forward with the 6 bills advancing through our Consumer Protection and Commerce Subcommittee to protect consumers, families, and children. While there's strong bipartisan support for many of these bills, as we will hear today, concerns remain about some of the bills before us. In the spirit of bipartisanship, we hope to move these bills by voice vote, but I'm hopeful that we can continue to work to improve these measures before they're considered on the House floor. The Health Subcommittee has produced a large and bipartisan package of important legislation. The Reauthorizing and Extending America's Community Health, or REACH Act, provides for 4-year extension of several critically important public health and workforce programs, including an extension of the community health centers. On the Medicare front, this package includes long-term priorities of this committee, such as the HEARTS Act and provisions to improve the diagnosis of prostate cancer and an extension of the Independence at Home project. This package will also address the disproportionate share hospital cuts for the next 2 years and will provide updated funding for the United States territories' Medicaid programs to ensure they can continue to provide the care their constituents need, while including strong program integrity measures that are more important now than ever. Finally, but notably, this package includes the No Surprises Act, which will protect patients and families from surprise medical bills. Thank you to all the members and staff for your good faith efforts in bringing this package together. Now, we know there's still work to do as this package moves to the floor and we negotiate with the United States Senate, but we have a great start, and I look forward to continuing these discussions. We'll also consider 2 additional health workforce bills today, along with 4 bipartisan bills that reauthorize important discretionary public health programs: the Autism Cares Act, the Newborn Screening Saves Lives Reauthorization Act, the Emergency Medical Services for Children Program Reauthorization Act, and the Lifespan Respite Care Reauthorization Act. As if that weren't enough, we'll also mark up the Metric Act, which will help increase transparency in drug pricing. The Energy Subcommittees produced 10 bills for consideration today, including bills to improve DOE electric and energy infrastructure, cybersecurity, and bills to increase water system efficiency and to speed up implementation of smart building technology. 2 additional bills, Chairman Rush's Workforce Development Bill and H.R. 2041, the Weatherization Bill, have been negotiated in good faith, will also pass with bipartisan support. I'm appreciative of the bipartisan collaboration from members and staff to produce these results today, and I yield back the balance of my time.
Thank you, Mr. Walden, and thank you for all your support in making this effort today bipartisan. And I'd like to now recognize Mr. Rush, Chairman of the Subcommittee on Energy, for 3 minutes.
I want to thank you, Mr. Chairman, for holding this important markup on 25 bills covering an array of issues, of which the vast majority are bipartisan pieces of legislation. I would like to commend all of the sponsors and co-sponsors and their staffs for all of their hard work in introducing each of these bills. While I support each of these pieces of legislation, I want to especially acknowledge some of the bills that originated from the Energy Subcommittee covering issues of workforce development, energy efficiency, and cybersecurity. I am the sponsor of H.R. 1315, the Green Collar and Blue Collar Jobs Act, H.R. 362, the Energy Emergency Leadership Act. I want to publicly thank Ranking Member Upton and his staff for working with my office to strengthen each of these bills. And I also must acknowledge the leadership of Mr. Hudson and Mr. Wahlberg, who worked with my office on the workforce and cyber security bills, respectively, which will each move forward through the committee with bipartisan support. I take my hats off to Mr. Hudson and Mr. Wahlberg for their strong efforts on behalf of these bills. I strongly believe that each of the bills before us will help to strengthen the economy and combat climate change, while also putting consumers first by investing in a skilled, diverse energy workforce and protecting the nation's electric grid. I urge all my colleagues to support the bill.
Thank you.
I yield back the remainder of my time.
Thank you, Chairman Rush. I'm now going to move to Dr. Burgess, Ranking Member of the Subcommittee on Health, recognized for 3 minutes.
Thank you, and I want to note that this markup today includes a number of critical health care reauthorizations that passed through the Health Subcommittee with unanimous bipartisan support last week. H.R. 2328, the Reauthorizing and Extending America's Community Health Act, reauthorizes public health programs for an additional 4 years. This will provide our public health programs with greater predictability, allowing them to maintain their staffing and research goals. H.R. 2328 also includes a 3-year extension of important Medicare programs, including the Independence at Home demonstration program, which Congresswoman Dingell and I have worked on for many years. The program provides home-based primary care to high-need Medicare beneficiaries with multiple chronic conditions, helping them avoid unnecessary hospitalizations, ER visits, and nursing home admission, and ultimately saving dollars. Another important public health reauthorization is 2781, the Empower for Health Act, which I introduced along with Representative Schakowsky. As chairman of the Health Subcommittee last Congress, I made passing Title VII physician workforce reauthorization one of my priorities. I am And we did that last Congress, but I am glad to see, since the Senate failed to take action, I'm glad to see that we're taking this issue up again. We will also be considering an amendment today to authorize Medicaid dollars to the United States territories, which will allow the territories to continue to provide critical access to health care. Following the recent events that have transpired in Puerto Rico, I am glad that we've reached a bipartisan consensus on adding more program integrity measures, and I want to thank Representative Jennifer Gonzalez-Colon for her work on this issue. The amendment also contains the No Surprises Act, which would ban surprise or out-of-network billing. The goal of this legislation is to protect the patient by keeping them out of the middle. I appreciate the bipartisan effort to continue working on this after the subcommittee markup so we can get to a compromise. It will be our job to make sure that it does not get unsatisfactorily diluted in our conference with the Senate. Another priority of the Health Subcommittee of this Congress has been to address fair drug pricing. H.R. 2296 includes measures to increase transparency throughout our drug pricing system. I am willing to support this package given the improvements that have been made on the after the bill was considered at our hearing. On a separate note, I would like to voice my support for the inclusion of H.R. 3375. Any American with a cell phone has dealt with robocalls, probably illegal robocalls, and I look forward to saving Americans from the nuisance and danger of these bad actors in the future. Thank you, Chairman Pallone, Ranking Member Walden, for putting this docket of bills together. I suspect that this will be a lengthy but productive dialogue. I yield back my time.
Thank you, Dr. Burgess. And now I recognize Ms. Eshoo, Chairwoman of the Subcommittee on Health, for 3 minutes.
Thank you, Mr. Chairman, and good morning to all the members of the committee. We're marking up 25 bills today, and that represents a great deal of work, highly productive work, and so much of it is done by the staff of the members, certainly the members themselves, their staffs, the subcommittee staff, and the full committee staff. So I want to acknowledge all of that. 8 bills have come out of our health subcommittee. They invest in public health and the Medicare program. They improve drug pricing, transparency. They provide Medicaid funding to the U.S. territories. And I think that this is really an enormous accomplishment. Of all the years that I've been on the committee, I think this represents the best work moving that issue forward for the territories. It's going to make a difference in the lives of so many Americans that live in the territories. And of course, ending this egregious issue of surprise billing. So I think that today's markup really continues our progress on legislation that's going to make a difference, a very real difference in the lives of all of our constituents, whether it's making sure that our community health centers are funded, their local hospital continues to operate, or that they'll no longer be stuck with these eye-popping surprise bills, especially if they have had an emergency room visit. So thank you to everyone that's been involved in the productivity, and I look forward to a timely and swift markup of these 25 bills, and I yield back the balance of my time.
Thank you, Chairwoman Eshoo. Next, we're going to go to Mr. Latta, Ranking Member of the Subcommittee on Communications and Technology. Recognized for 3 minutes.
Well, thank you very much, Mr. Chairman. And today's markup includes bipartisan bills that I'm pleased to support, including the Stopping Bad Robocalls Act, CyberSense Act, and Enhancing Grid Security through Public-Private Partnerships Act. I'd like to thank you, Mr. Chairman, our Republican Leader Walden, and Chairman Doyle for working so closely with me on a bill that will offer consumers relief from illegal robocalls. This legislation, which incorporates my bill, the Stop Robocalls Act, will offer immediate solutions to curb the estimated 48 billion robocalls that Americans receive each year. Our bill would build off the FCC's actions last month to provide consumers with robocall blocking technology, by requiring the FCC to add transparency provisions and redress options for consumers and callers. This will allow consumers to know which calls are being blocked, similar to the spam filter in email, and create a pathway to stop wanted calls from being blocked. The bill will also terminate illegal call operations by increasing information sharing between phone companies and the FCC and further industry efforts to trace back the source of unwanted robocalls. Most importantly, this bipartisan bill will ensure that we are preserving consumers' access to desirable and at times life-saving calls and text messages while also protecting them from bad actors who fraudulently spoof caller ID information to make illegal robocalls. Americans deserve peace of mind, knowing that the phones that connect us to the world are being used for good and not scams. I'm also pleased to see the markup of two bills I've introduced and worked on closely with my friend from California, Ms. McNerney, the Enhancing Grid Security through the Public-Private Partnerships Act will direct the Department of Energy to facilitate and encourage the public-private partnerships to improve cybersecurity of electric utilities. And my bill, the CyberSense Act, will create a voluntary DOE CyberSense program that will identify and promote cybersecure products for use in the bulk power system. It will also establish a testing process for products along with a reporting process of cybersecurity vulnerability. Finally, the Secretary of Energy will be required to keep a related database on these products to assist electric utilities in their evaluation of products and their potential to cause harm to the electric grid. At last week's Energy Subcommittee hearing, Assistant Secretary Evans expressed support for this policy to help improve the grid's security and resiliency. These bills will foster a collaborative relationship between the DOE and the utilities to ensure our grid becomes increasingly resilient in the face of cyber attacks. Grid security is a national security, and it's important that we act. With that, Mr. Chairman, I appreciate today's markup, and I yield back the balance of my time.
Thank you, Mr. Latta. Next, I go to Chairman Doyle.
Thank you, Mr. Chairman, for calling this markup today and for considering legislation to address a problem that we've all have firsthand experience with, robocalls. Unwanted robocalls have exploded recently, with Americans receiving nearly 48 billion last year alone, which is a 60% increase from the year before, and we're expecting to see that increase to 60 billion this year. And while some of these calls constitute legitimate alerts and reminders, that only accounted for about 20% of the robocalls people receive each year. In the month of June alone, my hometown of Pittsburgh received an estimated 34 million robocalls. So today, the committee will mark up the Stopping Bad Robocalls Act, legislation that was introduced by you, Mr. Chairman, and Ranking Member Walden, along with my Ranking Member, Mr. Latta, and myself. This legislation is a thoughtful and much-needed response to the onslaught of billions of illegal robocalls Americans face. On average, everyone in this country receives 14 of these calls every day. So the bill before the committee today is the result of bipartisan negotiations, which included industry and public interest stakeholders. I'm glad that these discussions have resulted in a strong bill that will help seriously reduce the number of robocalls consumers receive. All in all, this is a strong bill and a good compromise. It shows what Democrats and Republicans can accomplish when we put our heads together to address a critical issue. I'm glad to be marking it up today. I urge all members of the committee to support it and discharge it to the floor and out of the House forthwith. I'm also pleased that we're going to mark up H.R. 1058, the Autism Cares Act of 2019. Since we started working on this legislation in 2006, over $3 billion has been dedicated to NIH, CDC, and HRSA to understand autism spectrum disorders and to find the right intervention and support for each unique individual. Funding has also been used to support the training and education of health professionals, to provide resources for families, and to coordinate efforts across federal agencies at the Interagency Autism Coordinating Committee. These efforts have translated into real-life support for individuals and families, although we still have a long way to go. This bill today would help address some of the gaps that remain in our understanding of ASD and interventions and supports for individuals and families. And with that, Mr. Chairman, I yield back.
Thank you, Chairman Doyle. Next, we're going to go to Ms. Rogers, Ranking Member of the Subcommittee on Consumer Protection and Commerce, for 3 minutes.
Good morning, everyone. Thank you, Chairman Pallone and all of my colleagues on this committee. Today, we will consider 6 bills from the Consumer Protection and Commerce Subcommittee, beginning with H.R. 2211, the Sturdy Act. Thank you, Chairman Pallone and Chairwoman Schierkowski, for listening to our feedback on this legislation. Our amendment that I will offer later today continues to improve the bill. I appreciate your commitment to our bipartisan negotiations and to keeping children safe from harm. H.R. 3172, the Safe Sleep Act, addresses a suffocating hazard related to the recent recalls of several inclined sleep products. And H.R. 3170, the Safe Cribs Act of 2019, will address the suffocation hazard created by padded crib bumpers. I hope that our efforts here and the work done by the CPSC will help prevent future tragedies. I strongly encourage parents to visit saferproducts.gov to get the most up-to-date information about these and other recalls. That's saferproducts.gov. I'd also like to recognize Mr. Carter and Ms. Custer for their work on H.R. 1618, the Nicholas and Zachary Burt Carbon Monoxide Poisoning Prevention Act of 2019. Carbon monoxide detectors save lives, including a constituent of mine in Spokane Valley just earlier this year. Turning to H.R. 806, the Portable Fuel Container Safety Act of 2019, this bill requires all consumer fuel container products utilize a flame mitigation device preventing dangerous flame jetting. Thank you, Margaret Lewis, for turning your family's tragedy into a personal mission for other families and to protect those that might have a similar nightmare. Your steadfast commitment to your family in this issue got us here today. I'd also like to recognize Reps. Griffith and Matsui's work on H.R. 2647, the Safer Occupancy Furniture Flammability Act, or SOFFA Act. I share the goals of this legislation. One national standard is critically important, but I have concerns with the current draft that sets a state technical bulletin as a federal standard. As I've mentioned throughout the process, I'm disappointed that the majority did not allow my bill, the FASTER Act, to come up for debate during today's markup. But I'm encouraged by the progress we've made on several other bills here today and look forward to supporting them and moving them forward in the process. Thank you, Mr. Chairman.
Thank you,
Yield
Ms.
back.
Rogers, and thank you and Chairwoman Schierkowski, because you've taken so much care in trying to protect children, which I think is so important. And I'd like to now recognize Chairwoman Schierkowski for 3 minutes.
Thank you so much, Chairman Pallone, and thank you, Ranking Member Walden, for your leadership in bringing us all together for today's important markup. You know, consumer protection is what really drew me to public life in the first place, and I like to call the subcommittee that I have the honor of leading America's Helpline. And as I've said several times in our subcommittee, Americans sometimes have some skepticism about what does government really do for us, and the bills that we passed in our subcommittee have one thing in common: they save lives. They're pretty simple pieces of legislation, and I want to say that I am so happy that we were able to pass these bills in a bipartisan way. You heard some of them already from our ranking member, that she and I have been able to work together, and that we've been able to work in a totally bipartisan basis on these bills. And I again want to assure her that we all agree that the recall process needs fixing, and that we will go forward in working together to find a bill that does that better. But the bills that we passed will protect children from being killed from dressers falling on them. And some may say, really? That happens? Every 10 days, a child dies from that. We are going to protect people from gas cans that explode. We're going to make cribs that are safer, because there are instances of products inside the cribs that actually end in the death of babies. We are going to make furniture which has toxic chemicals that threaten people and firefighters safer, and protect people from carbon monoxide poisoning. So again, I don't want to take too much time. We have so many bills, but I do want to say that I also really appreciate the parents that have come forward in such a painful moment, situations where their children have died or been injured, and testify about these threats that have led to a number of these bills that we have passed. And also just thank all my ranking member and all the members of the subcommittee. I think we have made good progress today, and I think everyone can be proud to support these bills, and I yield back.
Thank you, Chairwoman Schakowsky. And now we're going to go back. Where did he go? To Ranking Member Upton. Is he at the end there? Yeah.
Thank you, Mr. Chairman. It's important that we have this full committee markup today. We've got 11 bills before us that were reported by the Energy Subcommittee. We have bipartisan agreement on almost all of them, and I look forward to continuing to work. It was important that we reached bipartisan agreement on an energy and manufacturing workforce development bill. It is a huge win for all of us. I look forward to a big vote so we can build on that momentum and get it across the finish line, given our history with this bill through multiple Congresses. We also came together to reauthorize DOE's weatherization program. It's an important program for every state, certainly Michigan, to help reduce energy costs for low-income households by increasing the energy efficiency for their homes. This is an expired program that continues to receive funding every year, so I'm glad that we are finally able to come together and reassert the committee's important role as authorizers. Also pleased that the full committee will soon report our bipartisan cyber bills from the last Congress, including legislation that I helped write to codify DOE's authorities regarding the cybersecurity of the nation's pipeline system. Finally, I want to thank you, Mr. Chairman, and Chairman Rush, for continuing to work with us to reauthorize PHMSA's pipeline safety program on a bipartisan basis. I know that we're going to get there. We're not quite there yet. And so we'll continue to work in the weeks ahead to get there and work with our colleagues in another committee or two. I also want to commend our committee's work on the very important health care bills that we're considering today. Many programs I've long supported, such as community health centers, a special diabetes program, and others. I also am pleased that we're moving legislation tackling the issue of surprise medical billing, certainly an important issue. I would guess that all of us have heard from our many community members on every side on this. I think that we've got a sweet spot. I look forward to supporting that and look forward to working with all of us, and yield back.
Thank you, Mr. Upton. I think that concludes opening statements by the subcommittee chairs and ranking members who have legislation before us. But would any other member seek recognition at this point? On the Democratic side, is there any? Mr. Kennedy?
Thank you, Mr. Chairman. I want to thank you for calling up this markup and moving forward with a series of bipartisan policies that will protect lives around this country. From bringing an end to abusive, predatory robocalls, to enacting critical safeguards for dressers and cribs, to job retraining programs to enhance workplace protections for nurses, the package that we consider today will make a massive impact on the lives of many Americans. None of these bills that we are considering today should be dismissed as non-controversial or portrayed as easy messaging bills because of the results that they will provide. Because there is, in fact, someone in this country whom none of us have met, whose lives will be changed by what we accomplish today. I'm particularly glad that this legislative package includes provision to postpone cuts to disproportionate share hospitals that will save hospitals in my home state of Massachusetts more than $300 million. Those savings can now be redirected towards life-saving care those hospitals provide every single day. It wouldn't be possible without the bipartisan support of the amendment that was received by many of my colleagues when we were in the subcommittee markup. And although we certainly still have work to do to increase funding for community health centers and other critical healthcare programs, this markup is a great start. Thank you. Yield back.
Thank you. Anyone on the Republican side? Gentleman is recognized.
Thank you, Mr. Chairman, for holding this important markup today. The number one thing I hear about back home is robocalls. Kentuckians are sick of their lives being interrupted by these intrusive calls. People have told me about calls that look like they're local, even though they're coming from their own number, only to be coming from somewhere across the country. One Kentuckian told me she disconnected a landline she had over 50 years because she was getting too many spam calls. A college student in my district said that he once received 12 calls during just one class period. So I'm glad we're addressing this issue. And in addition, I look forward to debating the No Surprises Act, which will protect patients from surprise medical billing. I appreciate the hard work of Chairman Pallone, Ranking Member Walden, and the staff on this bill. I think we all agree that we want to get this right and protect patients from surprise bills. I yield back.
Thank you. Mr. Lujan?
Thank you, Chairman. And thank you to you, Mr. Chairman, and to the ranking members, Mr. Walden, to all the subcommittee chairs and ranking members for their work to provide much-needed protections to the American people. Today, the Energy and Commerce Committee will pass more than 20 bills, the vast majority of which will pass with wide bipartisan support. We'll stop the avalanche of robocalls that take up our constituents' valuable time and to protect children from dangerous products. We'll promote green jobs and smart buildings, energy and water efficiency efforts. We'll strengthen our public health infrastructure and support our community health centers. We'll increase transparency related to drug prices and reauthorize vital nursing workforce development programs, and we will take steps to protect patients from surprise billing. Finally, I want to thank Chairman Pallone and Ranking Member Walden for working with me to strengthen the provisions that increase access to data and transparency related to the air ambulance billing process. Again, I thank my colleagues for their work on these important issues, and I yield back.
Thank you. Anyone else on the Republican side? Anybody on the Democratic side want to say anything? All right, we're going to proceed then. We'll start with the bill consideration, and I call up H.R. 3375, the Stopping Bad Robocalls Act, as forwarded by the Subcommittee on Communications and Technology on June 25th, and the clerk will report the bill.
H.R. 33775, a bill to amend the Communications Act of 1934 to clarify the prohibitions on making robocalls.
Without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read and open for amendment at any point. I'm going to recognize myself to offer a manager's amendment, which is labeled MGR 01, I guess. Clerk will report the amendment.
Amendment to H.R. 3375, offered by Mr. Pallone of New Jersey. Page 2, beginning
Without
on line
objection,
8.
the reading of this amendment will be dispensed with, and I'd recognize myself for 5 minutes to speak in support of the amendment. This bill, the Robocalls Act, as we've said, is an important step to cut down on the harassing, abusive robocalls that all of us, members here on this dais, but more importantly, our constituents across the country, receive these calls every day. It's been a great bipartisan effort to get the bill to this point today, and I would like to thank my colleagues for all of their efforts to support and strengthen the bill. And I'm offering today a manager's amendment that makes a few small but important changes to the bill. First, it includes a handful of technical tweaks in response to discussions we've had with colleagues and stakeholders. Second, the manager's amendment includes a new provision that addresses legitimate calls that are blocked or deprioritized. And one issue that my colleagues representing rural areas have raised with call authentication standards is that calls originating from networks using older technology, which often serve rural areas, may be blocked or appear as a possible scam call because the technology is not compatible with these networks. So to address these concerns, we added a provision to create transparency around blocked calls, as well as redress options for improperly blocked calls. But again, this is a strong bipartisan bill with common sense and meaningful provisions to tackle illegal and unwanted robocalls. It gives consumers more control over stopping these calls and tightens the screws on scammers using our telephone system to harass and abuse. And I worry that failing to act on this important issue not only causes further harm and annoyance to our constituents, but also undermines our telephone system. So I urge support for the amendment as well as the underlying bill, and I would yield back at this time. Are there any members? Oh, I'm sorry. Oh, I see. Are there any other members seeking recognition to speak on the amendment specifically, on the manager's amendment specifically? Yes, Mr. Chairman Doyle.
I move to strike the last word. Mr. Chairman, I support the manager's amendment and I support the underlying bill. This legislation does much to address many of the technological and regulatory shortfalls that have led to the rise in robocalls that we have to deal with. I'm pleased to see that language from the Support Tools to Obliterate Pesky Robocalls Act, or Stop Robocalls Act, which Ranking Member Latta and I introduced, was also included in the base text of this bill, which allows phone carriers to automatically enable robocall blocking services by default on phone lines. While these technologies have been available in an opt-in basis, too many of our seniors, and frankly, too many people in general, just don't know about these services or how to enable them. Allowing these services to be enabled by default allows more consumers to benefit from these technologies without having to go through an onerous sign-up process, particularly for seniors and those most vulnerable to scam calls. The bill also includes provisions that would ensure these new robocall blocking services do not result in new consumer fees, and provides redress for callers and consumers when a call is blocked incorrectly. The bill also requires all carriers to adopt call authentication technology, which would enable people to be certain that the number they see in their caller ID is really the number that the call is coming from. All too often, people get calls that look like they're coming from someone down the street, but were actually coming from scammers half a world away. The bill also seeks to limit the number of nuisance robocalls consumers receive by ensuring that callers have consumers' consent before they robocall them, and it would require a series of rulemakings by the FCC to update their current rules to ensure that these rules protect consumers. The bill also extends the statute of limitations for illegal robocalls to ensure that federal authorities have sufficient time to take legal action against spammers and scammers who make these calls. Mr. Chairman, this is a good bill, and I recommend all members to vote for the manager's amendment and the underlying bill, and I yield back.
Thank you, Chairman Doyle. Are there other members seeking recognition on this manager's amendment? Yes, Mr. Jankman.
I move to strike the last word.
Gentleman is recognized.
First and foremost, I commend Chairman Pallone, Chairman Doyle, Republican Leader Walden, and Republican Leader Latta on their ability to find a consensus to protect Americans from unwanted robocalls. Montanans have told me it's one of the worst things they face on a day in and day out basis are illegal robocalls. They're getting called with bogus insurance offers, threats of legal action, and false promises of government grants. Robocall scams put Montanans at risk of being robbed. Scammers constantly try to steal private, personal information, social security numbers, credit card numbers, and banking information from unsuspecting Montanans. Today, we're taking a huge step in stopping the scourge of robocalls. The Stop Bad Robocalls Act empowers and protects consumers. The bill requires phone companies to provide call authentication technology, offers call blocking services, and gives the FCC more tools to track down bad actors at no cost to consumers. This legislation also contains language I introduced with Mr. Butterfield and Mr. Johnson. Our Tracing Back and Catching Unlawful Robocallers Act creates a report on private efforts of companies to implement traceback technology, its effectiveness, which companies participate. Consumers will have access to this public information. The report will also inform the FCC and Congress on the effects of these traceback efforts. I'm proud of our bipartisan efforts are moving forward today, and we're one step closer to protecting Montanans from scammers and criminals who seek to do them harm. And with that, I recommend support of the manager's amendment and the underlying bill, and I yield back.
Thank you, Mr. Gianforte. Anybody on? Yes, Mr. Butterfield?
Thank you, Mr. Chairman. I, too, would like to thank you, Chairman Pallone and Chairman Doyle, and to the two ranking members for their efforts in preventing the spread of illegal robocalls. These calling operations, Mr. Chairman, have the potential to deceive and defraud unsuspecting citizens in my district and in your districts with little recourse for victims. Illegal calls are not only undermining legitimate commerce, but also the integrity of our government, as perpetrators often impersonate government officials, and that is absolutely despicable. Congress must do its part to bring perpetrators to justice and end bad robocalls for good, and that is what this committee is doing today with the Stopping Bad Robocalls Act. And so I want to thank the leadership of our committee. I want to thank Mr. Giannaforte and all of you who have had a hand in making this legislation possible. Thank you. I yield back.
Thank you, Mr. Butterfield. Anyone on the Republican side want to speak on this manager's amendment? Yes, Ms. Rogers.
Thank you, Mr. Chairman. I move to strike the last word. Robocall spam is a nuisance that almost every American deals with on a daily basis. For some, they can be more than just an annoyance. Sometimes it's leading to the theft of personal or financial information. Over the last few years, they've begun to impact nearly everyone in Eastern Washington and across the country, and are expected to become even worse in coming years. I want to applaud the chairman, Chairman Pallone, Ranking Member Walden, and the rest of the members and staff for this important work, bipartisan work, that went into the legislation before us. By cracking down on bad robocalls and requiring carriers to implement safeguards and services for their consumers, it's my hope that we can end this dangerous annoyance once and for all. I urge support for this important bill, and I yield back the balance of my time.
Thank you. Anyone else want to speak on this manager's amendment? On either side? All right. If there's no further debate, we'll proceed to a vote on the manager's amendment. All those in favor of the amendment will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chairs, the ayes have it. The amendment is agreed to. Are there any further amendments to this bill? Dr. Burgess is recognized.
Thank you, Mr. Chairman. I have an amendment to offer on behalf of Ms. Dingell and myself. It's amendment number XML 44.
Clerk, have the amendment.
Yes.
Clerk will report the amendment.
Amendment to H.R. 3375, offered by Mr. Burgess of Texas.
Without objection, the reading of the amendment will be dispensed with, and the gentleman from Texas is recognized for 5 minutes.
Thank you, Mr. Chairman. And then I wanted to offer this amendment with Representative Dingell to establish a hospital robocall protection group at the Federal Communications Commission. This group will issue best practices to help combat unlawful robocalls made to hospitals, as well as those made spoofing a legitimate hospital phone number. Robocalls have moved beyond a simple nuisance. Sophisticated actors are now using them to trick people into providing sensitive information by posing as legitimate organizations. When this spoofing happens to hospitals, patients have no reason to believe that there is a fraudulent actor on the other line, leading them to reveal sensitive health data and financial information. This activity threatens the integrity of real health-related phone calls and jeopardizes the relationship between the patient and their provider. Even more challenging than explaining to consumers that calls from your phone number are not always from your organization is the response time required. According to testimony by Dave Summit of the H. Lee Moffitt Cancer Center, in a 90-day period, they received over 6,600 external calls identified as a Moffitt internal phone number, requiring 65 hours of response time. This is time that could have been used to support the hospital rather than respond to fraudulent calls. The Hospital Robocall Protection Group will assist hospitals to combat these fraudulent robocalls so that they may focus on serving patients. A patient should not have to worry about whether or not they are speaking with their real provider when discussing sensitive health information, and providers should not have to deal with the disruptive false claims. I urge support of this amendment and look forward to the best practices being put forward by the Hospital Robocall Protection Group. And so I want to thank Representative Dingell for being willing to offer this amendment with me. And I yield back.
Is there any other member who wants to address? Yes. The gentlewoman from Florida.
Thank you, Mr. Chairman. It is vitally important that we tackle the bad robocall problem. Folks back home know that this is an issue, so this is very important that we're acting in a bipartisan way to do this. You cannot even trust the number that is calling you anymore. Robocalls have gotten so bad that people are just refusing to pick up the phone, right? You all are, you know it. It's happened to me, it's happened to everyone I know. The spoofing and the neighborhood spoofing also is preying on innocent people. In the Tampa area alone in 2018, there were 450 million robocalls. In Florida, just last month, or just in April of this year, 360 million robocalls. That's not right. You know, consumers are paying for telephone services, so they should be able to use them as intended. I want to thank Congressman Burgess and Congresswoman Dingell for bringing this amendment to help our hospitals back home, because in April, the Chief Information Security Officer from the H. Lee Moffitt Cancer and Research Institute in my hometown of Tampa testified in front of the Communications and Technology Subcommittee. He said that these unsolicited, fraudulent, and malicious robocalls are being directed to cancer patients in the hospital. And they're often spoofed as coming from the hospital to cancer patients. He also testified that the hospital personnel working on cancer research and taking care of patients are receiving thousands of calls that make it look like they're coming from inside the Cancer Institute as well. In that 90-day period, Moffitt Cancer Center received over 6,500 external calls identified as a Moffitt internal number, consuming enormous amounts of time that should be spent on taking care of cancer patients and the mission there. These robocalls are damaging, they're costly, they're time-consuming, so I want to thank Chairman Pallone and Ranking Member Walden and all of the members in this committee for working on this bipartisan legislation, which I am proud to co-sponsor. I urge that we pass this amendment, we get this bill to the House floor as quickly as possible. Thank you, and I yield back.
Thank you, Ms. Castor. Anyone on the Republican side want to speak on Dr. Burgess's amendment? Anybody at all on either side? All right. Oh, I'm sorry, Ms. Dingell.
Thank you, Mr. Chairman. I'm proud to co-sponsor this with my colleague, Mr. Burgess. I know he talked about the bill, but this bipartisan amendment, Protecting Patients and Doctors from Unlawful Robocalls Act, is going to help hospitals and patients combat the constant wave of robocalls that inundate patients' cell phones and hospital phone lines. And unless you've been sitting in a hospital or been with a patient, you don't know how bad it is. So there's something, as we're all going to talk about a lot today, we live with, but that relentless ringing of our phones prevents us from using them in the way they're intended to be used, to talk. Patients become afraid to answer the phones. And hospitals and patients are not immune, and in situations where seconds could make the difference between life and death, there can't be a delay due to robocallers or people afraid to answer the phone. This amendment will address that issue and complement the work the underlying bill does to mitigate robocalls across the board. It would put the FTC, voice service providers, companies focused on mitigating robocalls, and hospitals together to come up with solutions to this growing problem. So this amendment follows in the bipartisan path we've traveled with for the Stopping Bad Robocalls Act, and I urge my colleagues to adopt this amendment and support the underlying bill, and yield back the balance of my time.
Thank you. Does any other member seek recognition on this amendment? All right, then we're going to proceed to vote on the amendment. And again, this is Dr. Burgess's amendment. All those in favor of the amendment will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to. Are there any further amendments to this robocall bill? No? We thought there was one more, no? From whom?
Mr. Chairman,
Oh, Mr. Flores is recognized.
I have an amendment at the desk.
Does it have a number?
It's from Mr. McNerney and myself.
Oh, you have it, okay. You want to report the amendment for us?
Amendment to H.R. 3375 offered by Mr. Flores of Texas. and
Without
Mr. McNerney
objection,
of
the
California.
reading of the amendment will be dispensed with, and the gentleman, Mr. Flores, is recognized for 5 minutes.
Thank you, Mr. Chairman. Let me start by thanking you and Chairman Doyle and Republican leaders Walden and Latta for holding this markup and considering H.R. 3375 on a bipartisan basis. Everyone on this committee hears the frustration from their constituents about the scourge of illegal robocalls, and rightfully so. Consumers are estimated to receive 2.4 billion unwanted calls per month. Almost half of all cell phone calls over the next year will come from scammers that seek to illegally defraud everyday Americans. This is why I'm glad to co-sponsor this bill under consideration today, the Stopping Bad Robocalls Act. In terms of my amendment, I'm offering this amendment with Representative McNerney of California to increase penalties for perpetrators of illegal robocall operations. Make no mistake, these scammers intentionally seek to deceive consumers into handing over sensitive information to cause harm on everyday Americans. With our amendment, we will raise penalties for violations with intent from $1,500 per violation to $10,000 per violation, which is a more appropriate and robust penalty fit for the crime, and a monetary level to deter potential operators from entering into this illicit industry, which victimizes vulnerable Americans and harasses everybody. This bill, with the inclusion of our amendment, represents a strong step forward in giving enforcement agencies additional tools and authority to fight and ultimately end robocalls and allow consumers or constituents to once again trust their phone when it rings. I'm glad to support this bipartisan bill, which includes a combination of priorities from both sides of the aisle and will ultimately give consumers the tools they need at no additional cost, and it will establish regulatory flexibility for the FCC to continue fighting illegal robocall operations. I also want to thank Mr. McNerney for working with me on this and other important bipartisan issues in this committee. I urge my colleagues to support my amendment and to support the bill, and I yield back the balance of my time.
Thank the gentleman. Mr. McNerney?
Thank you, Mr. Chairman. I want to thank Mr. Flores for working with me on this amendment. Basically, we support the underlying bill, but we want to add a little more disincentive to robocall producers. Today, Californians and Americans are seeing more unwanted robocalls than ever before. This is something I do hear about from my constituents quite often. Right. More than 40% of these calls are illegal scams, and each scam on average costs the victim $430. So unwanted robocalls are annoying. They put consumers at risk. We are long overdue for putting a stop to them. From the perspective of consumers, it's often seems the best solution is just to not pick up the phone, and that threatens to make our phone system obsolete. Our amendment will create disincentives for the most egregious violators of the law. Creating these disincentives is critical for protecting consumers and stopping these abusive practices. That's why I'm proud to offer this amendment with my colleague, Mr. Flores. I urge my colleagues to support this bipartisan amendment and the underlying bipartisan bill. I yield back.
Thank the gentleman. Anyone else want to speak on the Flores amendment on the Republican side? Go to Mr. Sarbanes.
Just very briefly, I support the amendment, and this is really actually a critical amendment because a lot of these scam artists see the cost of doing this as just a cost of doing business. They're always trying to stay one step ahead of the law. They set up one operation, it gets shut down, they go to another operation. So if you increase the penalty on them, they may actually change their behavior in a meaningful way. So I want to thank my colleagues for the amendment. I yield back.
Thank you, Mr. Sarbanes. Anyone else on the Flores amendment? Okay, if not, we'll proceed to a vote on the Flores amendment. All those in favor will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the Flores amendment is agreed to. I think that's the last one. Are there any other amendments on this robocall bill? All right, then we'll proceed. Yes, the gentlewoman from California.
Mr. Chairman, I can't wait for this to pass, and when it does, I think we're going to hear applause from across America. So bravo to everyone involved in this. It's probably going to emerge as the most popular bill that we pass. But that speaks to the level of harassment and serious scamming that's taking place in our country. So let's go, let's pass it, let's get it to the floor, and I think that a lot of people are going to be very happy about this.
I thank the gentleman. I agree. I just got a call from Miami, which I didn't answer. And I mean, unless it's, Mario Lincoln or, one of the representatives. So I didn't answer it. I suspect it's a robocall. I know.
Raise the penalty.
All right. Anyone else? If not, we're going to proceed to a vote. Okay. The question now occurs on favorably reporting H.R. 3375 as amended to the House. All those in favor of reporting H.R. 3375 as amended will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. Oh, we want to have a recorded vote? Okay. Okay, so we do want to have a recorded vote.
Doesn't matter to me.
Do we? I guess the Democrats want to have a recorded vote. And you don't care, right?
You know they are.
I know. So recorded vote is ordered. Those in favor of reporting H.R. 3375 as amended to the House will say aye, and those opposed will say no, and the clerk shall call the roll.
Mr. Rush. Mr. Rush votes aye. Ms. Eshoo. Aye. Ms. Eshoo votes aye. Mr. Engel. Ms. DeGette. Ms. DeGette votes aye. Mr. Doyle. Mr. Doyle votes aye. Ms. Schakowsky. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes.
I vote for the Stopping Bad Robocalls Act.
Mr. Sarbanes votes aye. Mr. McNerney. Mr. McNerney, aye. Mr. Welch. Mr. Welch, aye. Mr. Lujan. Mr. Lujan, aye. Mr. Tonko. Ms. Clark. Mr. Loebsack. Mr. Loebsack, aye. Mr. Schrader. Mr. Kennedy. Mr. Kennedy, aye. Mr. Cardenas. Mr. Ruiz. Votes aye. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters, aye. Mrs. Dingell. Mrs. Dingell, aye. Mr. Vesey. Mr. Vesey, aye. Ms. Custer. Ms. Custer, aye. Ms. Kelly. Ms. Kelly, aye. Ms. Berrigan. Mr. McEachin. Mr. McEachin, aye. Ms. Blunt Rochester. Ms. Blunt Rochester, aye. Mr. Soto. Mr. Soto, aye. Mr. O'Halloran. Mr. O'Halloran, aye. Mr. Walsh. Mr. Walsh. Mr. Walden. Apologize. Mr. Walden, aye. Mr. Upton. Mr. Upton, aye. Mr. Shimkus. Mr. Burgess. Mr. Burgess, aye. Mr. Scalise. Mr. Latta. Mr. Latta, aye. Ms. Rogers. Mrs. Rogers, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Olson. Mr. Olson, aye. Mr. McKinley. Mr. McKinley, aye. Mr. Kinzinger. Mr. Griffith. Mr. Griffith, aye. Mr. Bilirakis. Mr. Johnson. Mr. Johnson, aye. Mr. Long.
Aye.
Mr. Long. Mr. Long, aye. Mr. Bouchon. Mr. Bouchon, aye. Mr. Flores. Mr. Flores, aye. Mrs. Brooks. Mrs. Brooks, aye. Mr. Mullen. Mr. Hudson. Mr. Wahlberg. Mr. Wahlberg, aye. Mr. Carter. Mr. Carter votes aye. Mr. Duncan. Mr. Duncan, aye. Mr. Giaforte. Mr. Giaforte, aye. Mr. Pallone. Mr. Pallone votes aye.
Are there any members who have not been recorded? I mean, we'll wait. Oh, Ms. Schakowsky?
Ms. Schakowsky votes aye.
Mr. Schrader?
Mr. Schrader votes aye.
Mr. Cardenas?
Mr. Cardenas, aye.
Mr. Tonko?
Mr. Tonko, aye.
On the, Mr. Shimkus?
Not recorded, Mr. Chairman.
You're not. Thank you. We'll wait for Mr. Scalise. Thank you. Anybody else who's not recorded while we wait? Mr. Scalise? Mr. Scalise votes aye.
Mr. Scalise, aye.
Thank you. Anyone else who's not recorded or who we expect and we should wait for? No? All right.
They checked in.
Okay, the clerk will report the tally.
Yes, sir. We have the vote, Mr. Chairman.
Yes.
Mr. Chairman, on that vote, the yeas were 47, the nays were 0.
Okay, thank you. The vote is 47 ayes to 0 noes, and so H.R. 3375 as amended is reported to the full House. All members shall have 2 additional days in which to file supplemental additional minority and dissenting views, and the chair does intend to file the report for the bill with the House on Friday. Excuse me?
Chairman, apologize. Apparently, the vote was 49 to 0.
All right, so let's change that.
Make that 49.
We'll vacate that previous vote, however that's accomplished, and we'll change it to say that the recorded vote on H.R. 3375 as amended is in fact 49 ayes to 0 noes. And that, again, the bill H.R. 3375 as amended is reported to the House with that changed vote. And again, I said all members shall have 2 additional days, and the chair intends to file the report with the House on Friday, this Friday. So now we're going to move to our second bill. The chair calls up H.R. 2211, the Stop Tip-Overs of Unstable Risky Dressers on Youth Act, or STURDY Act, as forwarded by the Subcommittee on Consumer Protections and Commerce on July 10th. These are the consumer protection bills, and the clerk will report the title of the bill.
H.R.
Committee come to order, and please, both members and our audience, please try to limit your remarks so we can hear each other. The clerk will report the bill H.R. 2211, the STURDY Act.
H.R. 2211, a bill to require the Consumer Product Safety Commission.
Without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. And it is open to amendment at any point. Are there any members seeking recognition to offer an amendment?
Mr. Chairman, I have a bipartisan amendment at the desk.
Ms. Rogers is recognized. What is your amendment labeled?
SLW 0034.
Clerk has that. All right. Clerk will report the amendment.
Amendment to the committee print to H.R. 2211 offered by Mrs. Rogers, page 2, line 9.
Without objection, the
Burt.
reading of the amendment by Ms. Rogers will be dispensed with, and the gentlewoman is recognized for 5 minutes.
Thank you, Mr. Chairman. I offer this bipartisan amendment with my colleague and chair of the Subcommittee on Consumer Protection and Commerce, Representative Schakowsky. This amendment makes 2 improvements to the underlying bill. First, the amendment further aligns the definition of clothing storage units to reflect the ASTM definition and clarifies that the standard covers freestanding furniture. Second, the amendment clarifies that the tests to be developed by CPSC are aligned with the CDC growth chart for 6-year-olds. We received testimony through this process highlighting the importance of clarity for the agency in developing the standards, as well as a growing consensus around setting 60 pounds as a metric that includes most 6-year-olds susceptible to tip-over related incidences. I'm pleased to offer and support this amendment. I thank the chair for continuing to work with me on this issue. I urge support for this amendment and yield back.
Thank you, Ms. Rogers. And again, I appreciate your and Ms. Schakowsky's work on these bills that protect children. Ms. Schakowsky, the Chairman Schakowsky is recognized for 5 minutes.
Thank you, Mr. Chairman. I appreciate Ranking Member Rogers working with me on this amendment, which further clarifies the intent of this bill and addresses concerns we have, as she stated. We have heard about the implementation and compliance. This amendment adopts the ASTM standard, which is really the industry standard definition of clothing storage units, and includes additional clarity that the Consumer Product Safety Commission safety rule is intended to address tip-over dangers from freestanding furniture. It further provides that the testing weight that these products must withstand is 60 pounds, which turns out to be the average weight of a 6-year-old child. There have been multiple fatalities of children over 5, and it makes no sense to only test up to 5 years old. And because some recent studies suggest that children are getting heavier, it allows for a higher weight to be tested if CDC updates its clinical growth charts. And so I just hope this clarification addresses the concerns that have been raised by the industry and consumers. And once again, I thank the ranking member for working with me in good faith to resolve these problems, and I yield back.
Thank the chairwoman. Are there any other members seeking recognition to speak on the Rogers Amendment? On either side? No? All right. So if there is no further debate, we'll proceed to a vote on the Rogers Amendment. All those in favor of the amendment will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there any further amendments to this bill? Seeing none, the question now occurs on favorably reporting H.R. 221 as amended to the House. All those in favor of reporting the bill as amended will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it. And H.R. 2211 as amended is reported to the full House. The next bill, this is in the series coming from the Consumer Protection Subcommittee. The next one is H.R. 3172, the Safe Sleep for Babies Act of 2019, is reported by the Subcommittee on Consumer Protection and Commerce on July 10th, and the clerk will report the title of the bill.
Committee print H.R. 3172, a bill to prohibit the manufacture, for sale, offer for sale, distribution in commerce.
Without objection,
or
the first
importation.
reading of the bill would be dispensed with, and the bill is now considered as read. and open for amendment. Are there any members who seek? Oh, Mr. Cardenas wants to strike the last word. The gentleman's recognized for that purpose.
Thank you. Thank you, Mr. Chairman. Appreciate this opportunity. Last month, I introduced H.R. 3172, the Safe Sleep for Babies Act, which bans the sale of inclined sleep products such as the Fisher-Price Rock and Play. I introduced this bill because babies have been dying, and that is unnecessary. This has been going on since 2009. At least 50 babies have died from these products. These deaths were avoidable. If companies had decided the safety and lives of babies were more important than profits, we might not be talking about this bill right now. If companies had listened to safe sleep recommendations from experts like the American Academy of Pediatrics or NIH or CDC, this product would not be available to the public. There have been a few recalls of inclined sleep products and accessories since I first spoke on the topic of the dangers of inclined sleepers just this past April. Fisher-Price recalled 4.7 million of its Rock and Play sleepers, and Kids 2 recalled 694,000 of their inclined sleepers. And I'm glad that some companies have finally stepped up and are taking action. And I'm glad the Consumer Product Safety Commission has finally acted to assist with these recalls. But our work here isn't done. Inclined sleepers like the Baby Delight, Evenflow, and Hiccapop are still on the store shelves. I urge CPSC to get these other inclined sleep products off the market. Otherwise, CPSC is sending the message that those products are safe, and that's why they remain on store shelves, while only some have been recalled. Because that's not the case at all. When grandparents like me walk into a store looking to buy something to spoil our grandbabies, or when people are buying baby shower gifts online, they assume that baby products are safe and can be trusted. They shouldn't have to worry that they might be buying something that could hurt or even kill the child. We need to help provide that certainty to Americans, and that's why we need this bill to remove the dangerous products off the shelves. I thank the chair and ranking member for holding this markup and bringing this important bill and others before the committee. And I thank my colleagues for their support. I hope my colleagues can feel proud that we're taking much needed action to protect babies from these kinds of products and to keep babies and families safe. With that, I yield back.
I thank the gentleman, and again, I appreciate your efforts in sponsoring this bill. I have to be honest. I think that when we go to the pearly gates, and you're going to have to say that you sponsored this bill, and then you go to heaven. I think that's how it works. Not that I know, but in any case, is any other member want to strike the last word on this bill? Okay. Anybody want to offer an amendment to the legislation? Okay, we don't have any amendments. The question now occurs on favorably reporting H.R. 3172 as amended to the House. All those in favor of reporting H.R. 3172 as amended? Well, it's not amended, is it? It is from the subcommittee. Oh, it's amended from the subcommittee, okay. All those in favor of reporting H.R. 3172 as amended to the House will signify by saying aye.
Aye.
All those opposed will say no. In the opinion of the chair, the ayes have it, and H.R. 3172 as amended is reported to the House. The next bill we have is H.R. 3170, the Safe Crib Act of 2019, is forwarded by the Subcommittee on Consumer Products and Commerce on July 10th, and the clerk will report the title of the bill.
Committee print to H.R. 3170, a bill to prohibit the manufacture for sale, offer for sale.
Without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. Are open for amendment. Is this one where we have amendments? No. All right, then who would like to speak? Ms. Schakowsky, you're the sponsor, recognized.
Just very, very briefly, this is the second bill that will make cribs safer for children. I want to thank Representative Cardenas for his legislation that would prohibit the sale, et cetera, of inclined sleepers. And this one would eliminate baby crib bumpers. I think a lot of people think they're soft and cozy and makes the bed more comfortable for children. Actually, children have died because of those. So this would prohibit the sale, distribution in commercial, in commerce of these crib bumpers. And I hope we can have the support, another bill that saves lives. Thank you. I yield back.
I thank the gentlewoman. Would anyone like to speak on this on the Republican side? If not, anybody else want to address this? All right. Then we're going to move to a vote. Question now occurs on favorably reporting H.R. 3170 as amended to the House. All those in favor of reporting the bill as amended will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and H.R. 3170 as amended is reported to the full House. Next, the chair calls up H.R. 1618, the Nicholas and Zachary Burt Carbon Monoxide Poisoning Prevention Act of 2019, again as forwarded by the Subcommittee on Consumer Protections and Commerce on July 10th, and clerk will report the title of the bill.
Committee print to H.R. 1618, a bill to encourage states to require the installation of residential carbon monoxide.
Objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. Open to amendment. Are we expecting amendments? No amendments. All right, no amendments are expected. Would any sponsor? Yes, Ms. Custer is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. Thank you,
Gentlewoman's
Chairman
recognized.
Pallone, for including my legislation as part of this markup. As a mother and an aunt, I know there's nothing more important than keeping our children and loved ones safe. From a young age, we tell children to look both ways before crossing the street, to wear a helmet while riding a bike or skiing, and to avoid talking to strangers. We go to great lengths to ensure that we protect our children from the dangers we can see, but there are some threats to their safety and well-being that can easily go undetected. Carbon monoxide poison is a stealthy killer. You cannot see it, smell it, or taste it. This deadly gas claims the lives of over 400 Americans each year and results in over 20,000 emergency room visits. Thankfully, we can keep children and our loved ones safe from carbon monoxide poisoning through education and by installing alarms in public places and homes. My bipartisan legislation, which I was proud to introduce with my friend Buddy Carter, does just that by creating a new grant program at the Consumer Product Safety Commission to support the installation of carbon monoxide alarms in low-income and elderly housing, provide training for firefighters to learn how to install alarms, and invest in educational programs to raise public awareness about the dangers of carbon monoxide. This legislation also incentivizes states to strengthen their own laws and require the installation of alarms in educational and child care facilities, lodging establishments, and other high-risk public places. This legislation will help save lives, and I urge my colleagues to support it, and I yield back.
Thank the gentlewoman from New Hampshire. Gentleman from Georgia is recognized.
Thank you, Mr. Chairman. I move to strike last word. Mr. Chairman, I rise in support of H.R. 1618, the Nicholas and Zachary Burt Carbon Monoxide Poisoning Prevention Act that was introduced with my friend from New Hampshire, Ms. Custer. This legislation comes in response to a growing number of carbon monoxide poisoning and deaths across the country. Each year, nearly 500 people die from carbon monoxide poisoning for a number of reasons. For instance, we see a rise in carbon monoxide poisonings in the wintertime when many people use alternative methods to heat their homes. Earlier this year, a family in my district was rushed to the hospital with carbon monoxide poisoning that is similar to these instances. This legislation would help to chip away at those numbers. It'll create a grant program that will assist states in helping install and monitor carbon monoxide detection systems that will help communities such as the elderly. This is a simple solution to a difficult problem. I support the underlying bill, and I urge my colleagues to do the same, and I yield back.
Thank the gentleman from Georgia. Any other member want to be recognized on this legislation? All right, we have no amendments, so we'll go right to the bill being reported. Question now occurs on favorably reporting H.R. 1618 as amended to the House. All those in favor of reporting H.R. 1618 as amended will signify by saying aye.
Aye.
All those opposed will signify by saying no. In the opinion of the chairs, the ayes have it, and as a consequence, H.R. 1618 as amended is reported to the full House. The next bill, the chair calls up H.R. 806, the Portable Fuel Container Safety Act of 2019. Again, it is forwarded by the Subcommittee on Consumer Protection and Commerce on July 10th, and the clerk will report the title of the bill.
Committee print on H.R. 806, a bill to require compliant flame mitigation devices to be
Without
used
objection, the first reading of the bill will be dispensed with. The bill is now considered as read. We expect any amendments on this? No? The sponsors? Nobody wants to speak? All right. Beautiful. Let's go to the vote. Question now occurs on favorably reporting H.R. 806 as amended to the House. All those in favor of reporting H.R. 806 as amended will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it, and H.R. 806 is, as amended, is reported to the full House. Now we go to H.R. 2647, the Safer Occupancy Furniture Flammability Act, or SOFFA. Clerk will report the title of that bill.
H.R. 2647, a bill to adopt a certain California flammability standard as a
Without
federal
objection, the
flammability.
first reading of the bill will be dispensed with. The bill is now considered as read. Are we expecting amendments? No. The ranking member is recognized.
I move strike the last word.
Gentleman is recognized.
Chairman Pallone and Chair Schakowsky, thank you for your work to get this to a bipartisan markup for the consumer protection and commerce bills. We appreciate that. While I agree the policy objectives of H.R. 2647 are important, I do continue to have concerns on our side of the aisle with the drafting of the legislation. Uniformity is critical for manufacturers and retailers who are balancing the previous calls for flame retardant furniture to address fire hazards with the increasingly unmanageable patchwork of state laws. The bill sets a state technical bulletin as a federal safety standard, which is an unprecedented approach to achieve uniformity. We're still learning about the specific concerns that have been raised by CPSC about their ability to even enforce the bill as it's currently drafted. So I am committed to working with you, our side is, and the rest of our colleagues on this bill moving forward, but we hope we can find a solution before the bill is considered on the House floor.
Will the gentleman yield?
Certainly.
I thank the ranking member for raising these issues. I know you share my desire to keep children, firefighters, and others safe from exposure to toxic chemicals, and I commit to working with you as we move to the floor to see if we can address your concerns.
Thank you, Mr. Chairman. I appreciate that. Finally, Mr. Chairman, if I could, I'd just like to recognize this is for all the members, this is the final Energy and Commerce markup for Melissa, our counsel on this subcommittee. She's served as the chief counsel on the Consumer Protection and Commerce Subcommittee the last 2 years. She's been an invaluable member of our team, as anybody who's worked with her knows, for more than 5 years, and in that time dedicated herself to public policy that addresses real problems for Americans, whether it was paving the way for self-driving vehicles, protecting the privacy and personal data of Americans, or strengthening product safety for consumers. A lot of the work we've put together out of this committee over the last number of years has resulted because of her diligent work in many of these areas. So while we'll certainly miss Melissa as she embarks on her next adventure, we know her future's bright. We thank you for your service, not only to this committee, but also to this great country of ours. And so, Melissa, thank you.
We also want to thank you, Melissa, as well. Thanks for all that you've done. No amendments. Any other members would like to speak on this bill? Seeing none.
Mr. Chairman,
Yes, Ms. Rogers.
I just want to say all the best to Melissa, too. I mean, she only lasted with me, I guess, 7 months, and then she was like, okay, I'm out of here. But
2 years with me. How many with you, Fred?
But she was extraordinary, and I just want to say, job well done. You shepherded through many of these bills that we just got passed in a bipartisan way, and wish you all the best. Thank you very much.
Thank you. I see Mr. Latta's hand is up.
Thanks, Mr. Chairman. Just a point of personal privilege here. I also want to thank Melissa because I tell you, in the last Congress, all the different bills that she worked on in the subcommittee with me, but also just to point out on the autonomous vehicle legislation, the subcommittee had over 300 meetings that they worked on and working with both sides of the aisle. So I just want to wish her all the best as she goes on to bigger and brighter things, but we're going to miss you.
Thank you. Anyone else want to comment? Yes, gentlemen.
Thank you,
Mr.
Mr.
Griffith?
Chairman. I do want to thank Ms. Matsui. We've worked on this issue for a number of years, and I appreciate her work on that and her working with me on that as well. And while I know there's some concerns, I also want to make sure I thank you, Mr. Chairman, and ranking members Walden and Rogers for continuing to work on it, because I'm hopeful that we can get the language worked out. We all have the policy in agreement, and it's harder to craft than one might expect. And with that, I will yield to the gentlelady, if I might, Mr. Chairman.
Thank you very much, my good partner. We do have some additional things to do, but it is good policy, and we'll certainly take care of it. I really appreciate working with you and the members of the committee and also the chairman and ranking member, and we'll move forward with this and hopefully get this through. Thank you. Yield back to you.
Mr. Griffith yields back. Anyone else want to comment on this bill? If not, we're going to go to move the bill to the House. The question now occurs on favorably reporting H.R. 2647 to the House. All those in favor of reporting the bill to the House will signify by saying aye. All those opposed will say no. In the opinion of the House, opinion of the chair, the ayes have it, and H.R. 2647 is reported to the full House. Next, now we're going to go to bills from the Energy Subcommittee. The chair calls up H.R. 1315, the Blue Collar to Green Collar Jobs Development Act of 2019. This is one of the Energy Subcommittee bills, and the clerk will report the title of the bill.
H.R. 1315, a bill to amend Title II of the Department of Energy Organization Act to reauthorize.
Without objection, the
office.
first reading of the bill will be dispensed with. The bill is now considered as read. Do we have amendments to this? All right, so we do have a amendment in the nature of a substitute from Mr. Rush, and I would recognize Mr. Rush to offer his amendment. What is it labeled?
I want to thank you, Mr. Chairman.
The bill is labeled Rush 047. Does the clerk have that?
Yes, sir.
Clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 1315 offered by Mr. Rush of Illinois. Strike all
Without
after-
objection, the reading of the amendment will be dispensed with, and now Mr. Rush is recognized for 5 minutes in support of his amendment. in support of his amendment.
Well, thank you, Mr. Chairman. Simply put, H.R. 1315 is a jobs bill designed to target and train underserved communities for the energy jobs and careers of the present and the future. Mr. Chairman, I first of all want to thank Ranking Member Upton and his fine staff for negotiating in good faith with my officers over the last few months to bring forth a bill that now enjoys widespread bipartisan support. And I also acknowledge the leadership of Mr. Hudson and his staff for working with my office on this bill and for being the lead Republican co-sponsor of the bill, both today and in previous Congresses. Mr. Chairman, the Green and Blue Collar Jobs Act will establish a comprehensive nationwide energy sector workforce development program to improve education and training for jobs in energy-related industries. Among other things, it encourages underrepresented groups, including religious and ethnic minorities, women, veterans, individuals with disabilities, socioeconomically disadvantaged individuals, unemployed energy workers, and returning citizens to enter into the science, technology, engineering, and mathematics, or STEM fields. The bill also requires DOE to provide direct assistance in the form of financial assistance awards, and technical expertise to minority-serving institutions, workforce development boards, nonprofits, labor organizations, and apprenticeship programs to help train these targeted candidates. In addition, H.R. 1315 establishes a grant program to provide assistance to these underserved applicants as they go through training in the renewable energy efficiency, grid modernization, carbon capture and storage, nuclear, cybersecurity, alternative energy, advanced automotive technologies, and fuel cell generation sectors. Mr. Chairman, this bill is a perfect example of what members of this committee can accomplish when we put politics aside, put our minds together, and we get to work on behalf of the American people. And I want to thank, Mr. Chairman, the minority side for working with my office in good faith. And with that, I yield back.
And gentlemen, yield to me just for
I want to yield to you.
a short period of time. I just want to thank you. I know you're always out front on trying to address these workforce issues, and particularly when we look at jobs of the future, I never think that the government is doing enough to train people. You know, I always get mad when I see all these companies that will, say, oh, well, I can't find an American to do the job, so I have to go overseas and they have to certify that there's no American who can do the job. And I know that may be true in certain cases. I'm not saying it's never true, but I'm always suspect of it because I know there's so many people right here in this country that if they had the proper training would be able to do the jobs that, some of the companies will say they can't find anybody. And so I think the government has an obligation to try to make a difference for, when we're going into new innovative fields, because this is the Committee of Innovation, and we should do our best to try to prepare people for jobs of the future in this innovative economy that we're always working to create. So I just want to thank the gentleman and also Mr. Upton and Congressman Hudson for coming together in a bipartisan fashion to draft this important bill.
Mr. Chairman, with that, I want to yield to my ranking member, my good friend, Mr. Upton, the balance of my time.
Well, thank you, Mr. Chairman. I want to just follow up on what Chairman Pallone indicated. We really appreciate both sides working together. I know Richard Hudson is not able to be here today. He's the lead co-sponsor of the Energy Workforce Bill, but I wanted to thank him and you for working on the manager's amendment. This amendment, I wanted to let all my colleagues know, reflects our efforts to ensure that the bill is fully inclusive of all those who are underrepresented in the energy industry, including women and certainly our veterans. The amendment also ensures that the bill is all of the above, supporting jobs across a wide range of energy industries. It's a great bill, which I'm pleased to co-sponsor myself. I look forward to working with the majority and the minority to get it through not only today in full committee, but also on the House floor and ultimately to the President's desk and signed into law. And again, appreciate your willingness to work with us again on an important issue that's dear to our hearts, and I yield back.
Mr. Rush,
I yield back the balance of my time, Mr. Chairman.
All right. I guess, is there any further discussion on Mr. Rush's amendment? Okay. If not, we will move to a vote on the amendment in the nature of a substitute introduced by Mr. Rush. All those in favor of the amendment in the nature of a substitute to H.R. 1315 will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 1315 is agreed to. Are there any other amendments? We're not expecting any. So we'll go to reporting the bill to the House. The question now occurs on agreeing to the measure H.R. 1315 as amended. All those in favor of agreeing to H.R. 1315 as amended will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and H.R. 1315 as amended is reported to the full House. And now we have another in this series of energy subcommittee bills. The chair calls up H.R. 2665, the Smart Energy and Water Efficiency Act of 2019, and the clerk will report the title of the bill.
H.R. 2665, a bill to direct the Secretary of Energy to establish a smart energy and water efficiency program and for the purposes.
Without objection, the first reading of the bill will be dispensed with. The bill is now considered as read. Expecting any amendments? Yes, Mr. Griffiths is recognized.
Mr. Chairman, I have an amendment at the desk.
Does the clerk have?
Griffith,
Yes, sir.
For Griff, Virginia, 30. Got it.
Amendment to H.R. 2665, offered by Mr. Griffith of Virginia. Page 4, beginning. On line 3, strike.
Without objection, the reading of the Griffith Amendment will be dispensed with, and Mr. Griffith is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. When we were discussing this bill in subcommittee, I realized that there might be something that we could do to tweak it, because I'd been talking with some folks at Virginia Tech who've been working on pipes and the soil samples around them and new technologies in that regard. And so I went to and asked Mr. McNerney, and he said fine. And so I want to thank Mr. McNerney and Mr. Kinziger for accepting this small change to the underlying bill. It was crafted with the help of the folks at Virginia Tech, which is in my district, so that we make sure we're getting things going on. They're doing great work in discovering innovative technology-based solutions to increase the efficiency of our water and wastewater systems. And I appreciate the sponsors and the chairman's support on this amendment, which they think is technical and clarifying. It just makes it so that there's more opportunities, and so that when the new technologies come along, we don't have to come back in and pass another bill. And with that, I yield back.
From Virginia for offering the amendment. I'm pleased to accept it. Is there any other member who seeks recognition on the Griffith Amendment? All right, and we're going to, someone else wants to speak? No?
Speak on the underlying bill.
You want to speak on the other? All right, well, let's do the amendment first, and then we'll. All right, is no further debate on the Griffith Amendment. We'll proceed to a vote. All those in favor of the amendment will signify by saying aye.
Aye.
All those opposed will say no. Opinion of the chair, the ayes have it, and the Griffith Amendment is agreed to. Is that the only amendment? All right, then we'll go to underlying bill, and Mr. McNerney wants to strike the last word on the underlying bill. Gentleman's recognized. Did I say your name wrong again? I'm sorry. All right, let me get it right. McNerney, right? I keep saying it wrong.
All right, thank you, Mr. Chairman.
It's my New Jersey accent.
It could be.
Maybe.
Well, you know, we're always looking for ways to improve energy efficiency. Water is one of the big opportunities we have. There's a huge nexus between water and energy, and anything we can do to increase efficiency with water will save energy. Anything we can do to improve energy will save water costs as well. So I thank my colleague, Mr. Kinzinger, for working with me on this issue, and I thank Mr. Griffith for his attempt to approve it. So we're all working together for the same thing. This bill aims to create an innovative water and energy resource management pilot program. Specifically, the bill will direct the Secretary of Energy to create a new federal pilot program to demonstrate innovative technology to increase and improve the efficiency of water, wastewater, and water reuse systems. It would also support the implementation of automated systems that provide real-time data on energy and water and assist in improving energy and water conservation, water quality, and predictive maintenance of energy and water systems through the use of internet-connected technologies. It's imperative that we update our water infrastructure to ensure a sustainable water future for our country. Folks, we're a long ways from that. We need a lot of work to do. This bipartisan piece puts us on the right path. I urge my fellow members to support this bill, and I'm going to yield the balance of my time to my colleague, Mr. Kinzinger.
Well, I thank the gentleman, and if you get something outrageous done to you, then to turn around and do an outrage, like call me Kinzinger, when it is Kinzinger, I will forgive it, Mr. Mack. So I want to thank my friend Jerry Mack for working with me on this legislation. The bill would establish a pilot program to demonstrate technology-based solutions to increase the energy efficiency of water, wastewater, and water reuse systems. And we were able to work together to craft this new bill in a way that it would not require any new funding. So I'm proud of this committee's bipartisan approach to enacting energy efficiency legislation, and I certainly hope it continues. So again, I urge my colleagues to support this legislation. I thank my friend, Mr. McNerney, and with that, I yield back to him.
Well, I already
Mr.
yielded the balance of
McNerney
my
yielding
time, so
back?
I'm going to yield it back to the chair.
All right, now I'm going to do this 3 times. McNerney, 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 Kinzinger, 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 like a zing. All right, Kinzinger, 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 and McNerney. All right, I'm trying. I'm sorry. Anybody else want to speak on this bill? All right, so the question now occurs on favorably reporting H.R. 2665 as amended to the House. All those in favor of reporting H.R. 2665 as amended to the House will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and H.R. 2665 as amended is reported to the full House. We have another energy bill. Chair calls up H.R. 2044, the Smart Building Acceleration Act. The clerk will report the title of the bill.
H.R. 2044, a bill to accelerate small building development and for other purposes.
Without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. We have amendments. Gentlemen, you want to strike the last word? All right, do we have any amendments? No. Okay, no amendments. The gentleman is recognized on the underlying bill.
I thank Chairman Poloni for the recognition. Mr. Chairman, the building sector uses about 40% of the energy in the nation. It's been incredibly challenging to increase energy efficiency in this sector for 2 reasons. First, buildings are designed to stand for decades, and individual owners have very little incentive to make energy efficiency improvements that yield benefits beyond their short-term ownership. And then secondly, builders and building owners usually do pass the cost of the energy bill onto their consumers or their tenants. So the owners have little incentive to make the energy efficiency improvements to reduce cost. What's happening with new technology, monitoring and control systems are enabling a transition of the building sector to smart buildings that have dramatically reduced energy use and improved the quality of service to the occupants. But despite the benefits of this technology, market awareness of smart buildings and adoption of these technologies is in its very early stages. And we've got to do more to accelerate this program. The federal government, incidentally, owns about 400,000 buildings, making it the largest landlord in the U.S., and it's uniquely positioned to study these questions and support the transition to more energy-efficient smart buildings. And the purpose of my bill with Mr. Kinzinger is to accelerate that transition by supporting research and by documenting the cost and benefits of emerging technologies in private sector and federal government buildings. Specifically, our bill requires the Secretary of Energy to conduct a survey of privately owned smart buildings evaluate which advanced building technologies in use are most cost-effective, and established an initiative at DOE to test the benefits of this technology in federal facilities. And the bill will improve the efficiency of our nation's buildings. I thank Mr. Kinzinger, of course, for his efforts and leadership on this bill, and I encourage all of our colleagues to support it. I yield the balance. I yield back.
Well, I think...
Or I yield to Mr. Kinzinger.
Thank you, and I thank the gentleman so much for his time and his work, and he's a good friend, and I thank you for your continued work on this and other legislation. This isn't the first time we've introduced this bill together, but hopefully it'll be the last, as we'd really like to get this over the finish line during this Congress, and we've come close a number of times. As my friend mentioned, this bill would accelerate the adoption of smart building technologies in the private sector and in key federal agencies, including the Department of Defense, the Department of Energy, to the Department of Veteran Affairs, and the General Services Administration. And even better, this would come at no cost to taxpayers, in fact, long-term savings. When opportunities come along to promote energy efficiency and innovation with little or no cost to the Treasury, we cannot let them pass us by. I urge my colleagues to support this legislation, and I yield back to the gentleman from Vermont.
Okay, we thank Mr. Welch and Mr. Kinzinger. Got it right. Mr. Griffith is recognized.
Strike the last word, Mr. Chairman. Thank you, Mr. Chairman. I appreciate it. The reason that the chairman thought there might be an amendment is I was working on an amendment that would piggyback on this bill that would, as long as we're working on smart buildings, would also make the buildings smart in a way that would protect so many of our birds, songbirds in particular. Estimates, which is just staggering, estimates are that up to 1 billion birds a year die flying into buildings. The numbers really are staggering. The lowest number is 100 million, and it goes up from there depending on which estimates you believe. I believe that would make it a smart building as well, to make sure that when we're building new buildings or we're renovating substantially buildings, that we put in what is really fairly cheap technology into the window that makes it so that the birds can actually say, wait a minute, that's not a place to fly, that's a barrier. And some of the technology may even be energy efficient because there's some ultraviolet things that you can do that humans don't see, but that birds do. So we're working on language. The other side of the aisle indicated that they wanted to try to tweak it a little bit. I was sliding it into the definition of smart buildings. I appreciate that help. I think, again, like we talked earlier on some other bills, this is one of those issues where I think we're all in agreement. We all want to do what we can. And we'll work forward, and hopefully by the time this gets to the floor, we'll have language that everybody can agree on. But I appreciate the bill, and I appreciate the opportunity to perhaps make it just a little bit better in a direction that will make the building smarter by protecting, or at least giving the birds an opportunity to recognize that's not a safe space to fly in. And
Will the gentleman yield?
I will yield.
Well, you are totally right. That is an incredible problem, and we've got to address it. I'm not sure we can do it on the fly, so to speak. So we will work with you to do that. But no, this is a huge problem, and Mr. Griffin, thanks so much for, bringing this to our attention, because we should be addressing that. Thank you. I yield.
Will the gentleman yield to me?
I will yield to the gentleman from New Jersey.
I want to support Mr. Griffith's efforts to protect and preserve our bird population, because identifying and promoting energy efficient, smart building is an important task for the government to perform, but identifying and promoting bird-safe buildings is also an important goal. And I know the gentleman considered offering an amendment on this issue, and I appreciate his willingness to withhold offering an amendment at this time. And I commit to working with him to try to achieve his goals of having buildings constructed in a way that is safer for birds. And I yield back to the gentleman.
Thank you, Mr. Chairman. I would just say that, I read one article that said, don't blame the cats, it's the buildings that are wiping out so many of our songbirds and making it harder for them to survive. Anyway, I yield back. Thank you.
Does anyone else, so we don't have an amendment in front of us, did anyone else want to speak on the underlying bill? If not, we'll proceed. The question now occurs on favorably reporting H.R. 2044 to the House. All those in favor of reporting H.R. 2444 to the House will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and H.R. 2044 is reported to the full House. We now have another energy bill from the Energy Subcommittee. The chair calls up H.R. 359, the Enhancing Grid Security Through Public-Private Partnerships Act, and the clerk will report the title of the bill.
H.R. 359, a bill to provide for certain programs and development in the Department of Energy concerning the cybersecurity and
Without objection,
vulnerability
the
of
first reading of the bill will be dispensed with. It's now considered as read. Do we expect an amendment on this? No? Would anybody like to speak on the underlying bill? Mr. McNerney.
Chairman, I move to strike the last word.
Gentleman is recognized.
Thank you. In today's cyber environment, it's more important than ever that Congress pursues policies to continue to support our grid infrastructure and secure it against potential physical and cyber threats. This is an issue I'm very passionate about. Any vulnerable component is a threat to our physical and national security, making it imperative that we invest in grid modernization and security. That's why I'm proud to co-chair this bipartisan Grid Innovation Caucus with my co-chair of the Grid Innovation Caucus, Mr. Latta of Ohio. Together, we focused on providing a forum for discussing solutions to the many challenges facing the grid and to educate members of Congress and staff about the importance of the electric grid with relation to the economy, energy security, and advanced technologies being utilized to enhance grid capabilities. The bill, which I've introduced along with Mr. Latta, assists us in this effort to bolster America's electrical infrastructure by encouraging coordination between the Department of Energy and the electric utilities. It accomplishes this by creating a program to enhance physical and cybersecurity of electric utilities through assessing security vulnerabilities, increasing cybersecurity training, and data collection. My bill would also require the interrupt cost estimate calculator, which is used to estimate and calculate the return on investment on utility investments to be updated at least every 2 years instead of the longer period that it is now. This will ensure more accurate calculations. So with that, I'm going to yield to my colleague, Mr. Latta.
Well, I appreciate the gentleman for yielding, and first I want to thank the gentleman for all of his hard work. I know that the two of us have worked on multiple pieces of legislation and also with the caucuses that we both chair, so I really appreciate your hard work on H.R. 359 and us, the two of us working on this, because again, as you mentioned, in this day of cybersecurity threats, this is going to help foster the public-private partnerships that we have to do to make sure that we have the cybersecurity for our grid. So with that, Mr. Chairman, I yield back to my friend.
Will the gentleman yield to me?
I'll yield to the chairman.
I just wanted to say a few words about the importance we have of these bills. We have 4 cybersecurity bills. This is the first of them that address the cyber and physical security of our energy infrastructure. And each one of these bills is completely nonpartisan and offers prudent steps we can take to protect our nation's energy infrastructure. It's important because members of the committee need to act in a unified manner if we're going to be successful in our efforts to understand, prevent, and mitigate security threats to the energy sector. In addition to Chairman Rush, I want to thank the bill's sponsors and also ranking members Walden and Upton for their work on all 4 bills, each of which reinforces the idea that the Department of Energy possesses the necessary expertise to address these issues. So I look forward to moving these bills today through the House and obviously ultimately to the Senate, to the President. And I yield back to Mr. McNerney.
Mr. Chairman, I yield back the balance of my time.
Just thank the gentleman. Does anyone else want to discuss Mr. McNerney's bill? All right, and so we will proceed to a vote. The question now occurs on favorably reporting H.R. 359 to the House. All those in favor of reporting H.R. 359 to the House will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chairs, the ayes have it, and H.R. 359 is reported to the House. The second of these cyber bills is H.R. 360, the Cyber Sense Act of 2019. Clerk will report the title of the bill.
H.R. 360, a bill to require the Secretary of Energy to establish a voluntary cyber sense program to test the
Without objection, the
cybersecurity.
first reading of the bill will be dispensed with. The bill is considered as read. Do we expect any amendments? No. Sponsors would like to address. Mr. Latta is recognized.
Thank you, Mr. Chairman. Strike the last word.
Gentleman's recognized for 5 minutes.
Well, thank you very much. I will not use that 5 minutes, but this is the second of the two bipartisan bills that the gentleman from California and I have introduced and worked on to improve the resiliency of our nation's energy grid against cyber attacks. I want to thank the chairman and the ranking member for holding today's markup to get these important bills passed by the House and over to the Senate to make sure that we are doing all we can to avoid cyber attacks in this country. So, and with that, Mr. Chairman,
Gentlemen.
my friend, I yield to my friend from California.
Well, I thank my friend from Ohio, and it's a pleasure to work with you on this one, and I like to see this move forward. As we mentioned before, cybersecurity is beginning to be, it's becoming a big issue. We need to make sure that we have protections in our grid and other of our critical infrastructure. This bill makes important headway in protecting our critical grid infrastructure. The CyberSense Act would create a program to identify cybersecure products for the bulk power grid through a testing and verification program. That way we'll have confidence that the parts we're using in our grid are secure. The bulk power system supports American industry and provides all the benefits of reliable electric power that the American people have come to rely upon. It's an essential fact that we make this system as secure as possible, as cyber attacks do pose a serious threat to our electric grid. We know that other countries, state actors are planning attacks on our grid, so we need to be as secure as we can. Any vulnerable component in our grid is a threat to our security, and this bill will go a long way to strengthening that system. Again, I want to thank Mr. Latta for his partnership in our efforts to co-chair the Bipartisan Grid Innovation Caucus, and look forward to continuing to work to ensure a more secure and resilient grid. And I yield back to my friend from Ohio.
And I yield back, Mr. Chairman.
I thank the gentleman. Anyone else would like to speak on the Latta bill, Latta-McNerney bill? Okay, we're going to proceed to the vote. The question now occurs on favorably reporting H.R. 360 to the House. All those in favor of reporting the bill to the House will signify by saying aye. Aye. All those opposed will say no. Opinion of the chair, the ayes have it, and H.R. 360 is reported to the full House. And now we go to the third cyber bill. Chair calls up H.R. 362, the Energy Emergency Leadership Act. The clerk will report the title of the bill.
H.R. 362, a bill to amend the Department of Energy Organization Act with respect
Without
to
objection, the
function.
first reading of the bill will be dispensed with. The bill is considered as read. Do we have an amendment to this? No. Any sponsor want to speak on this?
Yes,
Mr. Rush,
Chairman.
recognized for 5 minutes.
Mr. Chairman, I strongly support all four of the cybersecurity bills that's before us today, and each of them will help to address one of the most pressing issues we face, protecting our energy grid from those who might wish to do us harm. I would like to commend all of the sponsors and co-sponsors of these four cybersecurity bills that are being marked up today for their thoughtful attention to this critical issue. Mr. Chairman, I want to specifically acknowledge Mr. Wahlberg of Michigan for working with my office on the Energy Emergency Leadership Act. As you know, Mr. Chairman, this bill will establish a new DOE Assistant Secretary position with jurisdiction over all energy emergency and security functions related to energy supply, infrastructure, and cyber security. With all the focus on protecting our electric infrastructure, I believe that it is fitting and appropriate to elevate the person responsible for this task up to the Assistant Secretary level at the department. Mr. Chairman, this bill will also authorize the new Assistant Secretary to provide DOE technical assistance as well as support and response capabilities with respect to energy security risks to state, local, or tribal governments under request. Mr. Chairman, this bill will go a long way in helping to protect the nation's energy infrastructure from hackers who would attempt to disrupt our energy grid and cause untold harm to our economy, our daily lives, and to our overall national security. So I urge all of my colleagues to support this bipartisan bill. And with that, Mr. Chairman, I want to yield the balance of my time to my friend from Michigan, Mr. Wahlberg.
I thank the gentleman, and thank you, Mr. Chairman. As we all know, there is nothing more important than the security and integrity of our energy infrastructure. I commend the chairman for bringing up these bipartisan bills, which all highlight the critical role of the Department of Energy as the sector-specific agency for cybersecurity over the energy sector. Secretary Perry has taken leadership by establishing the Office of Cybersecurity, Energy Security, and Emergency Response, CSER, at the department to spearhead these efforts. As the sector-specific agency responsible for the bulk power system, the Department of Energy must be empowered to deal with the attacks our utilities face on a daily basis. Also critical to CSER's mission is energy security. Just this past weekend, a significant portion of New York City experienced a brief power outage. This office is critical for leading the interagency communication and response plans during these types of events. As such, we must elevate this important function into the department's core mission and make permanent the Senate-confirmed Assistant Secretary position for this function. This will better position the Department of Energy to work with their interagency partners to coordinate, plan, and respond to energy emergencies. I want to thank my friend and colleague, Chairman Rush, for working on this legislation with me, and I look forward to working with my colleagues to preserve energy and commerce jurisdiction over these functions and getting this bill across the finish line. I urge my colleagues to support, and I yield back.
Mr. Rush, are you? Thank you. I appreciate the comments by the gentleman from Michigan about our jurisdiction, which we're constantly fighting for. Are there any other members that would like to speak on this, on Mr. Rush's bill? If not, we're going to proceed to a vote. The question now occurs on favorably reporting H.R. 362 to the full House. All those in favor of reporting the bill to the House will signify by saying aye. Aye. All those opposed will say no. The opinion of the chair, the ayes have it, and H.R. 362 is reported to the House. And now we have our fourth cyber bill. The chair calls up H.R. 370, the Pipeline and LNG Facility Cybersecurity Preparedness Act. The clerk will report the title of the bill.
H.R. 370, a bill to require the Secretary of Energy to carry out a program relating to physical security and cybersecurity for pipelines and liquid.
Without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. Are we expecting any amendments? Sponsors like to comment on this?
Like the last word.
Upton is
Thank you, Mr.
recognized.
Chairman. So I just want to say that this bill, H.R. 370, which I reintroduced this year with Mr. Loebsack, will indeed strengthen the Department's ability to respond to physical and cyber threats to our nation's pipeline and its LNG facilities. You know, Russian agents and other nation states are waging cyber war on our energy infrastructure wherever they can find a weakness. And as the sector-specific agency for energy, DOE has to have a stronger lead role to protect our nation from those threats. And to help address these threats, this bill would, A, require that the Secretary carry out a program to coordinate federal agencies, states, and the energy sector to ensure the security, resiliency, and survivability of natural gas pipelines, hazardous liquid pipelines, and LNG facilities. B, it's going to authorize DOE to coordinate response and recovery to physical and cyber incidents impacting the energy sector and develop advanced cybersecurity applications and technologies. And C, it's going to allow DOE to perform pilot demonstration projects and develop workforce development curricula relating to physical and cybersecurity to help the energy sector evaluate, prioritize, and improve physical and cybersecurity capabilities. The bill is not a regulatory program. It simply strengthens the department's ability to coordinate cyber response, collaborate, and build capacity within states and the energy sector. Other agencies like the TSA have a role to play when it comes to cybersecurity for pipelines, but DOE has the core responsibility over energy infrastructure to ensure the reliable supply and delivery of energy against all hazards, and that's why we need to pass this bill. I look forward to continuing bipartisan support and urge all my colleagues to support it and yield back.
Gentlemen, thank the gentleman. The gentleman from Iowa wants.
Move to strike last word.
Gentleman is recognized.
Thank you, Chairman Rush and Pallone, and ranking members Upton and Walden for your leadership on these issues. This committee has worked hard across the aisle to advance legislation that will improve the cybersecurity of our nation's energy infrastructure, and this legislation, I think, is a critical piece of the puzzle. The Pipeline and LNG Facility Cybersecurity Preparedness Act, which I'm proud to have introduced with my colleague, Ranking Member Upton, will strengthen the Department of Energy's role in coordinating and information sharing with other federal agencies, states, and the energy sector to improve our nation's physical and cyber pipeline security. We know that cyber attacks are a near constant and increasingly dangerous threat to our energy infrastructure. As the Director of National Intelligence noted in his worldwide threat assessment earlier this year, and I quote, China has the ability to launch cyber attacks that cause localized temporary disruptive effects on critical infrastructure, such as disruption of a natural gas pipeline for days to weeks in the United States, unquote. Clearly, the threat to our nation's energy security is an immediate concern, and we cannot wait to act. This legislation will be an important step toward ensuring that we are prepared in both the public and private sectors to not only prevent, but also respond and quickly recover from cyber incidents. I'm pleased that the committee is acting to advance this and other critical legislation for our nation's energy cybersecurity, and I yield back.
Thank the gentleman. Anyone else want to speak on the Upton bill? Seeing none, we go to the vote. The question now occurs on favorably reporting H.R. 370 to the House. All those in favor of reporting the bill to the House will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it, and H.R. 370 is reported to the full House. And now we have another energy efficiency bill. The chair calls up H.R. 2088, a bill to amend the Energy Independence and Security Act of 2007 to reauthorize the energy efficiency and conservation block grants as forwarded by the Subcommittee of Energy on May 16th. The clerk will report the title of the bill.
Committee print to H.R. 2088, a bill to amend the Energy Independence and Security Act of 2007.
Without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. Do we expect amendments to this? We have an amendment. The gentleman, Mr. Bouchon, is recognized for his amendment.
Mr. Chairman, I have an amendment at the desk.
And that amendment, you have a number for it? Does the clerk have
I
it?
think it's the only one for the, should be the only one for this bill.
She has it. The clerk will report the amendment.
Amendment to H.R. 2088 offered by Mr. Bouchon.
Without
At the end of the
objection,
bill.
without objection, the reading of the Bouchon amendment will be dispensed with, and the gentleman from Indiana is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. H.R. 2088 authorizes a staggering $17.5 billion over 5 years to resurrect a one-time Obama-era stimulus program that faced significant challenges. To put this magnitude of spending in context, the original block grant program was provided a one-time appropriation of $3.2 billion. Both GAO and the Inspector General have raised concerns about the implementation of the program and the management of projects. Congress has wisely declined to provide additional funds for this program, and the DOE has shifted its priorities to support high-impact, early-stage applied R&D activities
and to encourage the private sector to fund the commercialization of energy-efficient technologies. Last year, DOE's Office of Energy Efficiency and Renewable Energy received almost $2.5 billion to support its work across a wide range of energy technologies to improve the energy efficiency of our homes, buildings, and industries. In addition, DOE's vast mission supports hundreds of millions of dollars in spending across the department and the national labs. My amendment is very straightforward. First, it would ensure that the underlying legislation incorporates lessons learned from the Obama-era stimulus block grant program. Simply put, we shouldn't rush to resurrect this program, especially given the track record. What the amendment says is the bill cannot go into effect until the DOE submits an evaluation of the CBGP program and the recommended reforms, and the DOE must certify the bill will not be duplicative of any existing DOE programs and will ensure the proper stewardship of the taxpayer dollars. The amendment will not kill a bill or slow it down. I encourage everyone on the committee to join me in supporting my amendment, and I yield back.
I thank the gentleman, and I now recognize myself for 5 minutes in opposition to the Bouchon amendment. I appreciate the desire to be good stewards of taxpayer dollars, as the gentleman's amendment suggests, but this request that DOE do a report evaluating this block grant program, I think, is duplicative, and it itself would become a misuse of taxpayer resources. The amendment gives DOE an infinite amount of time to submit the suggested report. If DOE elects to delay the report, the effect is delaying the grant program, and that's a non-starter for me. We already have 2 reports evaluating this program, one conducted by GAO on the implementation of the program, and another independent evaluation of its accomplishments commissioned by DOE and conducted by the firm DNVGL. GOA actually made some recommendations to DOE about improving program administration, but the report did not identify any fatal flaws in the program. GAO's report shows we can make the process more effective this time around, and that could be said of virtually any program. DOE is capable of fixing all of the issues raised in the 2011 report and administering a successful program. Ironically, the only mention of duplication in the GAO report is with respect to the reporting requirements of the program, and the Recovery Act required transparency and accountability for the funds delivered, and the Act's reporting requirements at times overlap with those of the existing programs funded through it. The second report, the independent evaluation report completed in 2015 by DNVGL, reflects one of the GAO's recommendations that the DOE solicit information to evaluate the energy-related impacts of recipients' use of the funds. And so what did DNVGL find? They found that the program produced energy savings of $5.2 billion on energy bills, 70% of which were realized by residential customers. It also produced more than 62,000 net job gains, and it avoided 25.7 million metric tons of carbon pollution. So again, in my opinion, the program is a win-win. I mean, it saves energy, it reduces costs, it produces jobs, and it also reduces carbon pollution. So I think if you want to seriously tackle the climate crisis, you should really reject this amendment and support the bill. States, territories, tribal organizations, and local governments across the country already are engaged in doing their part to reduce carbon pollution. The federal government should support their efforts, and the Energy Efficiency and Conservation Block Grant Program is an excellent way to do that. So I would urge my colleagues to oppose the amendment and to support the underlying bill. Does anyone on the Republican side want to comment on the Bouchon amendment? Anybody on the Democratic? Oh, Mr. Veazey is recognized.
Thank you, Mr. Chairman. I'd like to thank you for recognizing me in opposition to this amendment. And I appreciate the amendment offered by my colleague, and I think that it's great that we have a discussion about the impact of the legislation that we pass on this committee, but I think that the benefits that have been laid out by the chair are very apparent. And I have before me here 4 different reports on this program, including one from the Department of Energy on the GAO. These reports detail the successes of the program as well as the challenges DOE faced when implementing a brand new initiative. In fact, as a result of these reports and their findings, DOE is better prepared to administer the program. Furthermore, the amendment seeks to ensure proper stewardship of taxpayers' dollars. This is a fantastic goal, and in fact, this is one of the main objectives of the bill. By deploying energy-efficient devices in local government buildings, we will be saving taxpayer money by reducing their energy bills. According to an analysis prepared by the Oak Ridge National Laboratory, the program produced $5.2 billion of total cumulative savings on energy bills for the public. Finally, I would like to point out that this amendment does not include a timeline for when the DOE must submit the report to Congress, leaving open the possibility that the amendment is never submitted. It is for those reasons I ask that my colleagues join me in voting down this amendment and advancing the Energy Efficiency Conservation Block Grant Program. And Mr. Chairman, I also have a list too of Democrats and Republicans in the Texas delegation, many on this committee actually, that their mayors love this program and have benefited from it immensely. I yield back.
Does the gentleman ask unanimous consent to submit that for the record?
Yes, I ask unanimous consent to submit that for the record.
Without objection, so ordered. Are there any other members seeking recognition to speak on the Bouchon amendment? Okay. If there's no further debate, we'll proceed to a vote on the gentleman from Indiana's amendment. All those in favor of the amendment will signify by saying aye. All those opposed will say no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to. Are there further amendments to the underlying bill? Are there any members who would like to speak on the underlying bill? Yes, the gentleman, Mr. Bouchon, is recognized.
Thank you, Mr. Chairman. H.R. 2088 reauthorizes at $3.5 billion per year for 5 years the Energy Efficiency and Conservation Block Grant Program at DOE, which expired in 2012. It also explicitly authorizes funding to deploy infrastructure for alternative fuels, including electricity. There are two concerns I have with the bill: its $3.5 billion per year funding level, and the lack of information to justify that block grants are the best policy approach to achieve the goals of the bill without duplicating other federal, local, or private initiatives. Despite the April 10th legislative hearing, there actually has been no committee evaluation of the program, no assessment of alternative approaches, or whether it would be duplicative of other programs and be executed in a way that protects taxpayer interests. The only time the program was funded in the last 12 years was under President Obama's 2009 stimulus spending package, which was one-time funding of $3.2 billion over 3 years, and that was not fully expended. GAO and DOE Inspector General information at the time of the program raised questions about the fiscal management, whether funds achieved what was promised in some cases, and we should look more closely at that information. Would this program duplicate other programs? How does this work with the DOE Better Buildings Initiative or its Clean Cities program? The bill explicitly expands eligibility at state, local, and tribal entities to fund alternative fuel infrastructure, including electricity. What are the barriers to that infrastructure now, and why is this the program to address that? At both the legislative hearing and the subcommittee markup, Republicans expressed a desire to evaluate the success of the original program before rushing to reauthorize it. Ultimately, that hasn't happened. As it is, without better information, I cannot support the bill and would urge a no vote. I yield back.
Gentleman yields back. I just want to recognize myself in support of the underlying bill. I want to thank the Conference of Mayors for their support of this bill, and the main sponsor of it is Congressman Stanton from Phoenix, who I believe was the mayor of Phoenix before he was elected to Congress, and of course Mr. Veazey is our committee sponsor. But I also wanted to thank Mayor Brian Waller of Piscataway, New Jersey, in my district, who joined us here in May to testify to the importance of this program. State and local governments are the ones truly at the forefront of addressing the climate crisis, and they're stepping up to the plate to fill the vacuum left by the president. As you know, he still wants us to withdraw from the Paris Climate Agreement, which obviously I don't support, and I don't support the withdrawal. We should be supporting the efforts of local leaders to address climate change, and that's exactly what the Energy Efficiency and Conservation Block Grant Program does. In fact, the last time we funded the program, my colleagues across the aisle were allocated over $112 million cumulatively in their districts. And at the local level, this is not a partisan issue, and quite frankly, it shouldn't be. I know Mr. Bouchon is not saying necessarily opposes it. He just wants some safeguards, but we've already talked about that. I think that we can create new jobs, improve the environment, and make our communities safer and more resilient to climate changes that we can't avoid with this bill. I think it's a win-win. So I would urge my colleagues to support the underlying bill, and I would yield back. Is there anyone else on the Republican side that wants to speak on this, or anyone at all who wants to speak on it? Okay, so we're going to go to the underlying bill. The question now occurs on favorably reporting H.R. 2088 as amended to the House. All those in favor of reporting the bill as amended to the House will signify by saying aye. All those opposed will say no. No. The opinion of the chair, the ayes have it, and H.R. 2088 as amended is reported to the full House. What's next? This is the weatherization bill. The chair calls up H.R. 2041, the Weatherization Enhancement and Local Energy Efficiency Investment and Accountability Act. The clerk will report the title of the bill.
H.R. 2041, a bill to reauthorize the Weatherization Assistance Program and for
Without
other
objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. Are we expecting any amendments to this?
Yeah.
We'll start with Mr. Tonko, who has a manager's amendment. What's that labeled? Clerk has it.
Yes, sir.
Clerk will
Amendment to H.R. 2041 offered by Mr. Tonko and Mr. Upton. Beginning
Without
on page
objection,
1.
the reading of the amendment will be dispensed with, and Mr. Tonko is recognized for 5 minutes and speak to support his amendment.
Thank you, Mr. Chairman, and I want to thank you and Chairman Rush for including H.R. 2041 in today's markup. And I do also thank Mr. Upton and our colleagues for, on the other side of the aisle, for being willing to work with us on this amendment to ensure strong bipartisan support for what I believe is a very important bill. Because at the end of the day, it is important that we understand the merits of DOE's Weatherization Assistance Program. Our colleagues on the Senate Energy and Natural Resources Committee have just advanced the bipartisan companion measure out of committee yesterday. So I am indeed hopeful that this program might actually have a shot of being reauthorized during this 116th session of Congress. For over 40 years, DOE's Weatherization Assistance Program has been helping our most vulnerable neighbors, the poor, the elderly, and the disabled, to reduce their utility bills and make their homes healthier and much more energy efficient. Small investments in these homes can have a major impact. DOE estimates an average annual cost savings of $283 per home, which can be a big deal for people struggling to make ends meet. This bill would reauthorize and modernize the program. It has support from a wide range of stakeholders, including state energy officials, home performance contractors, efficiency advocates, and manufacturers of energy-efficient materials. This amendment makes a few minor changes in response to technical assistance provided by the Department of Energy. It also requires subgrantees to provide annual reports on the number of multifamily housing units weatherized under the program. I think we should be encouraging more work on these types of homes and hope we can give their unique circumstances additional consideration as we move forward. The amendment also responds to two requests from our Republican colleagues. First, it slightly decreases the underlying bill's authorizations for the program's first 3 fiscal years. The fiscal year 20 level would be identical to the recently passed House Energy and Water Appropriations Bill and would gradually increase to the target level of $350 million in years 4 and 5 of the authorization. In my view, weatherization is a cost-effective program that could handle significantly greater funding, but I understand the argument that funding is more likely to ramp up gradually in the near term. Second, the amendment would institute a sunset for the new Innovation Competitive Grant Program. This would give us an opportunity to evaluate the success of this new set-aside and determine whether it should continue in the future. So I am, again, very grateful to Mr. Upton and our Republican colleagues for being willing to work toward agreement on this effort, because I truly believe that weatherization is not just an important program. It is a good program. It helps our constituents who need it the most. In fact, when we look at the amount of energy cost impact on poor households, it's far more significant than that on average households. I encourage the members of this committee to support this amendment and the bill. And with that, Mr. Chair, I yield
Will the
back.
gentleman yield? Will the gentleman yield?
Yes, sir.
I just, thank you, and I just want to again reiterate my appreciation for working with us on our side. We had a lot of good discussions. You outlined exactly what the bill does. And it is a good bill. We care about the folks that this is going to impact in a meaningful way, and we truly made it bipartisan. I just want to thank you for that, and the staff again on both sides worked very hard, and we came to an agreement that I'm very proud of, and certainly that's why I put my name on it. Thank you, and look forward to seeing it get to the president's desk.
Thank you, and I yield back.
So we have the Tonko Manager's Amendment before us. We're going to vote on that. Anyone else want to address that amendment? If not, there's no further debate. We'll proceed to a vote. All those in favor of the Tonko Amendment will signify by saying aye.
Aye.
All those opposed will say no. Opinion of the chair is the ayes have it, and the amendment is agreed to. Are there? We have Mr. Rush. You have an amendment.
Mr. Chairman, I have an amendment at the desk.
And how is that labeled?
Rush 46.
Clerk has it. The clerk will report the amendment.
Amendment to H.R. 2041 offered by Mr. Rush of Illinois. Page
And
4.
without objection, the reading of the Rush amendment will be dispensed with, and Mr. Rush is recognized for 5 minutes.
Well, thank you, Mr. Chairman. Mr. Chairman, my amendment is consistent with the objective of my workforce bill in that it targets training for underrepresented groups in the weatherization program. The Rush Amendment encourages any entity receiving the funding from the federal government or from a state weatherization program to prioritize the hiring and retention of local candidates who are from the community that the program serves and who are members of underserved groups within the home energy performance workforce. Specifically, Mr. Chairman, my amendment would target training for religious and ethnic minorities, women, veterans, individuals with disabilities, and individuals who are socioeconomically disadvantaged. Mr. Chairman, now more than ever, it is important that Congress send the message that those who have been historically marginalized and overlooked by the system who are not forgotten by their representatives here in Washington. And not only do we value and appreciate them, but we are actively working to address their concerns and work on behalf of their interests. So it is my intention, Mr. Chairman, that any organization that receives taxpayers' money will work to actively include these individuals and train them for these good paying jobs and careers of retrofitting homes right in their own communities. Mr. Chairman, I view this amendment as enacting a concept that is long overdue, and I hope that my colleagues on both sides of the aisle will support it. We can no longer afford to continue doing business as usual when so many Americans are feeling like they are being diminished, ignored, or outright assaulted. I urge all of my colleagues to support this amendment, which will give many of our fellow citizens a lifeline to be productive and valued members of our society. And with that, I yield back the balance of my time.
Thank you, Mr. Rush. Does anyone else want to speak on the Rush amendment? Okay, hearing none, we'll move to a vote on the amendment. All those in favor of the Rush amendment will signify by saying aye. All those opposed will say no. Opinion of the chair is the ayes have it. The amendment is agreed to. I think that was the only other amendment, right? Now, would anyone like to speak on the underlying Tonko bill? I'm going to recognize myself. I want to thank Mr. Tonko and our other colleagues for their hard work on this bill. The weatherization program provides much-needed assistance to families that would otherwise be unable to afford making energy efficiency improvements to their homes. In addition to lowering energy costs, these improvements create local jobs and spur demand for energy-efficient products provided by local businesses. And I've been encouraged to hear our Republican colleagues state their efforts to tackle the climate crisis. This is one of the ways we can do that, but still create jobs and save energy and support our constituents by helping them to make their homes more comfortable and affordable. These are the types of solutions that we need. They pay for themselves over time, and they're the key to lowering carbon pollution. Buildings account for significant carbon pollution. Much of that is associated with the energy we use for heating and cooling. So lowering energy use in buildings will improve the climate both inside and outside. Representative Tonko has been a supporter of this program for many years, and I know he's worked with the advocacy community to improve the program and to ensure it's adequately funded. And businesses have invested to improve appliance efficiency and to develop new building materials to make homes and buildings more energy efficient, healthier, and more comfortable. So programs like these ensure that these new products and technologies are available and affordable to everyone. So I urge my colleagues to support the bill. Does anyone else want to talk about the bill? If not, the question now occurs on favorably reporting H.R. 2041 as amended to the House. All those in favor will signify by saying aye. Aye. All those opposed will say no. The opinion of the chair is the ayes have it, and H.R. 2041 as amended is reported to the full House. We have another energy bill. Chair calls up H.R. 2119, a bill to amend the Energy Policy Act of 2005 to reauthorize grants for improving the energy efficiency of public buildings. The clerk will report the title.
H.R. 2119, a bill to amend the Energy Policy Act of 2005.
Without objection, the first reading of the bill is dispensed with. The bill is now considered as read. Do we expect any amendments? The gentlewoman from Illinois is recognized for an amendment.
Mr. Chairman, I have an amendment at the desk.
Do we have it, Madam Clerk? We do.
Amendment?
Yes, proceed.
Amendment to H.R. 2119 offered by Ms. Kelly. Strike Section 1 and insert the
Without
following.
objection, the reading of the Kelly amendment will be dispensed with, and the gentlewoman from Illinois is recognized for 5 minutes.
Thank you, Mr. Chairman. My amendment would expand on the underlying bill, which expands and reauthorizes a federal program to help municipalities in building and updating energy-efficient buildings. Municipal energy efficiency is a win-win. It saves taxpayers money while investing in green-collar jobs. My amendment simply incorporates recognized energy efficiency standards and would add a benchmarking requirement to ensure the standards, goals, and metrics of the bill translate to energy efficiency. Quite simply, there's no sense in throwing good money after bad. Along those lines, the amendment would require third-party verification of energy efficiency improvements in each building. Lastly, the amendment would ensure the payment of prevailing local wages for jobs performed pursuant to the underlying grants. This amendment was drafted after consultation with various stakeholders. It improves the underlying bill by creating important auditing provisions and ensures labor rights are protected. I encourage all members to support the amendment and the underlying bill. I yield back.
Will the gentlewoman yield to me?
Yes, I will.
I just wanted to urge my colleagues to support the gentlewoman's amendment and also the underlying bill. This bill helps states improve the energy efficiency of public buildings and facilities by providing grants to states for the renovation of existing public buildings to reduce energy use or the construction of new energy-efficient buildings. And public buildings consume a large amount of energy, and this bill will help put a dent in that consumption. The bill will lower utility costs for local communities and help mitigate the crisis of global climate change by reducing carbon pollution. And I also support the gentlewoman's amendment because it includes the important provision to ensure workers employed to do this work are paid the living wage they deserve. So I want to thank her for both the amendment and the underlying bill, and yield back to the gentlewoman. Gentlewoman yields back. Are there any?
Mr. Chairman, I move strike last word.
Mr. Flores in opposition to the amendment, I assume?
I am in opposition. Thank you, Chairman Pallone. This bill has similar problems as H.R. 2088. It essentially spends money that has not been requested in the past. This bill reauthorizes an expired program for energy-efficient buildings from the Energy Policy Act of 2005. And this is the important issue here. This program has never been funded. It hasn't been used through the past 3 administrations. The Department of Energy confirmed to committee staff that this has never received funding, and we find no evidence that a past administration has ever even asked for funding. There was a statement earlier about throwing good money after bad. We're throwing good money after something that's never been funded before. Beyond reauthorizing programs never been used, the bill would increase the authorization level from an initial $30 million per year to $100 million per year for 5 years. There are numerous other energy efficiency support programs at the department and at other agencies like Housing and Urban Development. And without a better accounting of all the taxpayer funds that go to assist new and existing building efficiency projects, it's difficult to see why we should resurrect this unused program. So without better information or a more complete picture, the committee should not support this bill, and we should work to get a full accounting of all the efficiency programs available to assist public buildings. I urge a no vote on the amendment because it doesn't solve the problems with the underlying bill, and I also urge a no vote on the bill. I yield back the balance of my time.
Does anyone else want to speak on the Kelly amendment? All right, then we're going to go to a vote on that amendment. All those in favor of the Kelly amendment will signify by saying aye. Aye. All those opposed will say no. No. Opinion of the chair, the ayes have it, and the amendment is agreed to. Do we have any further amendments? No? All right. Does anyone want to speak on the underlying bill? For or against? No. So the question now occurs on favorably reporting H.R. 2119 to the House. All those in favor of reporting the bill to the House will signify by saying aye. Aye. All those opposed will say no. Opinion of the chair is the ayes have it, and H.R. 2119 is reported to the full House. I'm sorry, H.R. 2119 as amended is reported to the full House. And now we go, now we're going to go to the health bills, okay? So now we start with the health bills. The chair calls up H.R. 2781, the Empower for Health Act, as forwarded by the Subcommittee on Health on July 11th. The clerk will report the title of the bill.
Committee print to H.R. 2781, a bill to amend Title VII of the Public Health Service Act.
Without objection, the first reading of the bill will be dispensed with. The bill is now considered as read. Can we have less talk in the back here? Gentlemen or ladies? Seems like it's mostly the gentlemen. All right, without objection, the first reading of the bill will be dispensed with. The bill is now considered as read. Do we have any amendments to this bill?
We do, right?
The gentlewoman from Illinois is recognized.
Thank you, Mr. Chairman. Dr. Burgess and I have an amendment at the desk to H.R. 2781, the Empower for Health Act that we introduced in May. So,
The clerk has the amendment.
Amendment 1? Do you have that Amendment 1 to this bill?
Yes, I have it.
Clerk will report the amendment.
Amendment to H.R. 2781 offered by Ms. Schakowsky.
Without objection, the reading of the amendment is dispensed with, and the gentlewoman from Illinois is recognized for 5 minutes.
Thank you. Upon consulting with the Health Resources and Services Administration and relevant stakeholders, we are offering this amendment to clarify Section 4 of our bill, which invites the pediatric health care, which invests in the pediatric health care workforce. This amendment ensures this section of the bill will particularly impact regions of the nation in which there is a shortage of pediatric medical specialists, pediatric surgeons, surgical subspecialties, child and adolescent psychiatric, and child and adolescent mental and behavioral health professionals. So I encourage all of my colleagues to vote for this important technical but important addition to the bill. This is a technical amendment. And I yield back.
We have the Schakowsky amendment. Does anyone else want to speak on that? No? So we'll move to the Schakowsky amendment. All those in favor of her amendment will signify by saying aye.
Aye.
All those opposed will say no. Opinion of the chair, the ayes have it, and the Schakowsky amendment is agreed to. Are there any other amendments to the Empower for Health Act? All right. Anyone want to speak on the underlying bill? Yes, Ms. Rogers is recognized.
Mr. Chairman, I move to strike the last word. I'm proud to have joined my colleague, Mr. Rush, in supporting a more diverse workforce in the fields of occupational therapy, physical therapy, speech-language pathology, and audiology by co-leading the Allied Workforce Diversity Act. I've seen firsthand the benefit of these programs in helping people to live more full and independent lives. When people from underserved areas go into these fields, they're more likely to serve in underserved or rural communities. This legislation will help better serve Eastern Washington and the people who rely on these allied health professionals. I urge adoption of this amendment and the underlying bill and yield back the balance of my time.
Thank you. Anyone else want to speak on the underlying bill? Ms. Schakowsky?
Thank you, Mr. Chairman. I move to strike the last word. I'm really excited that this committee is moving toward advancing the Empower for Health Act, which I, along with, Dr. Burgess and I introduced in May. Research suggests that by 2030, the United States may see a shortage of up to 122,000 physicians. But we actually already have a significant physician shortage today. If healthcare access were equitable across race, social, economic status, and geography, then we would see that the United States needs almost 100,000 more doctors right now. With the increasing population and a growth in the aging population, the demand for physicians continues to rise faster than the supply. This bill will spur growth in our healthcare workforce by reauthorizing several Title VII health professional education and training programs at higher funding levels for fiscal year 2020 through 2024. The Center for Excellence Program Awards grants for innovative resources and educational centers to recruit, train, and retain underrepresented minority students and faculty at health profession schools. The health professional training for diversity programs, provides training for disadvantaged students through scholarships, loan repayment plans, and fellowships, and the Health Career Opportunities Program. The Primary Care Training and Enhancement Grant creates accredited primary care professional training programs and provides need-based financial assistance. The training in public health dentistry programs awards grants to develop training programs and provides financial assistance to dental students, practicing dentists, dental hygienists, and other approved primary care dental trainees. And the program emphasizes training for students from minority and disadvantaged backgrounds and engages the students to, encourages the students to choose primary care fields to practice in underserved urban and rural areas. The Area Health Education Centers program develops and enhances education and training networks within communities, academic institutions, and community-based organizations. The National Center for Healthcare Workforce Analysis also reauthorizes through this bill. What it authorizes is absolutely essential, develops information describing the health professions workforce and many things under the National Care for Health. The Public Health Workforce Grant enhances the quality of the public health workforce and ability of the workforce to meet national, state, and local health care needs. The Geriatric Workforce Enhancement Program and the Geriatric Academic Career Awards program provides grants for training across the provider continuum to integrate geriatrics and primary care delivery systems. The Pediatric Healthcare Workforce Loan Repayment Program is for health professionals agreeing to serve at least 2 years in pediatric medical subspecialties, pediatric surgical specialties, or child and adolescent mental and behavioral health. And I want to emphasize that for decades, Title VII programs have assisted students from minority and economically disadvantaged backgrounds to enter the health professionals by focusing on student development, retention, matriculation, and graduation. But we still have to work on it. In 1980, about 7% of the medical school matriculation were Black, and in 2016, we only increased to 8%. We have a lot of work to do. This bill brings us in the right direction to have a culturally competent and diverse workforce, and I yield back.
I thank the gentleman. So we're on the underlying Schakowsky bill, the Empower for Health Act. Does anyone else want to speak on the bill? If not, we're going to go to a vote. The question now occurs on favorably reporting H.R. 2781 as amended to the House. All those in favor of reporting the bill as amended to the House will signify by saying aye. Aye. All those opposed will say no. Opinion of the chair, the ayes have it, and H.R. 2781 as amended is reported to the full House. The next health bill deals with the nursing workforce. The chair calls up H.R. 728. The Title VIII Nursing Workforce Reauthorization Act of 2019 is forwarded by the Subcommittee on Health on July 11th. The clerk will report the title of the bill.
Committee print to H.R. 728, a bill to amend Title VIII.
Without
of the
objection, the
Public Health
first reading of the bill will be dispensed with. The bill is now considered as read. Do we expect any amendments? No. Sponsors want to speak? Gentlewoman from California, Ms. Matsui.
Thank you, Mr. Chairman. I move to strike the last word. Nurses are an integral part of patient care in many settings. They're often the most memorable part of patients' hospital stays and to serve as a vital role in communities, delivering primary care and promoting public health and prevention. As our population grows, the demand for nurses will only continue to grow. To ensure that our system is ready to meet current and future health care needs, it is imperative that we invest in Title VIII nursing workforce programs, the largest dedicated source of funding that supports training, developing, and retaining a strong, diverse, competent nursing workforce across all care settings. We know it is expensive and time-consuming to become trained as a medical professional, but loan repayment and scholarship programs can help alleviate that burden. I'm thankful for my colleagues' support for my amendment as subcommittee that raises Title VIII funding levels and gives more nurses the opportunity to benefit from the loan repayment programs authorized in the legislation before us today. Our nurses will be able to practice at facilities in critical shortage areas where they are needed, rather than having to seek employment in places where they can receive enough compensation to repay their investment. Bolstering our nursing workforce is a key piece of the broader solution to address our nation's provider shortage challenges. I appreciate the work of my colleague, Representative Joyce, and this committee to advance this important legislation. Thank you, and I yield back.
Thank the gentlewoman. Any of the other, those sponsors want to speak? We have no amendments, so we'll just go to the vote. Question now occurs on favorably reporting H.R. 728 as amended to the House. All those in favor of reporting the bill as amended will signify by saying aye.
Aye.
All those opposed will say no. In opinion of the House, opinion of the chair, the ayes have it, and H.R. 728 as amended is reported to the full House. Next is the autism reauthorization. The chair calls up a committee print for H.R. 1058, the Autism Cares Act of 2019, as forwarded by the Subcommittee on Health on July 11th, and the clerk will report the title of the bill.
Committee print to H.R. 1058, a bill to reauthorize certain provisions of the Public Health Service Act related
Without
to
objection, the
autism.
first reading of the bill will be dispensed with. The bill is now considered as read. Does Mr. Doyle have an amendment in the nature of a substitute?
Yes, I have an amendment at the desk.
Clerk has the amendment and will report the amendment.
Amendment in nature of substitute to H.R. 1058 offered by Mr. Doyle. Strike all after the
Without
enacting
objection, the
clause.
reading of the amendment will be dispensed with, and Mr. Doyle is now recognized for 5 minutes.
Thank you, Mr. Chairman. I'd like to offer this amendment in the nature of a substitute to the Autism Cares Reauthorization, a bill that I've introduced with Representative Chris Smith of New Jersey. As co-chair of the Autism Caucus, I'm grateful that we're considering this bill before the committee today. I hear from parents, families, and individuals who have been impacted by autism spectrum disorders on an almost daily basis. I hear about the big stuff, about the progress a child has made, about struggles to find appropriate support services and their cost. I hear about the small stuff too, daily victories, daily pitfalls, laughs, tears, and more. These are the kind of stories that motivate me to push for this bill, and hopefully more like it. In 1995, the CDC spent less than $300,000 annually to study the prevalence of autism spectrum disorders, and the NIH spent about $10 million. 20 years later, we've made significant progress, but we are still far behind where we would like to be and where individuals and families need us to be. In 2000, the CDC reported approximately 1 in 150 children with ASD. The latest report found that number had increased to 1 in 59 children. Similarly, even though ASD can be diagnosed as early as 2 years old, most children are not diagnosed with ASD until after age 4. The total cost per year for children with ASD in the United States are estimated to be between $11.5 billion to upwards of $60 billion in both direct and indirect costs, from medical care to special education to lost parental productivity. And children and adults with ASD had average medical expenditures that were $4,000 to $6,000 higher than children without ASD. We also don't have a reliable estimate of autism's prevalence among adults. As autism is a lifelong condition, Each year, an estimated 50,000 teens and young adults with autism age out of school-based services. We have an unacceptable gap in our awareness of their needs, particularly in areas such as employment, housing, and social inclusion. That's why it's so important we pass this bill to continue to close the gaps in knowledge and services surrounding ASD. The Autism Cares Act of 2019 increases authorized levels to match our recent success at the Appropriations Committee to $296 million annually. $296 million annually at the NIH, $23 million at the CDC, and $55 million at HRSA. This money will be used for research, surveillance, education, detection, and intervention for individuals with autism spectrum disorders of all ages, not just children. The bill also supports training the healthcare workforce to better understand and treat individuals with autism and prioritizes awards to medically underserved areas. It also directs HHS to submit a report to Congress on the health and well-being of individuals on the autism spectrum, including proposals to improve health outcomes for individuals with autism, an often overlooked part of ASD. The bill also adds an important voices to the Interagency Autism Coordinating Committee. We have included representatives from the Department of Labor, the Department of Justice, the Department of Housing and Urban Development, and the VA. It also increases the minimum number of self-advocates included in the public membership of the committee, an important step for a committee whose voices are invaluable. I'm proud of the progress we've made over the last 20 years, but I know we still have more to do. The Autism Cares Act of 2019 takes important steps towards our ultimate goals to ensure that every individual has access to the treatment and support that is right for them. Mr. Chairman, with that, I yield back and urge a positive vote, and I would yield the balance of my time to Ms. Eshoo.
I thank the gentleman. I want to really point out that the superb advocacy of Mr. Doyle and his partner who chairs the Autism Caucus in the House, Mr. Chris Smith, this would not have happened without them. And the legislation really is going to move the needle finally on autism. You say it's the Autism Cares Act. I think it's the Doyle-Smith Cares Act. So bravo to you, and for families that are faced with individuals that they love with this, I think that we really are offering hope with this legislation. So thank you, and I'm proud that we were able to move it through the Health Subcommittee and now the full committee. Yield back.
I thank the gentlelady. Mr. Chairman, I yield back, and thank you.
I thank Mr. Doyle. We have before us the Doyle amendment in the nature of a substitute to his underlying bill. Does anyone else want to speak on the amendment? All right, let's go to a vote on the amendment. Oh, I mean, I don't, there are no other amendments, are there? Oh, there is. I apologize. Okay. Oh, I see. This is an amendment to the Ains. Okay. Ms. Rogers is recognized for that purpose.
Thank you, Mr. Chairman. I have an amendment at the desk.
Gentlewoman, oh, we need to have the amendment. Does this amendment have a label? You have it? All right. The clerk will report the amendment to the Ains.
Amendment to the amendment in the nature of a substitute to H.R. 1058 offered by Mrs. Rogers of Washington.
Without objection, the reading of this amendment will be dispensed with, and the gentlewoman is recognized on her amendment to the Ains.
Thank you, Mr. Chairman. I'm a proud co-sponsor of H.R. 1058, the Autism Cares Act, led by Representative Doyle and Representative Smith, ensuring that individuals with disabilities have adequate access to education, housing, and other programs has always been a priority for me. We've made great progress over the years, and this bill helps to continue our efforts. This amendment makes technical changes to the amendment in the nature of a substitute in order to ensure that individuals with autism spectrum disorder and other developmental disabilities are more clearly included in the statute for autism education, early detection, and intervention activities. I urge adoption of the amendment and the underlying bill, and yield back the balance of my time.
Thank you. Anyone want to speak on the Rogers Amendment to the Ains? Hearing none, we'll proceed to that vote. All those in favor of the Rogers Amendment will signify by saying aye. Aye. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment to the Ains is agreed to. I assume now we go to the Ains. We will proceed to a vote on the amendment in the nature of a substitute introduced by Mr. Doyle. All those in favor of the Doyle amendment in the nature of a substitute as amended to H.R. 1058 will signify by saying aye. All those opposed will signify by saying no. Opinion of the chair, the ayes have it, and the amendment in the nature of a substitute as amended to H.R. 1058 is agreed to. Now we're going to go to the underlying Doyle bill. A question now occurs on favorably reporting H.R. 1058 as amended to the House. All those in favor of favorably reporting the bill as amended will signify by saying aye. Aye. All those opposed will say no. Opinion of the chair, the ayes have it, and H.R. 1058 as amended is reported to the House. All members shall have 2 additional days in which to file supplemental additional minority and dissenting views, and the chair intends to file the report for H.R. 1058 with the House on Friday. The next health bill is H.R. 2507, the Newborn Screening Saves Lives Reauthorization Act of 2019, as forwarded by the Subcommittee on Health on July 11th. The clerk will report the title of the bill.
Committee print to H.R. 2507, a bill to amend the Public Health Service Act to reauthorize certain programs under
Without
Part
objection,
A.
the first reading of the bill will be dispensed with. The bill is now considered as read. Do we expect any amendments to this? No? Okay. Would anyone like to, the sponsors would like to speak on this? A gentlewoman. Oh, you're recognized. The gentlewoman from New York is recognized for 5 minutes.
Thank you very much, Mr. Chairman. I just moved to strike the last word. Mr. Chairman, it is great today to know that the Newborn Screening Saves Lives Reauthorization Act of 2019 is being considered on our agenda. I'd like to thank my colleagues for their diligent work on this bill, which will reauthorize newborn screening programs for the next 5 years. Since its original passage in 2008, the Newborn Screening Saves Lives Act has helped to create a federal advisory committee to review significant disorders, and it has also established a grant program for screening, counseling, and other services related to heritable disorders. While the act has made significant strides towards eliminating preventable newborn deaths, one crucial component that we still need to address is the patchwork method through which states are implementing disorders on the federal recommended uniform screening panel list, otherwise known as RUSP. With our current system, it could potentially take a decade or more for all 50 states to test for an added disorder, leading to thousands of unnecessary lives lost due to screening limitations. Today, I'd like to recognize Ms. Alyssa Seeger, who is with us today in this markup. Ms. Seeger is the mother of Aiden Jack Seeger, a spirited 6-year-old Brooklyn boy who developed vision and concentration problems. In 2011, Ms. Seeger discovered that Aiden had ALD, a deadly brain disease from which he unfortunately has passed away. It is in Aiden's memory that I now look forward to working with the committee on this important issue, to adding ALD and 3 other disorders to RUSP in order to eliminate death by zip code. Thank you, Mr. Chairman, and I yield back the remainder of my time.
Thank the gentlewoman, our committee vice chair. Does anyone else want to speak on the gentlewoman's bill? All right, then we're going to go to a vote. The question now occurs on favorably reporting H.R. 2507 as amended to the full House. All those in favor of reporting the bill as amended will signify by saying aye. All those opposed will say no. In the opinion of the chairs, the ayes have it, and H.R. 2507 as amended is reported to the full House, and all members shall have 2 additional days in which to file supplemental additional minority and dissenting views. The chair intends to file the report for the bill with the House on Friday. The next health bill, call up H.R. 776, the Emergency Medical Services for Children Program Reauthorization Act of 2019. The clerk will report the title of the bill.
H.R. 776, a bill to amend the Public Health Service Act to reauthorize the Emergency Medical Services for Children program.
Without objection, the first reading of the bill will be dispensed with. The bill is now considered as read. Do we expect an amendment? No amendments. Sponsors would like to speak. Gentlewoman from Florida.
Thank you. Chairman Pallone and Health Subcommittee Chair Eshoo, I want to thank you very much for including my bill in the markup today. H.R. 776 is the Emergency Medical Services for Children's Program Reauthorization, which I introduced with Congressman Peter King of New York, along with my colleagues, Congressman Butterfield from our committee and Chris Stewart. Our bill reauthorizes the Emergency Medical Services for Children program through 2024. EMSC is a vital initiative because it is the only federal funding specifically focused on addressing the unique needs of children in emergency medical services. Children have specific health care needs. They're not like adults. And EMSC helps bring innovation in pediatric emergency care to each state. In 2016, 22% of emergency department visits in my home state of Florida were made by children, so it's critical that we reauthorize this initiative as soon as possible to ensure that America's kids are getting the right care when they need it. I want to thank my colleagues on the committee, Representatives Bobby Rush, Darren Soto, Lisa Blunt-Rochester, and Susan Brooks for co-sponsoring H.R. 776. I urge my colleagues to support this bill, and I yield back my time.
I want to thank the gentlewoman. Does anyone else want to speak on the Castor bill? All right, we're going to go to a vote. Question now occurs on favorably reporting H.R. 776 to the House. All those in favor of reporting the bill to the full House will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it, and H.R. 776 is reported to the House. All members shall have 2 additional days in which to file supplemental additional minority and dissenting views, and the chair intends to file the report on Friday. Next health bill is the chair calls up H.R. 2035, the Lifespan Respite Care Reauthorization Act of 2019, as forwarded by the Subcommittee on Health on July 11th. The clerk will report the title.
Committee print to H.R. 2035, a bill to amend
Without
Title
objection,
29.
the first reading of the bill will be dispensed with. The bill is now considered as read. Do we expect any amendments? No amendments. The sponsor is? Sponsor's not on the committee, but who is it anyway? Oh, Mr. Oh, Mr. Langevin. No. Oh, Miss Rogers. Oh, does she want? Did you want to speak?
Thank you, Mr. Chairman.
Recognize the gentlewoman from Washington.
Move to strike the last word.
Gentlewoman is recognized.
Respite care is an essential part of a comprehensive healthcare approach, and this legislation will support respite care agencies by providing funding for state grants to improve and expand these services in our communities, improve coordination, and streamline access to programs. I'm proud to have joined Mr. Langevin in introducing the Lifespan Respite Care Act of 2019 to help fill gaps in respite care in Eastern Washington and all across our country. I yield back.
Thank the gentleman. Woman, anyone else want to talk on this respite care bill? If not, we'll go to a vote. The chair, question now occurs on favorably reporting H.R. 2035 as amended to the House. All those in favor of reporting the bill as amended to the House will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it. H.R. 2035 as amended is reported to the House. All members shall have 2 additional days in which to file supplemental, additional, minority, and dissenting views, and the chair will file the report for the bill on Friday. Next, health care bill. Chair calls up H.R. 2296, the More Efficient Tools to Realize Information for Consumers Act, or the Metric Act, as forwarded by the Subcommittee of Health on July 11th. Clerk will report the title of the bill.
Committee print to H.R. 2296, a bill to require reporting regarding certain drug price increases and for other purposes.
Without objection, first reading of the bill will be dispensed with. The bill is now considered as read. Expecting any amendments? Okay, Ms. Schakowsky has a manager's amendment. Did you want to be recognized?
Mr. Chairman, may I speak on the underlying bill first?
Absolutely. The gentlewoman is recognized to speak on the underlying bill.
So the first thing I want to say is thank you. I'm grateful first to Representative Francis Rooney of Florida, who was the first Republican to join me in introducing the Fair Drug Pricing Act, which is included in this package, and who has been committed to working across the aisle on drug pricing for several years now. I'm also very, very grateful to Senator Baldwin and Braun, senators, both of them in the Senate, who are fighting to get this companion bill over the finish line. I'm also grateful to Ranking Member Walden, his staff, and my Republican colleagues on this committee who agreed to work diligently with us to reach bipartisan compromise on the Fair Drug Pricing Act and other drug pricing transparency measures that are all included in this package of bills. I hope that people will look at this markup today and realize that bipartisanship is still possible, especially in this committee, but also in this Congress. And finally, I'm most grateful to our chairman and his staff for being so committed to this issue of true drug price transparency that actually has teeth. They have worked with me throughout the Congress to set what I hope will be a unanimous committee vote to make the whole package, move the whole package to the House floor today. This package is essential and it is long overdue. The bills being considered today are only a start, and transparency is only one piece of the puzzle in bringing down the cost of prescription drugs. But let me make everyone aware it is a huge deal that the Energy and Commerce Committee has taken the lead on marking up the most robust, the most comprehensive, the most effective drug price transparency legislation that has ever been seriously considered in the United States Congress. We should all be proud of that effort. AARP, the Campaign for Sustainable Prescription Drugs, Patients for Affordable Drugs, Families USA, the National Multiple Sclerosis Society, the American Academy of Neurology, the Alliance for Retired Americans, the Medicare Rights Center, all agree that they have endorsed this package. But most importantly, I want to say that this package will, for the very first time, give taxpayers public notice of price increases. It will, for the first time, bring basic transparency to the market for prescription drugs. The American people are crying out, and prescription drug prices are literally killing them. H.R. 2296 will finally force drug companies to answer to the American people. So what we need to do right today is to pass this package, and I yield back.
I thank the gentlewoman. Did you want to say? All right, so we're doing, this was the underlying bill, but now, unless anyone wants to speak on that, we're going to go to the Schakowsky Manager's Amendment. Mr. Gentleman from Georgia wants to speak on the underlying bill. Gentleman's recognized.
Thank you, Mr. Chairman. I move to strike the last word. Mr. Chairman, I'll be brief, but I wanted to again state my appreciation for the work that's gone into these bills. I've had concerns with earlier versions of these bills, but I think after a robust process of hearings and negotiations, this is a package of bills that will help patients. So far, this committee has demonstrated a sincere effort to work together to address prescription drug prices. While I think we still have some work to do, today's transparency bills are a good step. Sunlight is the best disinfectant, and I'm concerned and I'm confident that the policies in this bill will help lower costs for patients. Again, I want to thank you, Chairman Pallone and Chairwoman SU, for your leadership throughout this process. And I want to thank the staff on both sides for their work on this as well. I look forward to continuing to work with you all to address other drug pricing reforms moving forward. I remember during one of the insulin hearings in the Oversight Committee earlier this year, Chairwoman DeGette said she thought she'd never see the day when Buddy Carter was channeling Jan Schakowsky. But here we are, and I'm thankful we have been able to work together on these issues. Mr. Chairman, today marks another strong step in this committee's work to lower drug prices for Americans. I encourage all of my colleagues to support this bill. I look forward to working to continue to work with you all to get this bill across the President's desk so we can start delivering for patients across the country. Thank you, and I yield back.
I thank the gentleman. So, anyone else want to comment on the
Chairman,
underlying?
I move to strike the last word.
Who's
over
Oh,
here?
yeah, the gentleman's recognized.
Thank you, Mr. Chairman. H.R. 2296, the Metric Act, includes much-needed transparency in the cost of prescription drugs. Last month, my Texas colleague Jody Arrington and I introduced H.R. 3408, the Shop Rx Act of 2019. H.R. 3408 ensures that sponsors of prescription drug plans offer real-time benefit information to Medicare beneficiaries. Real-time benefits allow providers to see the cost of a drug and its alternatives before they prescribe it to their patients. By incorporating price transparency tools, both patients and their providers can have more informed, productive conversations about their health care options. Physicians and patients should be on the same page and be aware of all the options available. I'm pleased to see this committee included H.R. 3408 in this bill. I urge my colleagues to support H.R. 2296. I yield back.
Thank the gentleman. Any other statements on the underlying bill? If not, we'll move to the Schakowsky Manager's Amendment, and the gentlewoman is recognized.
Thank you. Thank you, Mr. Chairman. Before beginning, let me just thank Chair Eshu of the Health Subcommittee for bringing us to
You know, I apologize. We have to, the clerk has to report your amendment
Okay.
first.
So let me just say then, for the purpose of offering an amendment to H.R. 2296.
Clerk has the amendment?
Yes, sir.
Read it.
I do. Amendment to H.R. 2296 offered by Ms. Schakowsky.
Without objection, the reading of the amendment will be dispensed with, and Ms. Schakowsky is recognized to speak in support of her.
Once again, I want to thank Chair Eshu for bringing us to this day where we're doing some very important work, and also thank her for, I've had the opportunity to wave on to the subcommittee on several occasions, and I appreciate it so much. Mr. Carter, they don't call you Buddy for nothing. I'm so happy to be able to work with you on this legislation. I want to explain, I want to take just a few moments to explain why the provisions in this package are stronger and more effective than similar bills that have been introduced this Congress. First, Section 2 is the bicameral and bipartisan Fair Drug Pricing Act, which I've introduced with Congressman Rooney. I alluded to it before, which is I think the least we can do for consumers. This section does two essential things. First, it requires pharmaceutical manufacturers to notify HHS and submit a transparency and justification report 30 days before they increase the price of certain drugs by more than 10% or by more than 25% over 3 years. All non-proprietary information will be made public on the date of the price increase so that American taxpayers who fund research and development on so many prescription drugs will receive notice. Who rely on those drugs. The justification report will require manufacturers to accurately and truthfully provide an explanation for the price increase, the manufacturing, research, and development costs for the drug, the net profits attributed to that drug, the marketing and advertising spending on the drug, the expenditure on patents and licensing for the drug, executive compensation during the period of the price increase, and other information that the Secretary can decide is necessary through rulemaking. While other transparency legislation has been considered for the first time this Congress, I feel confident that H.R. 2296 will provide greater information for consumers about true costs of drugs developed and marketed. Unlike other proposals, my bill does not allow manufacturers to pick and choose what information they would like to disclose. Additionally, I want to highlight Section 3 and 4 of this package, which will increase transparency around the rebates and merger activity of pharmacy benefit managers. This is the issue that Representative Carter has brought to our attention. As chair of the Consumer Protection and Commerce Subcommittee, I'm especially happy that Section 4 mandates a report from the Federal Trade Commission that studies merger activity of PBMs and potentially anti-competitive practices that could increase drug prices. Section 5 of this package is based off of a very strong bill that was introduced by my friend Judy Chu last April. I commend her for introducing robust legislation to help Americans understand exactly what is influencing or driving the distribution of drug samples. And I am happy that through our negotiation around her bill, we reached bipartisan agreement to make aggregate information on samples, sample distribution publicly available online. Section 6 of this package incorporates a bill introduced by my friend Lloyd Doggett, who has been an ally in the fight for true drug price transparency and a champion of the Fair Drug Pricing Act. His bill would force drug companies to report more information to CMS about their average sales prices. Section 7 of the package requires that insurers give real-time drug price information to seniors enrolled in Medicare Part D. I hope you all will join me in voting for this landmark drug pricing package, and with that, I yield back.
Thank the gentlewoman. Recognize the ranking member, Mr. Walden.
Thank you, Mr. Chairman. I asked to strike the last word. As I mentioned in the subcommittee, I want to sincerely thank Chairman Pallone and his team for a commendable process on these bills. Today, this package of bills is focused around transparency, and I think that's a very laudable goal. If there's one thing I think the healthcare market could benefit from, it is more transparency to empower consumers and ultimately open up more choice and competition. But I do want to make sure that as this process continues, that we do not open ourselves up to unintended consequences of the language we began with several months ago. So I can support this package because I feel we've mitigated many of those issues. While I still have some concerns, honestly a few more than I did last week, I feel they are outweighed by all the progress that we were able to make. I also plan to continue to diligently work to ensure that we do not hamper innovation or impede patient access to their needed medication as this process continues. Now, a lot of compromises were made on both sides as we worked into the night just yesterday. As I said many times previously, if I feel in our attempt to pay homage to the idea of transparency that we actually end up violating any of the core principles in this space, I'll have to reevaluate my support. But you understood the concerns we had, and you worked with our members and staff, Mr. Chairman. And I do again want to thank you and your staff, and I hope I have your commitment to protect this important work that we have accomplished. It's my sincere hope, Mr. Chairman, that you can defend this committee work and ensure that it is our language that we report out today that actually proceeds to the floor. I'm encouraged by our work on this bill, support the amendment, and I thank the chairman for this process, and I urge members to support this legislation, and I yield back the balance of my time.
I thank the ranking member, and I yield myself 5 minutes in support of the amendment offered by Representative Schakowsky. And I do want to, I will certainly commit to the ranking member to protect this important work. I know that there are competing bills, and I do believe that our work of this Energy and Commerce Committee is important to protect and bring to the floor. This amendment includes important bipartisan improvements to the bill since its consideration by the Health Subcommittee last week. We have incorporated stakeholder feedback, technical assistance, and other changes that strengthen the underlying legislation, all while maintaining our commitment that we reach bipartisan agreement on legislation that will provide meaningful transparency for consumers and policymakers. This amendment clarifies the underlying reporting requirements for manufacturers of qualifying drugs that raise their prices more than 10% in 1 year or 25% in 3 consecutive years, such as the total expenditures for research and development in order to obtain FDA approval, as well as the identity of other manufacturers that may have contributed to the advancement of the drug previously. And specifically, the bill denotes each data reporting requirement that must be disclosed publicly, removing any subjectivity that could be applied in justifying high price increases. This means that exactly what manufacturers report to HHS will then be disclosed publicly, and we have also reinforced these reporting requirements by making clear that manufacturers must provide information that is truthful, not misleading, and accurate, while also ensuring that any information that is protected from disclosure today will continue to be protected under those reporting requirements. We're sending a message to drug manufacturers that if you indiscriminately raise your prices, you have to answer to the American people and tell them why. And this goes to the very heart of this bill, increasing meaningful transparency. Consumers have a right to know why the drugs they're taking are increasing in price. They have a right to know how much a drug will cost them when it is being prescribed, and they should be able to understand the impact of product samples on price. However, information is only as meaningful as the format in which it is provided. The Metric Act ensures that the reported documentation required to be submitted by drug manufacturers when they increase their prices is publicly disclosed in full, while also in a format that is user-friendly and can be readily understood. For example, this bill will allow the American people to know just how much money drug makers are spending on marketing and advertising as compared to other costs like manufacturing and research. Access to information like this will provide insight into manufacturers' real intentions and motivations when they increase their prices. In addition to the reporting provisions for drug manufacturers, the bill ensures researchers have access to information related to the distribution of drug samples to facilitate analysis and study the implications of distributing product samples to healthcare providers. And this will encourage both qualitative and quantitative analysis that will ultimately help consumers and policymakers to better understand what connections, if any, there are regarding samples and health provider behavior. I think we need more transparency in the drug supply chain, but for transparency to be useful, it must be in a way that consumers can appreciate and understand, and this amendment and the underlying bill accomplish that goal, in my opinion. H.R. 2296 represents a strong bipartisan agreement that will bring greater transparency to the marketplace and to the American people. And again, I want to thank Representative Schakowsky for her leadership. I know how hard she's worked on this bill, as well as my Republican colleagues and Ranking Member Walden. I'm proud of this legislation and our committee's work, and I urge my colleagues to support the amendment and the underlying bill. And with that, I would, let me yield now to the gentlewoman, the chairman of the Health Subcommittee, who's also been so helpful with this. I yield to Ms. Eshoo.
Thank you, Mr. Chairman. I move to strike the last word, but I'll be brief. I won't use the whole 5 minutes. I want to thank Ms. Schakowsky for her work, for everyone that's been involved in this. because it's a very important undertaking. Everyone is for transparency. I don't know anyone that isn't for it. What I want to make sure we do moving forward is that once people see the price, that we actually bring that price down. Because when they see the price, their temperature is going to go up. So transparency is one thing, and it's another thing to us continue working to bring the overall prices down for the American people. I want to highlight that in the Metric Act, which I really think is important, is that it requires PBMs to report the discounts they negotiate with drug manufacturers. And I know that members on both sides of the aisle were, this is something that they cared a great deal about in the subcommittee. And I think that that transparency is going to help patients to benefit from that discount. And the bill also directs the FTC to review PBM's anti-competitive behavior. At our hearings, we learned that there are 3 PBMs that control the majority of the market, and they own pharmacies, too. So how do you like that one? I think it's a potential conflict of interest. So with this bill, the FTC is going to scrutinize the PBMs, and if there isn't anti-competitive behavior, terrific. But if there is, we will need to together address any distortions in the market. So I wanted to highlight those things in the underlying bill, and I look forward to its passage, and I thank everyone that has worked on it. I think it's important work for the American people, and I yield back.
Thank Chairwoman Eshoo for her contribution with this legislation as well. So now we have the Schakowsky Amendment. Does anyone want to speak on that? If not, we'll go to a vote. All those in favor of the gentlewoman's amendment in the nature of a substitute will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. Do we have any further amendments? Okay, so we're going to go now to the underlying bill. The question now occurs on favorably reporting H.R. 2296 as amended to the House. All those in favor of reporting the bill as amended to the House will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it, and H.R. 2296 as amended is reported to the full House. The next health care bill. This the last one? Don't we have 2 more?
No, this is the last one because we pulled a pipeline, so this is the last one.
Oh, I see. Surprise billing and extenders are all in one bill. All right. So the chair calls up H.R. 2328, the Reauthorizing and Extending America's Community Health Act, or REACH Act, as forwarded by the Subcommittee on Health on July 11th. The clerk will report the title of the bill.
Committee print to H.R. 2328. A bill to
Objection,
reauthorize.
the first reading of the bill will be dispensed with. The bill is now considered as read. Do we have any amendments to this?
You have an amendment in the nature of a substitute.
This is my own. All right. So I'm now going to recognize.
No. Okay. I think they want to do Walden first.
Oh, you have one?
Right, here we go.
All right, so. Now, this bill, you know, has everything, right? It has all the extenders, it has the community health centers, it has the territories under Medicaid, and it has surprise billing all rolled into one. And others, too, but. So what amendments do we have? Let's just pause a second here. We're putting this all together. It's not easy. We resolved the staff differences. All right. I'm going to recognize myself to offer an amendment in the nature of a substitute, which is labeled Ains 01. Have that. The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 2328, offered by Mr. Pallone.
Without objection, the reading of the amendment will be dispensed with, and I recognize myself for 5 minutes. This amendment adds 2 additional bipartisan bills to the underlying health extenders package, which is itself a product of a successful bipartisan compromise coming out of our health subcommittee. I want to thank the ranking member, Mr. Walden, for his willingness to work with me to get to this point. First, this amendment incorporates H.R. 3630, the No Surprises Act, which I've introduced with ranking member Walden. I'm proud of the open bipartisan process the ranking member and I have had with this legislation. We've done our best to hear all sides of the issue, and I think we've landed with a strong product that will provide consumers with significant protections from surprise medical bills. While I still have reservations about the inclusion of an independent dispute resolution process, I believe the amendment will be offered today by Representative Ruiz and Bouchon, and that's an appropriately targeted amendment that represents their concerns, and I'm committed to getting this legislation done for consumers, and so that's what we're doing. This amendment also incorporates the Territories Health Care Improvement Act, which was introduced by Representatives Soto and Bilirakis, and provides critical funding and important program integrity improvements to the Medicaid programs in the territories. We all know that the territories' Medicaid programs are in crisis. Without additional federal financial support, they won't have enough money to last them through next year. Without additional federal funds, the American citizens who live in the territories would be at risk of losing their health coverage, losing access to doctors, hospitals, and drugs. So this bipartisan bill would provide the territories with several years of enhanced federal funds and an increased matching rate. It will ensure that the territories have the money they need to ensure people continue to have access to health care. It also makes important program integrity improvements that will help ensure that federal Medicaid dollars are being spent to improve the health of Medicaid beneficiaries. The policies in the amendment augment the significant investment the REACH Act makes to community health centers, teaching health centers, the National Health Service Corps, and other health programs. Community health centers provide access to primary health care and other services for millions of Americans, especially in areas that have been underserved. Health centers provide high-quality care to individuals regardless of their ability to pay and are often the only access point available to patients in their area. Since the House created the Community Health Center Fund in the Affordable Act of 2010, we have seen a significant expansion of health centers and their ability to serve. At our legislative hearing, we heard how important it was for community health centers to receive long-term stable funding to allow them to invest in care for their patients without the risk of shutting their doors. And I'm proud that the reauthorization we're passing today represents the longest extension of the fund since it was created and includes more funding than any other one piece of legislation it has ever put into community centers. Let me just add for my Republican friends, I know I'm mentioning the ACA here, but I also very much aware of the fact that community health centers concept were started, were very much supported by the Republicans over the years, particularly President Bush, who was a big advocate for it. This bill also invests in the future of our healthcare workforce in underserved communities by extending funding for the National Health Service Corps and the Teaching Health Centers program. The National Health Service Corps program provides financial support to professional students and primary care providers who commit to serve in medically underserved communities. In the past, when Congress has failed to extend funding for this program on time, providers were left in limbo for months without the ability to renew their contracts. It is critical we prevent that from happening again by passing this package today. The Teaching Health Center program has similarly increased training of primary care medical and dental residents in community-based settings. Physicians trained at teaching health centers are far more likely to practice in a medically underserved or rural community, helping better ensure that all Americans receive the care they need. And finally, the REACH Act includes important extensions of the Patient-Centered Outcomes Research Institute, or PCORI, and important Medicare programs that improve access to quality care for low-income beneficiaries and allow seniors to remain in their home as they age. Patients are counting us to put them first, and the REACH Act does that. The amendment in the nature of a substitute provides the investments necessary to improve access to care in the U.S. territories and a lifeline to millions in traditionally underserved areas. And it protects patients from the unreasonable and unacceptable practice of surprise billing. So I thank all the members for their work on this package. I think it's one of the things we can be truly proud of, and I urge support for this amendment and the underlying bill and yield back. Now recognize Mr. Walden. You want to speak on the Ames? He wants to speak on it. Okay. I recognize our ranking member.
Thank you, Mr. Chairman. H.R. 2328, as you've said, reauthorizes for 4 years funding for the special diabetes programs, teaching health center, graduate medical education, the National Health Service Corps, community health centers, and other critical public health programs. It also reauthorizes for 3 years important expiring Medicare programs and eliminates 2 years of DSH cuts that would have had a significant impact on hospitals and that were called for under Obamacare. This amendment, in the nature of a substitute to H.R. 2328, incorporates the language of H.R. 3631, which is the Territories Health Care Improvement Act, and H.R. 3630, the No Surprises Act. I support the inclusion of these important provisions, appreciate the bipartisan commitment made to get the policies in this amendment right, and I urge my colleagues to support its package. And I really want to give a shout out to our delegate, resident commissioner from Puerto Rico, who is in the front row there. Jennifer Gonzalez-Cullen has been a terrific resource for us and a very effective representative for the island and the people who live there to make sure that we get Medicaid at the right level for the people who need it most. And we appreciate your counsel, and we'll be submitting your comments for the record. Mr. Chairman, with that, I yield back.
Thank you, Mr. Walden. I want to recognize Ms. Eshu next, but I do want to thank her and Dr. Burgess. You know, we're very proud of the fact that on all legislation, or most legislation, when we follow a regular order, that we have hearings in the subcommittee and markups in the subcommittee. And I know that this bill basically comes from numerous health subcommittee hearings. So I just wanted to mention it, and thank you for that. I recognize Chairwoman Eshu.
I thank the chairman for his kind words and move to strike the last word. I just want to put this very simply. I think that this bill is a very big deal. First, on the territories, there was a great deal of thought on the part of many that went into what has produced the outcome that's before us today. And I want to recognize all of the delegates representing the territories for their terrific work and for their, they were highly instructive to us. Mr. Soto has done marvelous work, and again, all of my thanks to the delegates. I say that the bill is a big deal because it's going to really improve health care for every single American, including the 1 in 13 Americans who receive primary care from community health centers, regardless of their ability to pay, the 30 million Americans who have diabetes, and depend on the research that's funded through the Special Diabetes Program, the 10,000 people who newly enroll in Medicare every day and depend on personalized counseling to understand their benefits and their premiums, the 11 million people who receive care from clinicians in the National Health Service Corps, and the millions of Americans who rely on the care provided by the disproportionate share hospital in their community. It also will help the 1.5 million Medicaid enrollees in the territories whose lives hang in the balance of a funding cliff. I think that this is the most comprehensive legislation relative to the territories, at least since I've been on the Energy and Commerce Committee, and that's a long time. It's more than 2 decades. As we heard at our historic hearing, for too long, the territories have struggled with inadequate, unfair, I think, federal funding with their low federal match. So I'm really proud of the work that the subcommittee has done. This longer-term fix for the territories offers them certainty. And that is, I think, one of the most essential ingredients in this, because they need to invest in their healthcare systems, and they'll be able to. And it's bipartisan, and that's very important, obviously, as well. And I'm also pleased that the bill includes a sense of Congress acknowledging the need for a permanent fix relative to Puerto Rico. So with that, I'm going to yield back the balance of my time.
Gentlewoman to yield to me.
Sure, I'd be glad to.
Just wanted to follow up on what you said. I noticed that Jennifer Gonzalez is here, the delegate from Puerto Rico. Are there other delegates who are here? But I wanted to mention that both she and Stacy Plaskett were great when we had the Codell that went to the two, well, I guess there's more than two islands in the Virgin Islands, right? You know, after Hurricane Maria, and were very instructive in telling us about the problems with the difficulty in funding the Medicaid program. And Mr.
Mr. Chairman, can I reclaim just
Yeah, sure.
30 seconds
Of
to say
course.
something about surprise billing? There's been a ton of work that's gone into this bill, and I think the good news is that everyone agrees that patients should not be caught in the middle of this. I appreciate the work that's been done, hearing out members and sensibilities that they had, and that there's a blend to the bill that we have with a stopgap measure. I think it improves the legislation, and I'm really very proud of our committee's ability to listen to members so that legislation can be improved, and that ultimately that patients are going to be protected from the sticker shock of surprise bills, so surprise billing. So thank you to you and the ranking member, and I yield back.
Well, let me just take the last 15 minutes,
Sure.
if you will, and
Bouncy
also
ball.
say that, you know, obviously Darren Soto did so much work on this, but we also had a lot of help from other members of Congress who were, you know, who are of a Puerto Rican descent, Nydia Velasquez, Jose Serrano, and others. So I just wanted to thank all of them as well. Thank you. The gentlewoman yields back. Is there anybody on the Republican side that wants to speak on this? Yes, the gentleman from Florida.
Thank you, Mr. Chairman. I move to strike the last word. I'd first like to thank you for offering this amendment in the nature of a substitute, H.R. 2328, also known as the Reauthorizing and Extending America's Community Health Act, or the REACH Act. I'm very pleased to see this amendment includes the longest reauthorization of the community health centers, a critical community lifeline. Community health centers treat 1 in 5 uninsured Americans, a third of those living in poverty, and 1 in 6 Medicaid beneficiaries. They provide high-quality, cost-effective care that annually saves the healthcare system an estimated $24 billion by reducing the need for patients to seek care in costlier settings such as emergency departments. And I know, Mr. Chairman, you worked with my father, Congressman Mike Bilirakis, for years. I think y'all co-chaired the caucus for many years, the Community Health Center caucus, and I appreciate that. I've witnessed impressive innovation and collaboration as the community health centers in my district, like Premier Community Health Center and Community Health Center of Pinellas, work with other community partners to provide a system of care that is accessible and cost efficient. Community health centers have long enjoyed bipartisan support because they are a prime example of what is working in our healthcare system. Additionally, this amendment includes Medicaid funding for the U.S. territories to address the pending fiscal cliff. I want to thank my friend and colleague, Jennifer Gonzalez, who works on behalf of her constituents. She does a wonderful job, and we're very, very fortunate to have her here in Congress working on behalf of these wonderful American citizens in Puerto Rico. Also, Stacy, I'm not sure if she's in the room, but all the delegates, they've done an outstanding job with regard to this. I'd like to also thank my colleague and co-league on this effort, Representative Soto, who's also done a great job, and he's worked in a bipartisan fashion. We appreciate it so much. You've made this bill better. As I said last week, while it may be tempting to engage the political brakes due to malfeasance in Puerto Rico, we must remember that the pending Medicaid fiscal cliff is not only an issue for the United States territories, but also for the United States, issue impacting U.S. citizens. Again, we don't want to punish the U.S. citizens in Puerto Rico. They need the health care, and they need to get it soon. Under this bill, the Medicaid caps are responsibly raised to properly reflect the needs of American patients in the territories, while robust program integrity measures have also been included. I urge my colleagues to continue to support our communities through our community health centers by supporting the reauthorization, in addition to supporting our citizens in the territories by supporting this responsible, bipartisan Medicaid funding package. And I yield back. Thank you, Mr. Chairman. Appreciate it.
Thank the gentleman. Ms. Schakowsky is recognized.
Thank you, Mr. Chairman. I move to strike the last word. I congratulate the sponsors of this legislation and the staff on both sides of the aisle for their tireless work in crafting this bipartisan essential legislation. It is critical that we extend funding for critical public health programs and protect consumers from outrageous medical bills, surprise billing, and otherwise. This bill guarantees community health centers, teaching health centers, and National Health Service Corps the steady stream of funding that they need to continue the work they do. So I will be voting for this legislation and hope all my colleagues will join me in doing the same so that we pass it unanimously and send a strong message to spur action on both the House floor and the Senate floor. Still, I would be remiss if I did not express my disappointment that this bill maintains the current limitations on federal funding for abortion. Let us remember that community health centers are safety net facilities that provide care regardless of one's income and insurance status and ability to pay. The lower income, vulnerable women who rely on these centers for care should not be denied comprehensive reproductive health care simply because they are poor. Reproductive health care is a fundamental component of health care, and health care is a human right. And with that, I yield back.
I thank the gentlewoman. Gentleman, who's first? Ms. Rogers? Yes, is recognized.
Thank you, Mr. Chairman. I move to strike the last word. I strongly support the Teaching Health Center Graduate Medical Education Program and its positive impact on increasing the number of physicians practicing in America. Living in rural Eastern Washington, I know firsthand the challenges of getting doctors into the rural areas in my district, in Eastern Washington, as well as all over the country. I want to thank Chairman Pallone and the Ranking Member Walden for their work in extending this important program for another 4 years. I appreciate the chance to work with Mr. Ruiz and together get this legislation passed. I look forward to continuing to work with you as this package moves to the floor and on ensuring continued robust funding for this important program. We need to be mindful of the effect that short-term level funding can have on the stabilization and the expansion of these important programs. And that's why I'm happy that we, in this legislation, are authorizing the longest extension that we've seen in the THC GME program. I also want to recognize my friend and colleague Jennifer Gonzalez for her leadership and tireless efforts on behalf of the people of Puerto Rico. Per her invitation, I had the chance to visit Puerto Rico right after the hurricane and saw the devastation, and had the chance to go back again this spring and to see how far they've come rebuilding. The work of this committee in helping, especially with the Medicaid, that is so important to many in Puerto Rico as well as the other territories, is to be lauded, and I'm glad that we're moving forward. So thank you very much, Mr. Chairman. I yield back.
Thank the gentlewoman. Anybody on the, Mr. Welch?
I'm going to support this bill, and I appreciate the work that so many people have done to get it to this point. But I do want to raise a serious concern I have. You mentioned President Bush as someone who has supported these community health centers. He has a close ally in that effort, and that's Senator Bernie Sanders. And he contacted me, but it was to raise a question that I think all of us had on our mind, and that is that level funding does, over time, through 2024, not keep up with inflation, does not keep up with the population increase. So we've got to be clear-eyed about this, that we're giving stability to our community health centers, and they want to avert that disaster where there's uncertainty about funding altogether. But on the other hand, you know, we don't level fund the Pentagon. And why is it that we level fund health care? And I think that's a concern to all of us. I'm not offering the amendment because this bill is comprehensive. It includes many things that many people have worked on very hard. And I'm going to say something nice about the Republican ranking member, so I want my Republican colleagues to close your ears. We don't want this to go to his head, but after talking to Mr. Pallone, who himself is a strong supporter of community health centers, and I think if he had a magic wand would want to raise the funding as well, told me that Mr. Walden was extremely cooperative and helpful in getting this bill to the place it's at. And I actually inquired from Mr. Walden about the advisability of me proceeding, and he gave me his opinion, and for that I appreciate it. So there's something to be said, actually an awful lot to be said for finding ways to work together, especially in this environment. But on the other hand, there's also something to be said for candid acknowledgement that level funding for healthcare, but not level funding for the Pentagon, suggest priorities that many of us question. And I do hope that at some point, when the opportunity arises, we may find a way forward to increase funding to reflect population increase and inflation adjustment, which generally in healthcare is higher than the regular CPI. But I do want to express my appreciation to Mr. Pallone and to Mr. Walden for the work that they did, not just on this aspect of the bill, but on all the other aspects of the bill. But I also do want to alert my colleagues that if we have any opportunity to restore what I would call full funding, level funding, that it would include that inflation and population adjustments that are necessary to make certain that our citizens get access to those community health centers that George Bush and Bernie Sanders think are so important. I yield back.
I thank the gentleman. Going to go to the Republican side,
Chairman.
Mr. Olson.
Mr. Chairman, move to strike the last word.
Gentleman is recognized.
Mr. Chairman, the REACH Act includes H.R. 3029, the Improving Low-Income Access to Prescription Drugs Act, which I introduced my good friend from California, Representative Nanette Diaz-Barragan. H.R. 3029 would permanently, I say again, permanently authorize the limited income newly eligible transition program known as LINET. When a family suffers a sudden reduction in income, the LINET program helps ensure these families maintain needed prescriptions as they transition to Medicare Part D. As we continue to tackle prescription drug prices, this program provides a critical backstop for families in need of help. Folks shouldn't have to worry if they can afford needed medications during these horrific transitions. And finally, Mr. Chairman, H.R. 2328 contains a bipartisan, much-needed 2-year delay in cuts to Medicaid disproportionate share hospitals, also known as DSH cuts, DSH. Earlier this year, despite speaking different languages, nasal New York, and a Texas twang, my good friend Mr. Dingell and I sent a letter to Speaker Pelosi with over 300 signatures asking for a 2-year delay in the upcoming DSH cuts. I want to thank Mr. Dingell for working hard on this issue with me. Last month, I introduced H.R. 3054, the Dish Cuts Delay Act, to do exactly this, delay these scheduled cuts for 2 more years. Medicaid is a critical lifeline for low-income folks all across America and Texas. And many of these folks rely on local community hospitals for their care. The Medicaid DISH program plays an important role in ensuring quality care. Cuts to this program would create an immediate void for essential health care by forcing local community hospitals to close their doors. We must act to protect our nation's most vulnerable citizens, especially children, the elderly, and the disabled. I'll close by thanking Dr. Michael Burgess, lead GOP member of the Health Subcommittee, for getting this DISH cuts delayed for 2 years in this bill. I urge my colleagues to all support H.R. 2328. I yield back.
Thank the gentleman from Texas. Gentlewoman from California, Ms. Berrigan.
Mr. Chairman, I wish to strike the last word. First, let me start by thanking Mr. Olson and my friend from Texas for, first of all, pronouncing the name right. That was pretty darn good. It's as close as I say, Barragan. But I also want to thank you for working with me to work on the LINET program, which is so critically important. I represent a district that's almost 90% Latino African American, a district that's very working class and low income. So this program is critically important to my constituents and to so many of those across the country. I also want to take an opportunity to echo comments by my colleagues about the importance of community health centers and the work that they do. I was glad to see that we were able to authorize funding for a longer period of time, the 4 years, and do echo comments by my colleague, Mr. Welch, who, at some point would like to also look and seeing how we can make sure to increase funding to account for inflation. The last thing I want to mention is I think it's so great to be in committee where we have so much bipartisan work done. When you turn on the television these days, you wouldn't know that we're doing things on a bipartisan basis. And to be here and to work with our colleagues across the aisle to make sure we're doing things to improve lives and communities is so important, and it's nice. It feels really good. And so I hope we have more opportunities to do good work for the American people. The issue of diabetes is very personal for me. My mother has diabetes. She has type 2. My sister-in-law has diabetes type 1. And so all the work we've been doing to lower prescription drug pricing, especially on insulin, is critically important. And so I know we'll continue to work on that. But to see the special diabetes program being funded as well is good. We have the highest diabetes rate in my congressional district than any other district in the state of California. So the bills that we're passing here today are going to be very, very helpful, and I am glad the House is able to move this out of committee, and hope that we will see some action on the Senate side as well. And with that, I yield back.
I thank the gentlewoman. On the Republican side, is there anyone? If not, Mr. Ruiz, Dr. Ruiz.
Thank you, Mr. Chairman. I first would like to thank Representative McMorris Rogers for working with me on the Training the Next Generation of Primary Care Doctors Act that really emboldens the teaching healthcare program. And I also would like to thank the chairman and committee staff for working with me to include elements of this bill, especially a very important change from previous reauthorizations of this very important program, which makes logistical sense for the program itself. So we have heard that the family medicine programs, the primary care residencies, take 3 years to complete, yet previously we've been funding them at a 2-year level, making it very precarious for residents to join a program of which they don't know if it's gonna receive the necessary funding every 2 years. It makes it logistically impossible to start planning for growth within these programs if they only receive funding every 2 years. So adding the funding for 4 years is a great addition. It's a great victory to this program, a program which directly addresses the health disparities that we see in rural communities and underserved communities, because these programs exist in rural and underserved communities. And this program has shown success in making sure that we train more primary care doctors in the locations of which they're needed the most. Residents who train in teaching health centers are more likely to stay at those teaching health centers for employment after their residency, which means that they're more likely to stay in underserved rural areas. And given our overall physician shortage, especially the crisis that we have in underserved rural areas with the physician shortage crisis, this bill is a necessary, proven solution to the physician shortage crisis that will alleviate pain, suffering, and promote wellness of all Americans throughout our great country. So I want to thank you for moving this ball forward. I want to thank you for continuing to find ways to add upon the successes that we've made. I want to thank you for looking into the funding issue, as Representative Welch has said, for future reauthorizations, and I yield back my time.
Thank you, Dr. Ruiz. Do we have any other Republicans that want to speak on the Ains? Any Democrats? Okay, we'll start with Mr. Soto.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman's recognized.
After what was a long day yesterday, it's great to see us coming together today and show we can still get the job done in a bipartisan fashion here in Congress on health care, energy, consumer protection, for jobs, for all Americans. And let this be a sign that, if we work together, there's nothing that this Congress can't achieve. I'd like to also thank both you, Mr. Chairman, and my fellow Floridian Representative Gus Bilirakis for working with me in a bipartisan fashion to move the Territories Health Care Improvement Act forward for our fellow Americans in the territories. I'd like to thank Ranking Member Walden, Chairwoman Eshoo, and Ranking Member Burgess for their bipartisan support and collaborative efforts to have the Territory Health Care Improvement Act included in this amendment. When you think about all the members of this Congress from our territories, Representatives Plaskett, Gonzales-Colon, Sablan, Radowagon, San Nicolas, as well as supporters such as Congresswoman Velasquez and other co-sponsors, it's been a long journey for a lot of those representing our territories and those areas of the country that often have strong links. This legislation, in short, will right a long-time injustice to Americans in the territories, as well as save lives there. Unlike the states whose federal medical assistance percentage, FMAP, is determined by its per capita income, the territories receive a fixed amount of federal funds in the form of block grants. While the FMAP for states can go as high as 83% for states that need it, the territory's matching rate is fixed at 55%. Section 1108 of the Social Security Act further caps the amount territories are eligible to receive, thus restricting additional Medicaid funds the territories desperately need. This amendment would provide the territories with several years of increased federal funds. Puerto Rico's Medicaid allotment would be increased to approximately $3 billion per year for 4 years, which is huge. Allotments for the U.S. Virgin Islands, Guam, American Samoa, and the Commonwealth of Northern Mariana Islands would be increased substantially to prevent future federal funding shortfalls for the next 6 years. This legislation is needed because the Commonwealth of Northern Mariana Islands has exhausted its ACA funds as well as all other sources of federal and local funds for its Medicaid programs. We've heard from Delegate Sablan about that. While Guam and American Samoa are unable to generate the non-federal share required to draw down federal funds, which we've heard from their members as well. Additionally, the USVI will exhaust its Medicaid funding in 2020. This amendment could increase the territory's Medicaid cap to alleviate these shortcomings. Following the devastation caused by Hurricane Maria, many specialists and residents fled Puerto Rico. This was due to specialists not being able to be reimbursed through Medicaid, leaving patients unable to receive the care they desperately needed. The lack of sufficient Medicaid coverage and statutory caps also contributed to Puerto Rico's debt issues. By not having FMAP, they actually contributed to the reimbursements of medical specialists and patient needs. Puerto Rico has been forced to spend more of their already strained budget to meet required Medicaid standards, thus leading to many medical specialists and Medicaid-eligible patients fleeing the island to states where they could receive coverage and access to quality care. My home state of Florida, New York, New Jersey are favorite destinations for Puerto Ricans fleeing the Medicaid shortfalls. By passing this legislation, we also help states by ensuring that the Medicaid systems that so many of our fellow citizens depend on are properly funded. However, following the news of corruption of officials in Puerto Rico, we know that merely funding the Medicaid systems in the territories is insufficient. We must also have stringent integrity measures to ensure the allocated funds reach our fellow citizens in need of medical assistance, instead of lining the pockets of corrupt officials. I thank the ranking member, Walden, as well as my fellow Floridian Representative Bilirakis for their leadership in working with me and others on the committee for good governance amendments. This will ensure strong integrity measures are put in place to guarantee further corrupt actions of officials will not be tolerated moving forward. Thank you for all who participated in this amendment to safeguard the ability of fellow Americans in the territories to achieve the quality health care they are entitled to. Thank you again, Mr. Chairman. I yield back.
Thank you, Mr. Soto. Anybody on the Republican side? I saw Mr. O'Halloran's hand was up. Mr. O'Halloran.
Mr. Chairman, I move to strike the last word.
Gentleman's recognized.
I want to thank the chairman and the ranking member of this committee and the same with the subcommittees, their staffs, the members here, and their staffs that have done such a great job on showing that we can work together on this critical piece of legislation. As other members, I am proud to have advocated for increased funding for community health centers and the National Health Service Corps during my time in Congress. Mr. Chairman, as you know, community health centers nationwide provide over 27 million Americans with affordable, accessible, and quality health care, regardless of their ability to pay. Their reach is expansive. For example, they serve 350,000 veterans nationwide. These programs have provided critical services to underserved, rural, and tribal communities for decades. In Arizona's 1st Congressional District, 8 federally funded health center organizations serve nearly 200,000 patients. For example, the Sun Life Family Health Center serves nearly 50,000 patients and has 11 centers in my district alone, including locations solely dedicated to women and children. Their impacts are tremendous. I am disappointed that the final version of the bill provides lower funding than my introduced legislation, the CHIME Act. Though I recognize that this amendment includes the highest funding levels and the longest extension since the Affordable Care Act became law, providing certainty to providers across Arizona and the nation. I am also pleased that this has been a bipartisan endeavor, and there is support on both sides of the aisle for longer-term extension. But let me be clear. In the future, I remain committed to ensuring that these programs have the necessary funding they need to continue to provide vital services for Americans for decades to come. I am also proud to have introduced 2 pieces of legislation that aim to improve the lives of millions of Americans by reauthorizing the Special Diabetes Program and the Special Diabetes Program for Indians. SDPI has proven to be successful at curbing diabetes across Indian country, where American Indian and Alaskan Native adults are twice as likely to suffer from the disease. SDPI has been instrumental in improving health outcomes in Native communities, as diabetes rates among American Indians and Alaska Natives have declined by 54% since 1998. Numbers this significant demonstrate the program's value to communities across the country and the overall public health. It also demonstrates that the will of Congress does bring about results. While I applaud the committee for moving this legislation through committee, I want to emphasize that this is just one step in a long journey to improve preventive care and treatment. While the program has proven valuable, the prevalence of the disease remains highest among American Indians and Alaska Natives. We must work to address other contributing factors. Driven by additional challenges, from food deserts to lack of access to care, I remain committed to working with all of you, my colleagues, on both sides of the aisle to improve outcomes for all Americans. In my 2.5 years here now, it has been such a pleasure to watch how this group has come together with the leadership provided by the chairman and the ranking member to find common ground. And I yield.
Thank you, Mr. O'Halloran. So we're still on the Ains. Anyone else want to speak on the Ains? Because we still have 5 amendments to the Ains. All right, so I guess we're going to go to the amendments to the Ains. Any members who seek recognition to offer an amendment to the amendment in the nature of a subject? Yes,
I have an amendment at the desk.
Member.
Territory 01, I'm told.
Amendment to the amendment in the nature of a substitute to H.R. 2328 offered by Mr. Walden of Oregon.
Without objection, the reading of the amendment will be dispensed with, and the gentleman from Oregon is recognized for 5 minutes.
Thank you, Mr. Chairman. As we know, funding for the territories expires September 30th, and the result of such an expiration would have a devastating effect on the program in each of the territories. It was my commitment at our hearing last month that we work together in a bipartisan way to find a sustainable solution that avoids this hit on September 30th. The bill before us today meets those requirements. So I want to thank Mr. Soto and Mr. Bilirakis for their important work on this issue. I'd also like to thank the territory's delegates here in the House. Their tireless work on behalf of their constituents has proven invaluable to me and to my staff. I'm also thankful to Chairman Pallone and Chairwoman Eshoo for their partnership and willingness to work together on these and so many other matters, so that we could put forward a bold package that will ensure that the territory's Medicaid programs are adequately funded and that these programs will have program integrity measures in place. This heightened accountability is critically important to ensure these dollars go to the people who need them most. Now, with that said, given the news out of Puerto Rico last week, we all agree that additional program integrity measures are needed before we advance this bill to the floor. My amendment does just that. It adds these additional measures for Puerto Rico to ensure that the wholesale fraud that has taken place is not something that can continue moving forward. My amendment adds the following program integrity measures for Puerto Rico to meet, as well as incorporates TA technical assistance from the agency on the base bill. If Puerto Rico fails to meet a single one of these, we will be hard-pressed to discuss additional enhanced funding once these 4 years of funding come to a close. So number one, beginning 1 year after the date of enactment, Health and Human Services Office of Inspector General shall audit areas of the Puerto Rico Medicaid program that it considers to be high risk for waste, fraud, or abuse, such as contracting protocols, inappropriate denials of care, and financial management. Number two, not later than 1 year after the date of enactment, HHS's Office of Inspector General shall develop a work plan to audit and or investigate contracting practices related to the Puerto Rico Medicaid program. Number three, not later than 2 years after the date of enactment, GAO shall issue a report on contracting oversight and approval for the Puerto Rico Medicaid program. That report shall examine Puerto Rico's process for evaluating bids and awarding contracts, including which contracts are not subject to competitive bidding or requests for proposals, CMS oversight of contracts, and any recommendations to HHS, Congress, or Puerto Rico for changes necessary to improve program integrity. Number 4, Puerto Rico must establish and maintain a tracking system for all federal funds dispersed. It should include initial fund balance, each request for federal funds, and the remaining fund balance. It should be broken out by quarter for each federal fiscal year, and it must be reported to CMS every quarter. And 5, Puerto Rico must make available to CMS upon request all documentation related to the awarding of contracts related to the Medicaid program. Now, with this amendment and the underlying policy, we can ensure that our territories are properly funded for the years to come and that these dollars are actually serving the people they're intended to serve. So I urge adoption of my amendment. And Mr. Chairman, I do have prepared remarks from our delegate from Puerto Rico, Congresswoman Jennifer Gonzalez Colon, which I'd like to enter into the record. And again, she's been a terrific advocate for Puerto Rico and has been very helpful in getting us to this point, and I greatly value her input and counsel, as I know other members on the committee do as well. And so without objection, Mr. Chairman, if we could add her prepared statement.
Without objection, the gentlewoman from Puerto Rico's statement will be included.
And with that, Mr. Chairman, I yield back the balance of my time and ask for support on my amendment.
Thank you. Let me recognize myself to speak in support of the amendment to the Ains sponsored by the ranking member. Last week, we were all shocked and troubled by the allegations of misconduct by some of the individuals involved with the Puerto Rico Medicaid program. As my friend, the ranking member, and I said last week at the subcommittee markup, the news of these allegations broke the day before the markup, and there wasn't enough time to address the issues raised by the allegations in the bill we were considering. But we agreed to work together on a bipartisan basis to address the concerns we both had about the program integrity in the Puerto Rico Medicaid program. I think the ranking member's amendment does just that. It makes common sense improvements to strengthen the oversight, accountability, and integrity of the Medicaid program in Puerto Rico. Increased audits, oversight, and reporting will help to ensure that federal Medicaid dollars are serving their intended purpose of helping to improve access to health care for people in need. And I think that's what's really important here. As we discussed last week, there are no allegations that beneficiaries did anything wrong, but they're the ones who will suffer if we fail to act to ensure the integrity of the program. So I'm glad we were able to reach an agreement that preserves the package introduced by Representative Soto and Representative Bilirakis, and the increased funds and matching rates in their bill will help avert a humanitarian disaster. People in the territories are counting on us to make sure that Medicaid programs don't go off the funding cliff, but we also have an obligation to ensure that the additional funds serve their intended purpose of improving access to health care. It's our responsibility as the Committee of Jurisdiction for Medicaid to ensure that we are improving access to care while being good stewards of taxpayer dollars, and this amendment ensures that we're doing that. So for this reasons, I support the gentleman's amendment, and I urge my colleagues to do the same. And I yield back. Would anybody else would like to comment on the Walden amendment? If not, we will vote on it. And this is an amendment to the Ains. All those in favor of the Walden amendment will signify by saying aye. Aye. All those opposed will signify by saying no. Opinion of the chair, the ayes have it, and the amendment is agreed to. Do we have any more? We have other amendments to the Ains? Does anyone else? You want to do the gentlewoman from New Hampshire? You want me to go next? All right. I have a technical amendment we'll do before we do the New Hampshire amendment. Mine is FCTA 01, technical changes. You have it.
Amendment to the amendment in the nature of a substitute to H.R. 2328 offered by Mr. Pallone.
Without
Page
objection,
36.
the reading of my amendment will be dispensed with. Do we even need to comment on it? No. I don't think so. I don't think anybody has any objection. So we'll just move to a vote on my amendment to the Ains. All those in favor of the amendment will signify by saying aye. All those opposed will say no. And the amendment to the Ains is adopted. Now we're supposed to go to the gentleman from Montana, is recognized.
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk has it, the clerk
Yes,
will
sir.
report the gentleman's amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2328.
Without
offered by
objection,
Mr.
the
Gio.
reading of the amendment will be dispensed with, and the gentleman from Montana is recognized in support of his amendment.
Thank you, Mr. Chairman. I'm encouraged that we've worked together and across the aisle to reauthorize so many vital public health programs. All of the bills we're working on today are important to ensure that all Montanans have access to quality health care, especially folks in our rural communities. We need to reach a bipartisan solution to end surprise billing. I've heard from many Montanans about this issue, both patients and providers. Too many Montanans are getting their mail and finding an unexpected and outrageous bill for health care. Just last month, a woman in Ekalaka reached out to me. She was surprised when she received a $70,000 bill from a small Montana hospital. She had no idea how this had come about or how to handle the situation. This has to stop. I often hear from providers in Montana that Washington doesn't understand the needs of our rural communities. We need to ensure that all patients who are trying in good faith to work through our convoluted system to receive care and pay their bills are not victimized when providers and insurers can't agree. At the same time, we need to ensure we aren't harming rural providers in the process. That's why I'm introducing this amendment. The amendment simply ensures that the Secretary of Health and Human Services takes rural America, where too many are underserved, into account when setting in-network benchmark rates. I urge my colleagues to support this amendment. We need to make sure that rural communities are not lost in this process. I look forward to working with all of you to end the practice of surprise billing and reauthorize these critical programs. And with that, Mr. Chairman, I yield back the remainder of my time.
Thank the gentleman. Does anyone else want to speak on Mr. Gianforte's amendment? Mr. Butterfield is recognized for 5 minutes.
Thank you very much, Mr. Chairman. Mr. Chairman, and to the ranking member, thank you for your work on this bipartisan solution to the problem of surprise medical bills. I'm continuing to hear, Mr. Chairman, as I said in our last markup, from providers in my district who are concerned that setting a benchmark rate could impede access to care in rural communities. That is a fact. Mr. Gianforte's statement, which I am pleased, amendment, which I'm pleased to co-sponsor, will allow the Secretary of HHS and the Secretary of Labor to consider rural and underserved areas, including health professional shortage areas, when developing the benchmark methodology included in this bill. There has been a reduction in local access to care. This is why the inclusion of this amendment is so very important for rural districts like mine and like the gentleman from Montana. And so I urge my colleagues to support this amendment. Please support this amendment to ensure that access to care in rural communities is protected. Thank you for the time. I yield back.
Thank the gentleman from North Carolina, gentleman from Indiana.
Thank you, Mr. Chairman. I move to strike the last word. I'll be brief. I want to speak in support of the amendment. And, you know, in many areas of rural America, the Medicare reimbursement is lower than it is in other parts of the country. And as we know, a lot of times that falls into the private, you know, commercial insurance rates. And so I think it is very important with what we're about to do on surprise medical billing that we take into strong consideration what's happening in rural America and make sure that every American has access to quality, affordable care and also is not subjected to surprise medical bills. I yield back.
Dr. Ruiz is recognized.
Yes, thank you, Mr. Chairman. I want to associate myself with Representative G.K. Butterfield's comments and concerns about rural and underserved areas. I want to thank Representative Gianforte and Butterfield working together in a bipartisan manner. I support this amendment. I yield back.
Thank the gentleman. It's the rural day here. Oh, I'm sorry. Is there someone on the Republican side that wants to speak on this? And we'll go to the gentleman from Iowa.
Thank you, Mr. Chair. I didn't plan to speak on this, but this is such a great amendment. I do want to second it. Thank you, Mr. Gianforte. And I want to associate myself with all the comments that were made by the previous speakers. Being from Iowa, being from a rural part of America, we experience the same problems that all the other folks who've already spoken have. And so thank you very much. And I just want to second your thoughts. And I do support the amendment. I hope all of us do. Thank you. And I yield back.
Thank you. Anyone else on the Gianforte amendment? All right, so this is an amendment to the Ains. We'll proceed to a vote. All those in favor of the amendment by Mr. Gianforte will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment to the Ains is agreed to. We have more amendments to the Ains, right? Congresswoman Matsui is recognized.
Yes, Mr. Chairman, I have an amendment at the desk.
Clerk have that amendment?
Yes, sir.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2328 offered by
Without
Ms.
objection,
Matsui.
the reading of the Matsui amendment will be dispensed with, and the gentlewoman from California is recognized for 5 minutes.
Thank you, Mr. Chairman. I'm supportive of the critical steps that the No Surprises Act takes to protect patients from surprise medical bills. I'm also proud of the urgent action this committee has taken to correct critical gaps in consumer protections that until now have left too many American families footing the bill for a fundamental failure in our health care markets. Throughout this process, I've worked to preserve an equitable balance between providers and insurers when it comes to securing fair reimbursement for services. I thank the committee for supporting changes that create a more predictable payment rate for providers and require greater transparency from insurers. My amendment today requires that a provider's acuity level and case mix are taken into consideration when determining the appropriate amount to be paid by insurers. Caring for patients in highly specialized and higher acuity settings comes with different challenges. Trauma centers and teaching hospitals, for example, often treat complex emergency cases that require different level of resources to optimally care for injuries. In addition to looking at similar services, specialties, and geographic regions when determining a median contractor rate as required in the underlying bill, my amendment will help ensure that highly specialized sites of care can remain financially strong in the changing healthcare reimbursing landscape. I thank my co-lead in this amendment, Ranking Member Burgess, and I urge my colleagues to support this change and the vital patient protections from surprise medical bills included in the underlying bill. Thank you, and I yield back.
The Matsui amendment to the Ains, Dr. Burgess is recognized.
Move to strike last word. This is a common sense amendment, and it will improve upon the benchmark included in the bill as it passed through the Health Subcommittee. It allows for the benchmark methodology to take into consideration relevant payment adjustments that account for facility type, and that would include higher acuity settings and case mix. Patients require different levels of care, and if facilities or physicians are providing a higher acuity of care, they should be eligible for consideration in the establishment of the benchmark. I urge members to support this bipartisan amendment, and I yield back.
Thank you, Dr. Burgess. Dr. Ruiz.
Thank you, Mr. Chairman. I agree with this amendment wholeheartedly. I want to thank Representative Matsui and Representative Burgess for working together in a bipartisan manner. It is very common that in rural and underserved communities, the type of hospitals you have, which are usually the only type of healthcare hospital in the entire region, are tertiary care trauma centers that see pediatrics, OBGYN, and have a very broad case mix. And right now we have problems with hospitals shutting down in rural areas. So I think this would help tease out the relativeness of the types of different hospitals available and match apples to apples instead of apples to oranges, that we can do our logistic regressions and account for these higher acuity hospitals when determining median in-network payments. So I appreciate the effort and I support this, and I yield back.
Thank you. We got all the doctors today. Dr. Bichon.
Don't you love it? I want to speak in favor of this amendment. I want to thank Congresswoman Matsui and Congressman Burgess for offering it. Acuity of care is very important when considering payment levels for providers, and I support the amendment, and I hope everyone else will support the amendment. I yield.
Thank you. Anyone else on the Matsui amendment? All right, we're going to go to a vote. All those in favor of the Matsui amendment to the Ains will signify by saying aye. Aye. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment is agreed to. Now we're going to go to Ms. Custer, who has another amendment to the Ains. Does the clerk have that? Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2328.
Without objection,
offered by
the
Ms.
reading of the amendment will be dispensed with, and the gentlewoman from New Hampshire is recognized for 5 minutes.
Thank you, Mr. Chairman. I would first like to commend your leadership on the underlying legislation and acknowledge the incredible work on both sides of the aisle that we have achieved thus far in this committee to ensure that patients are not left with surprise medical bills. My home state of New Hampshire has been a leader in this area by passing a comprehensive law that protects Granite Staters from surprise billing by out-of-network providers at in-network facilities. Working in tandem with surprise billing protections, the New Hampshire approach includes network adequacy rules to ensure that insurance companies can actually provide access to their services that their policies cover. As I'm sure many of my colleagues who represent rural districts are all too well aware, network adequacy is especially important where time and distance to providers play a critical role in access to care. One of the concerns that we have consistently heard from the provider community regarding this legislation is the fear that they will lose their negotiating leverage with plans. They ask again and again, why would insurer negotiate when they know they'll only have to pay a certain rate for a service? We want to make sure we are not exacerbating some of the issues that rural communities continually face, limited access to affordable care due to narrow networks. We should strike a balance and ensure that while we are removing the incentives for providers and insurers alike to game the system through balanced billing, we are not inadvertently creating new incentives that would encourage plans to simply narrow their networks if they don't get the contracted rate they want. My amendment, which I am proud to offer with my colleague and friend, Representative Susan Brooks from Indiana, directs the Secretary of Health and Human Services to conduct a study examining network adequacy, taking into account maximum time and distance. In short, we should be able to judge the effectiveness of insurance networks so that we can say with confidence that our work here lowers the cost of care without limiting access, especially in rural America. And with that, I yield back.
Thank you. The gentlewoman from California is Indiana, boy, is recognized.
Pretty far away, but I move to strike the last word.
Big step down.
It's a great state, though, both of them. Thank you, Mr. Chairman, and thank you to the Chairwoman Eshoo and Ranking Member Burgess, and special thanks to my friend Representative Custer for introducing this amendment. According to a National Opinion Research Center study, more than half of American adults have received a surprise medical bill. 2/3 of Americans who have filed for bankruptcy cite medical debt as a contributing factor. Out-of-pocket costs for patients have risen dramatically in recent years and don't seem to be slowing down. We've been hearing for such a long time how patients have been stuck in the middle and suffer from surprise billing. There isn't always a clear path forward on how to approach this complex facet of our healthcare system. But whatever our solution, I believe it's critical we evaluate and continue to reevaluate the efficacy of the policies we're moving forward. That's why I'm proud to co-lead this important amendment, which will require HHS to conduct an annual study for the next 5 years on the effects of premiums and out-of-pocket costs that this bill will have should it pass into law. The study will also review the adequacy of provider networks in the individual and small group health plans. I commend the committee, the many stakeholders, and all have reached out to all of us to provide input on this legislation. This study will help future lawmakers evaluate and adjust the policy we're putting forward today. Ultimately, we have to continue to keep the patient foremost in mind as we work together to fix this broken healthcare system where surprise billing is so common. I yield back.
Thank the gentlewoman. Anyone else want to speak on the Custer amendment? If not, we'll go to a vote. All those in favor of the amendment offered by the gentlewoman from New Hampshire will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment to the Ains is agreed to. Now we go to gentlewoman from Delaware is recognized. She has an amendment to the Ains.
I have an amendment at the desk, Mr. Chairman.
We have it. The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2328, offered by Ms. Blunt Rochester of Delaware.
Without objection, the reading of the amendment will be dispensed with. The gentlewoman from Delaware is recognized for 5 minutes.
Thank you, Mr. Chairman. And first, I want to thank you and Ranking Member Walden and all of the members of this committee. And I join with my colleagues in saying how good it is to be a part of something that is this important to the American people and also bipartisan, and that the stellar reputation of this committee is warranted, and I'm proud to be a member of it. I've heard from many stakeholders in my home state of Delaware about the surprise billing legislation. Many are excited and support this bill. Others are more apprehensive. They've shared with me their support for eliminating surprise billing, but also their worries about how this law could impact them, our state, and some of our most vulnerable communities in both Delaware and across the country. I've listened to them, and I think their concerns are understandable. Any changes can be difficult and often uncertain. However, one thing is certain: we need to fix surprise billing and to protect the American people. I'm offering an amendment to require the Government Accounting Office to do, Government Accountability Office to do a study on the impact this bill has had once it is enacted. This study will allow us to see what changes have actually occurred and make sure the bill has had its intended effects. We'll be able to actually learn what the data shows about whether more patients are finding themselves in out-of-network situations and whether there have been changes in provider availability in rural and medically underserved communities. Additionally, the GAO study will tell how much grant funding states have received for all-payer claims databases, what they've done with that money, and how they've used the data they've collected. I'm pleased that our committee is willing to take a bold and bipartisan step to protect patients from surprise bills, and I believe that it is our responsibility to analyze the effects of this law that this law will have. I also want to thank my colleague, Mr. Mullen, for joining me in offering this amendment, and I urge my colleagues to vote in support of it. I yield back.
Thank the gentlewoman. Does Mark? No.
Yeah, I move to strike the last word, Mr. Chairman.
Gentleman from Oklahoma is recognized.
Well, thank you, Mr. Chairman. This amendment ensures that Congress is striking the right balance between oversight and limited government. I'd like to commend my colleagues for taking a balanced approach to this legislation that will not only protect patients, but strengthen our healthcare system. Patients deserve certainty on what it's going to cost when they go to healthcare providers. Rural communities like the one I live in face unique challenges when it comes to healthcare. Sometimes that means we have to drive an hour or even go across the state lines to our closest hospital. This amendment helps ensure rural areas are not left behind and that they get the relief they need. I'm proud to once again join my colleague, Ms. Rochester, who we have spent time together. Really enjoy her company. She is, I found out she was actually not even that far different on a lot of policies when we spent some time speaking to schools. In fact, we're more alike than Joe Kennedy. He's really liberal. We can't, no, I'm kidding. Not at all, actually. But I'm proud to join you in this amendment. It's good to work with someone that we get along with so good, and hopefully we can move this forward. I yield back.
Thank the gentleman. Anyone else? Mr. O'Halloran?
Motion to strike the last word. Mr. Chairman, I would like to speak in support of the gentlelady's amendment that would require the GAO to submit a report to the Congress on the legislature's impacts on provider shortages in rural and medically underserved areas. Throughout this process, I and others have been concerned with potential effects of the so-called benchmarking approach. So I am pleased to see this amendment, as well as the amendment offered by Dr. Ruiz, that to curb these potential effects to rural and medically underserved areas, particularly at a time when many communities nationwide are suffering from physician shortages. In the 1st District of Arizona, the Cobre Valley Regional Medical Center is a critical access hospital located in Globe, Miami. The center has been attempting to recruit a general surgeon for a year and a half. They have also been attempting to hire a neurologist and an ENT specialist with negative results. The problem is that Cobre and other hospitals are simply cannot find providers willing to relocate, and if they do find them, they must pay them a premium rate, a rate much higher than hospitals in urban areas. This is why I strongly support this amendment. It is a prudent, common sense amendment. It would allow Congress to be well informed of the law's implications and therefore better serve Americans nationwide, and I yield back.
Thank the gentleman, although I don't know why you can't get people, because I think it's awful nice there where you are, or whatever. So we have the gentlewoman from Delaware's amendment. Anyone else on that? If not, we'll have a vote. All those in favor of the amendment sponsored by the gentlewoman from Delaware will signify by saying aye. Aye. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment is adopted. Next, we have an amendment to the Ains from Mr. Lujan. It's recognized.
Thank you, Mr. Chairman. During last week's subcommittee markup of the No Surprises Act.
Wait a minute, I'm sorry. We have to have the clerk report it. You have it? All right, go ahead.
This is the air one, air.
Lujan 1? Yes.
Amendment to the amendment in the nature of a substitute to H.R. 2328 offered by Mr. Lujan of New Mexico.
Without objection, the reading of the amendment is dispensed with, and the gentleman from New Mexico is recognized for 5 minutes.
Thank you, Mr. Chairman. During last week's subcommittee markup of the No Surprises Act, Chairman Pallone and Ranking Member Walden agreed to work with me to strengthen provisions regarding the transparency in air ambulance billing. I want to thank the Chairman and Ranking Member for following through on this important commitment. Today, I am introducing an amendment to the No Surprises Act to require full and comprehensive transparency from both air ambulance providers and health insurance companies. Through many conversations about why billing by air ambulances can be egregious, I was told this practice was due to a lack of transparent data and subsequently low Medicare and Medicaid reimbursement rates. Well, then let's go to the source. Let's require this data to be reported and let the numbers speak for themselves. This amendment will do just that. It will require air ambulance providers to report cost data to the Department of Health and Human Services. It will require insurance companies to submit all claims data to HHS. Additionally, it will require the Secretary of HHS and the Government Accountability Office to provide 2 separate and independent reports on this data to Congress. While I plan to continue to investigate additional actions that can be taken to strengthen governance of the industry on behalf of constituents, I believe this amendment takes action to address the lack of transparency in air ambulance billing and takes a necessary step to prevent surprise billing by air ambulances. I urge my colleagues to support this amendment, and I yield. I would yield to the gentleman as well, Mr. Guthrie.
Thank you very much. I thank the gentleman for yielding, and I'll speak in support of your amendment. I want to thank my friend from New Mexico on your effort to ensure we have proper data. I have my one experience. I had someone contact me that had over a $30,000 bill, and he was just trying to figure out what the right number should be before he paid the bill, and it was hard to get to the numbers. And I met with several groups that represent the services, and the point that you made that we don't know exactly what Medicare and Medicaid pays, the underpayment of that is what forces some of the others. So I think it's vitally important that we find out exactly what those numbers are and address it and make sure that we have the proper payment, whether it's one way or the other. We need to know the right answer, and I believe that your amendment gets us in that direction, and I urge my colleagues to support it.
Thank you. Mr. Chairman, thank you very much. And Mr. Guthrie, thank you always for your leadership. It's always an honor to partner with you. And again, thank you to Chairman Pallone and Ranking Member Walden. And with that, I yield back.
Thank you. Does anyone else want to speak on the Lujan amendment? Well, wait a minute. Did Mr. Guthrie, did you already speak, or you want your own time? You're okay. All right. Well, we'll ask Mr. Ruiz, and then we'll go to Ms. Eshu.
Thank you,
Dr.
Mr.
Ruiz?
Chairman. I was a flight physician for Stat Medevac and Medical Command for the city of Pittsburgh. Representative Doyle knows Stat Medevac very well. It has the most air medical transportation flights and landings on helipads aside from the Pentagon. And I've seen some very critical patients out in the field from traumas in rural areas, hard to reach areas. And I know firsthand that they provide an incredible value to our nation and the American public's health. In emergency care, especially in rural areas, if you do not get to the cardiac catheterization lab within a certain time frames, the muscles in your heart die after an ischemic episode, and you will have long-lasting permanent disabilities. If you don't get to a interventional radiologist or a stroke center within a certain amount of time, then your brain cells will die due to an ischemic episode, which will augment a lifetime of permanent disability, when in fact you could have prevented that by getting to those locations at a timely manner. In addition to not only saving life and saving costs through reducing morbidity and long-term disability, the air medical community is our last stance in case of disasters. When there's a disaster, an earthquake, or rubble, who do you think is going to come to the rescue of the American people to lift them out and take them to the appropriate locations? I know that it's the air medical ambulance community because I've seen it done in other areas, and I've seen the important value of that, and that we should not discount that value, not only in the way that we work with the air medical transportation community, but also when we value the way we calculate what is fair in terms of reimbursement. I introduced a bill last Congress, and I'm working through a bill with other members of this committee, but the bill last Congress was called Ensuring Access to Air Ambulance Services Act, and the air ambulance community basically are very willing to share the information and the data. In fact, it was part of that bill that there would be a long-term study of transparency in terms of costs, so that everybody understands how much it actually costs, and so people can understand the percentage of that reimbursement that goes on, because as of now, it's unsustainable, and we need transparency, we need data, we need the information, we need to help rural communities like those in New Mexico, and we need to make sure that patients don't bear the brunt of that cost, and we need a fair, value-based system for reimbursement for that very valuable industry in our nation that saves lives and prevents permanent disability for thousands of Americans, if not millions. I yield back my time.
Thank the gentleman. Anyone on the Republican side? If not, we go to the Chairwoman Eshoo. You had a question?
Yes, Mr. Chairman, thank you for recognizing me. I move to strike the last word. I just want to make a couple of comments, given the comments that have been made. I don't think there isn't anyone here that is carrying a brief to diminish emergency services for anyone in the country, wherever they are, especially in rural areas of our country. So no one is carrying that brief. What came up in the hearing at the Health Subcommittee, under the very tough questioning of Mr. Lujan, were the costs of the service. So, and that was a legitimate, tough line of questioning. And through our government reimbursement, we need to know what these services cost. They were reluctant, as I recall, to really come clean with what their real costs are. So I think that there's a difference, and I just want to place that down on the record, maybe as a reminder, maybe people don't remember, or members that are not members of the subcommittee. That's A, and B, under the umbrella of surprise billing, the surprise billing that can come out of these services, because the price tag is so high. If we think going to the emergency room just via ambulance or driving to an emergency room it has sticker shock, this one is extraordinary. So I compliment the gentleman for the work he's doing on this. But, you know, whatever part of the system any of this is, we really need to drill down on the costs. And
will you yield?
I think that Mr. Lujan has done a good job with it, and I yield back the balance of my time. Oh, to Mr. Yes.
Yeah, I just want to concur with what you said, and in no way, shape, or form I want to imply that anybody was disparaging the air ambulance or emergency transportation services. I agree with this amendment.
You know,
I believe my comments are complimentary.
I want to reclaim my time. I'm not disparaging anyone. I think it is absolutely essential that the issue of what the cost of these services are be addressed.
No, I agree with you.
And they weren't under questioning. They weren't under questioning. Yeah, I'll yield.
Yeah, I agree with you. And what I'm saying is, I'm not saying anybody is disparaging. Nobody, not anybody in this committee. And I just want to make sure everybody understands I support this amendment. I support Representative Lujan's effort. And I think it's very important that we get transparency so we can get to the bottom of this and fix this issue. And you've done a great job in committee making sure that all the tough questions are asked, and I'm sure we're going to come to a very good solution. Thank you.
Yield back.
Thank you. So now we're on the Lujan amendment to the Ains. Does anyone else want to speak on that? If not, we're going to vote on it. All those in favor of Mr. Lujan's amendment will signify by saying aye. All those opposed say no. Opinion of the chair, the ayes have it, and the Lujan amendment is agreed to. I have another amendment to the Ains. Mr. Ruiz?
Mr. Chairman, yes, I have an amendment at the desk.
And does the clerk have that one? Statute of Limitations Amendment, Mr. Ruiz?
Yes.
Got that one?
Amendment to the amendment in the nature of a substitute to H.R. 2328, offered by Mr. Ruiz of
Without objection, the reading of the amendment will be dispensed with, and The gentleman from California is recognized for 5 minutes.
Thank you, Mr. Chairman. I'd like to thank my colleague, Dr. Bouchon, for co-sponsoring this amendment with me. This amendment simply states that a patient cannot be billed for the first time more than a year after the service provided. I can tell you the importance of this from not only the anecdotes and the experiences from family, friends, communities, but from distraught constituents who received medical care and then, for no fault of their own, due to a hospital or provider's billing lack of billing capacity, 3 or 4 years later get a surprise bill. When they have moved on, they find themselves in difficult situations. They have budgeted for other monthly or yearly expenses, and then suddenly they get a bill for $500, $600. So we want to make sure that that we incentivize billing capacity, but also to make sure that patients are not caught in that middle and receive that surprise bill. After a year, if they have not received it, then they cannot be billed. I yield back.
Anyone else want to speak on the Ruiz statute limit? Dr. Bouchon?
Thank you, Mr. Chairman. I want to speak in favor of the amendment. Thank Dr. Ruiz for offering it. This is a perfectly reasonable approach to prevent another form of a surprise medical bill that happens when, for whatever reason, a provider does not bill a patient until after a year after the service. In fact, many patients that I've heard from, they have no idea or can't even remember what the service was for. So I want to speak in support of the amendment, and I hope all my colleagues support it. I yield back.
Gentleman from Virginia, Mr. McEachin.
Thank you, Mr. Chairman. I think this is a question for council, and I may be thinking in too much of a parochial manner. But this amendment talks about a bill to the individual more than a year after such date of service. Is there not a doctrine of necessities? And does that doctrine not suggest that a spouse could be billed for services that are necessary? And if so, does this amendment exempt the spouse after a year?
God bless you if you can answer that question.
Mr. Chairman.
Go ahead.
The amendment is specific to the individual receiving the service.
Would the sponsor yield for a question?
I didn't really hear what you guys said. What did you say?
The amendment is specific to the individual receiving the service.
Not to the spouse.
No.
Okay. And you want?
I assume from your presentation that you mean to exempt the entire family from a bill after a year, do you not? Well, Mr. Chairman, I am certainly not trying to slow down this train, but I don't think this amendment accomplishes what the gentleman is trying to get at.
Would you explain to me again, to all of us, what
I'll try, and again, this may be just a Virginia thing, and maybe Mr. Griffith can help me, but if I have certain health care needs and they're provided to me, especially on an emergency basis, my wife is as liable for them as I am. And so so this amendment talks about an individual, the individual that received the service more than a year later, but it doesn't exempt the spouse. In other words, it doesn't defeat what we call in Virginia the doctrine of necessities. And I think that's what he's trying to get at, is to defeat the doctrine of necessities in this particular instance.
Would the council agree with Mr. McEachin's analysis of this?
Yes, as currently drafted, it's specific to the individual receiving the services. So if the intent were to apply to family members, you would have to insert a reference to such family members.
Dr. Ruiz?
Yeah, I have a question. So if, let's say, my wife is under my health insurance, the bill comes, to me, but it's her services, right? It's the individual who received that. So wouldn't that be considered protected in this case? Because regardless if the bill comes to me, it is that individual services. It's just a way to identify which service would not require a payment after a year of billing.
You're still liable. You're still liable. Your wife may not be, but you're still liable.
Could I offer an amendment to my amendment to state that not only the individual who received care, but the family member who received that care?
What I would suggest, if it's okay with both of you, that we try to address this, before we go to the floor, only because I don't think we should be writing these amendments now. I think everyone agrees that Mr. McEachin has a legitimate concern, and the council has said that he does. So why don't we just say we'll all agree that we'll change this before we go to the floor, if that's okay with everyone?
I agree, and I want to thank Representative McEachin for ensuring that the intent of the amendment is followed through so that we can have the most robust protections for patients and families from this. Thank you very much.
Mr. Chairman.
Could we just pause a second here? He wants to just say or immediate family member.
I don't know what
All right, Mr. Griffin has a proposed amendment, but we're concerned that this, we just don't want to do this the last minute. So we just promise you that we'll do something like this before we go to the floor, if that's okay with everyone.
Mr. Chairman,
Agree? Yes, Dr. Burgess?
strike last word just to speak on this issue. And I'm not opposed to what you've proposed, but maybe I'm just cynical for having worked with insurance companies for 25 years, and they always find a reason to delay your pay or not pay you or require more information. And they can drag things out for a year. I promise you they can drag things out for a year. So am I, as a provider, then enjoined from ever collecting that debt that the insurance company has managed to drag out for over a year's time?
Well, that's...
Should we think about, as you work on this, and maybe I'm just being overly cynical.
No, I think you raise a good point, and I think that's why we should take some time.
Well, I would just look at putting a prompt pay issue from the standpoint of the payer in here.
Yeah.
Because otherwise, the game is, we'll just kite the check till the end of the month and leave the doctor holding the bag. That's been my experience.
I think another reason why we should take another look, but go ahead, Mr. Griffith.
Mr. Chairman, if I might, and I regret I was over here in a little bit of a fog, and I appreciate the good lawyering work done by my colleague from Virginia. Reminds me of our days on the Virginia Courts of Justice Committee. But I think that's why we have to limit it not to others, but to an immediate family member, because I think otherwise we let the insurance company off. What we don't want them doing is coming back on the individual that got the service or the immediate family member. We may want to put in some clarifying language to take care of Dr. Burgess's problem that says, but that does not excuse or negate the responsibility of an insurance company or a corporate insurer from having to pay the bill subsequent or greater than 1 year later. We could do that as well, but I have to tell you, it never entered my mind, and I just think Representative McEachin did great lawyering work today.
All right, we're going to comment. We're going to tell him how great a lawyer he is. Thank you, I guess. Whose time is this, by the way?
It's mine if you give it to me.
It's actually my time, and I'll yield back to the chair.
All right, let's yield back, and we'll go to Mr. Bouchon.
I just want to, it's kind of a parliamentary question, then Mr. Ruiz will have to formally withdraw this amendment, is that correct?
Oh, is that what you want to do?
If that is necessary to make the corrections so that we can provide those robust protections and make sure that Dr. Burgess's concerns are addressed, then yes, I would withdraw the amendment.
But before you do that, can I just ask everybody, I would like to, he has a legitimate issue here of trying to address the statute of limitations. I would prefer if we moved your amendment and we made a commitment that myself and Mr. Walden would address your concerns rather than just dropping the statute of limitations.
Great. Why don't we go ahead and do that for the sake of time? I do not withdraw my amendment, and
If it's okay with everyone, and unless someone objects, I'm going to ask that we move his amendment and that we try to address this as an amendment to his amendment before we go to the floor. Is that okay, Mr. McEachin and the doctors amongst us? All right. All right, is there anybody else who wants to comment on this? We're going to move forward with that understanding. All those in favor of the Ruiz statute of limitation amendment will signify by saying aye. All those opposed will say no. And in the opinion of the chair, the ayes have it, and the amendment is agreed to. Now, do we have now we have a Schrader amendment. The gentleman from Oregon is recognized. Well,
I want Don to go outside the room first, so we can't find a problem with my amendment. That's okay. No,
I don't even know what he said, but okay. Does the
Have an
clerk
amendment
have
at
the
the desk.
amendment?
Yes, sir.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2328 offered by Mr. Schrader.
Without objection, the reading of the amendment is dispensed with, and the gentleman from Oregon is recognized for 5 minutes.
Thank you, Mr. Chairman. Thank you for your leadership, along with the ranking member, in bringing this bipartisan bill before the committee today, and all my colleagues for collaboration on these efforts. I just wish this would get some news media attention, quite frankly. You don't see this every day, and it'd be nice to get this great work that members played heavily into before the American people. I want to thank Mr. Griffin for also supporting this amendment, the goal being to strengthen the integrity of the surprise billing bill that we've got before us. As a committee, we've done great work. This is balanced, I think, and fair in total. We have all agreed with the central tenet that patients should be protected, not caught in the middle and on the hook for these big, huge medical bills that they don't have any control over. They thought they've done the right thing. We've considered with great debate the various approaches to the contracting and reimbursement issues that are the foundation of these surprise medical bills. And while we may not have solved absolutely everything here today, we're moving forward, I think, on a great compromise that'll solve the patient portion for sure. My amendment before you will improve the audit provisions of the bill, an important safeguard in the bill to ensure that the methodology determined by the Secretary is being properly calculated by payers in determining that median network rate. It clarifies the Secretary's authorities to do so and adds some specification on how the audits will be performed, evaluating up to 25 health plans a year. 25 is not a huge sample, but a big enough sample, and the Secretary also has the authority to audit any plan where there's been a complaint. I believe this amendment strengthens the balance of the bill. It's necessary for ensuring unintentional mistakes aren't made, and frankly, to corral some of the bad actors that are out there. It strikes a good balance, I think, for us and for the committee, and would urge everybody to vote in favor of the amendment, and I yield back.
Thank you. Mr. Griffith?
Thank you, Mr. Chairman. I concur with my colleague and ask that everybody vote for the amendment.
That was brief. Thank you. Anyone else on the Schrader amendment? We'll move to vote. All those in favor of the Schrader amendment will signify by saying aye.
Aye.
All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment is agreed to. What else do we have? Chairwoman Schakowsky has an amendment. Do we have it, Madam Clerk? There are two different ones?
Schakowsky 35, there's an amendment at the desk.
I have it.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2328 offered by Ms. Schakowsky of Illinois. Page 76.
Without objection, the reading of the amendment is dispensed with, and the gentlewoman from Illinois is recognized.
Thank you, Mr. Chairman. Mr. Loebsack and I have an amendment at the desk to amend the amendment, the nature of a substitute to H.R. 2328. As I've said many times before today, I'm very proud of the work of this committee, what we're doing today to shield consumers from outrageous bills. One way to do that, a solution not included in this bill, is to expand patient choice in providers. I have always believed that all providers in our healthcare system should be able to engage in their full scope of practice. Many non-physicians, especially advanced practice registered nurses, play a primary role in providing the highest quality care and filling gaps in access to care across our country. Our amendment would underline the importance of the provider's non-discrimination law that was established through the ACA, which prohibits insurance networks from discriminating against a class of healthcare providers acting within the scope of their practice. We must work to ensure that we are promoting competition and consumer choice and avoiding anything that might restrict access to necessary care. I look forward to working with the chairman and the ranking member, Mr. Loebsack, to strengthen the protections against provider non-discrimination moving forward. And I yield right now to Mr. Loebsack.
Thank you, Congresswoman Schakowsky, for offering this important amendment today. Thanks for yielding. In 2010, Congress enacted into law a provider non-discrimination provision that prohibits health plans from discriminating against qualified health care providers based only on their licensure. Unfortunately, health insurance issuers are continuing to discriminate against providers, and this is especially problematic for folks in rural areas who already have access limitations as it is. One of the underlying causes of surprise billing and restricting access to licensed providers in rural and underserved areas is provider discrimination. I have heard from a number of provider groups like CRNAs, for example, who have experienced discrimination from insurance issuers, which forces them to become an out-of-network provider. When health plans organize their healthcare delivery in a way that blocks out whole classes of qualified licensed healthcare professionals, patient access to care is impaired, and healthcare costs climb from lack of competition. Congress must address this problem by properly enforcing provider non-discrimination. And again, I thank Ms. Schakowsky for this amendment, and I yield back to you.
I thank the gentleman for yielding back and for his remarks. Again, I do look forward to working with the chairman and ranking member if we could strengthen the protections for the protections against the non-discrimination protections. That would be great. In the meantime, and for the moment, I withdraw this amendment and yield back.
So the gentlewoman has withdrawn her amendment. Do you want to comment on it?
Yeah, can I just comment, Mr. Chairman?
The gentleman from Indiana, strike
Yeah, I
the
moved to
last word.
strike the last word. Even though it's been withdrawn, I would be in support of it. I had, in the rural part of my district, a nurse practitioner who was practicing within the scope of her practice and needed to call my office to have congressional intervention to finally get on some health plans because they had been dragging the process out for months, and it was inhibiting her ability to provide access to medical care in a rural community, and this was under a MD's supervision even. So I would agree that in rural America particularly, you know, if people are practicing within the scope of practice that has been determined by their state, that we should not be discriminating against providers. I yield back.
Mr. Chairman,
Gentlewoman,
let me just ask you, if this amendment could be bipartisan, could it be considered now or between now and the floor?
Yeah, I think the latter would probably be the best. I think we can talk about it and see where we might make a difference.
And we can certainly work with you.
Thank you.
Before we go to the floor. Now, just let me tell you, the gentleman has withdrawn her amendment. What we're going to do is going to recognize Mr. Peters to strike the last word, and then we're going to end on a high note with the Ruiz-Bouchon amendment. And I was a little concerned because I saw Mr. Shimkus studying some paper over there with Mr. McEachin. I don't want you to study too much because we got to get done. All right. So I'll recognize Mr. Peters. Strike the last word.
Thank you, Mr. Chairman. I move to strike the last word and discuss an important piece of bipartisan legislation I've been working on with other members of the committee as well as with your staff. First, I want to thank you and your staff for all your effort to bring together this important package today. And the package we're discussing and we will pass extends many critical programs and will ensure that our communities will have access to much of the care that they need and deserve. The package does not, however, deal with one important issue, that of ensuring that seniors will continue to have access to clinical lab diagnostic services in the coming years. I've had the pleasure of working on a bipartisan basis with Mr. Bilirakis, Mr. Hudson, and Mr. Schrader on my bill, the Laboratory Access for Beneficiaries, or LAB Act. When Congress passed the Protecting Access to Medicare Act, or PAMA, we had the goal of updating the clinical laboratory fee schedule so that it's more reflective of market rates for lab services. Unfortunately, the first round of reporting collected by CMS captured only 1% of the laboratory market. And that means that CMS is basing its fee schedule on only a very, very small piece of the laboratory landscape. The resulting fee adjustments for lab services threaten $10 billion in cuts, which is 4 times greater than CBO had projected. Cuts of this magnitude threaten the health of our seniors as they will be delayed in or prevented from obtaining the lab tests they need to diagnose, treat, or prevent disease. If Congress fails to act, CMS will continue to gather incomplete data, adjust rates based on this incomplete data, and further threaten patient access. So, Mr. Chairman, I appreciate the work of you and your staff to iron out a few details on the bill. Hope it can be considered as soon as possible. I ask unanimous consent to submit for the record a letter of support for the LAB Act, signed by more than 25 organizations, including the Infectious Disease Society of America, the Caregiver Action Network, and the American Academy of Family Physicians. And I yield back.
Without objection, so ordered, and we will work with you on the lab issue before we go to the floor. Okay, so lastly, I think, we have an amendment sponsored by Mr. Ruiz and Bouchon. Bouchon, I guess, is the lead. So is that accurate? No, you are? Okay. Recognize Mr. Ruiz
Thank you, Mr. Chairman. I have an amendment at the desk.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2328 offered by Mr. Ruiz, after the subsection E.
Without objection, the reading of the amendment will be dispensed with, and the gentleman from California is recognized on his amendment.
I would like to thank Chairman Pallone, Ranking Member Walden, Dr. Bouchon, and all of your staffs for working together to move forward on this important piece of legislation. I appreciate the collaborative process, and I am pleased that we are all able to come to agreement. My amendment with Dr. Bouchon simply adds an appeals process in the form of an independent dispute resolution in cases where the in-network median rate may not be the proper reimbursement for a specific episode of care. We believe that adding this backstop strengthens this legislation, which already protects patients from getting surprise bills from unanticipated and often unavoidable out-of-network care. I want to thank, in particular, Dr. Bouchon and his staff. This is a true bipartisan amendment, and I urge everyone to support this important amendment and the underlying bill. Thank you, and I yield back.
Gentleman from Indiana is recognized.
Well, thank you, Mr. Chairman. I also would like to thank the chairman and ranking member, as well as Dr. Ruiz, the chairwoman and the ranking member of the Health Subcommittee also, for the collaborative approach of working on this amendment. I stated at both the legislative hearing and the subcommittee markup the critical nature of having an independent dispute resolution process as part of the solution to surprise billing. And I'm grateful for the fact that we've been able to make that happen today in a bipartisan way. And I look forward to being supportive of the amendment and the underlying bill. And with that, I yield to my colleague, Congressman Carter.
I thank the gentleman for yielding. I want to thank Chairman Pallone, Republican Leader Walden, Congressman Ruiz, and Congressman Bouchon for their hard work leading on this issue. I've said from the beginning that we need to find middle ground on this issue because protecting patients from surprise bills is simply too important to fall by the wayside. This has been a complex problem to tackle, but inaction was simply not an option. I'm proud that we found a way to move forward. I think this amendment strengthens this bill, and I look forward to moving this important policy to the House floor, and I yield back to the gentleman from Indiana.
And with that, I yield to Dr. Burgess.
And I thank the gentleman from Indiana, thank the gentleman from California for putting this amendment together. That's a good amendment. It improves the bill significantly. Really, there was no way to move forward on this without a mechanism for an independent dispute resolution, and you have accomplished that, so that is a good thing. Allowing docs to opt into an independent dispute resolution process that accounts for their quality level and the physician's acuity level is critical. And again, there really was no way to move forward without this, so I'm grateful that it has been included today. I'll yield back to the gentleman from Indiana.
Any other members on this side want to speak to the amendment? If not, Mr. Chairman, I'll yield back.
From Indiana, and I'd now like to strike the last word myself on the amendment. Yield myself 5 minutes for that purpose, but I won't use it all. First of all, our most important task today is to protect patients from the unreasonable and unacceptable practice of surprise billing. Under the Pallone-Walden legislation, providers would no longer be able to balance bill patients for out-of-network emergency services or for scheduled services from providers the patient was not aware would be in their treatment. Our legislation removes the surprise from billing by completely protecting patients and taking them out of the middle of disputes between insurers, providers, and hospitals. The Ruiz-Bouchon amendment adds a backstop for providers to appeal their claims through an independent dispute resolution process if they can demonstrate that they have not been fairly compensated. The amendment would allow providers to have 30 days within which to file an appeal of the benchmark payment with the insurer. The insurer would then have 30 days to adjudicate the appeal, after which the provider could initiate independent dispute resolution. The Ruiz-Bouchon amendment would limit appeals to extenuating circumstances so that only complex cases would qualify, and it also limits the variables that can be considered during arbitration. Most importantly to me, it bars arbitrators from considering billed charges, which are unilaterally set by providers. Provider charges are often double or triple Medicare rates, and in some cases, for some large physician staffing companies, it is around 500% of Medicare rates. If Congress sends the signal to arbiters that provider charges are to be considered, we would be creating a significantly higher standard for payment, decreasing incentives for providers to be in network and putting upward pressure on healthcare premiums. I'm supporting this amendment because it addresses concerns raised by members on both sides of the aisle that providers should have some recourse to be able to make the case to a neutral third party if payment is inadequate. But I have to be honest that I do continue to be concerned that arbitration may come with additional administrative costs, which could be passed on to consumers in the form of higher premiums. My priority is that we protect consumers without raising healthcare costs for working Americans, and I believe the Ruiz-Bouchon amendment achieves these goals. It's imperative that we pass this legislation today and finally protect American families from the financial devastation and the tremendous emotional toll of surprise medical bills. And that, I yield back at this time and yield to the ranking member.
Thank the chairman and for his leadership, and I do mean that, leadership. It takes a lot to get this done, and to legislate on challenging topics like surprise medical bills takes patience too, both words, patience and patience, and a commitment to share ideas, listen to feedback, and produce consensus. And you've done that here, and it reflects a decades-long legacy of this committee's chairman. When this committee released our discussion draft on the No Surprises Act, it did so in front of a packed room of people. But what we're doing today will impact millions of people. Our goal was clear: protect patients, hold them harmless. Along the way, we heard input from a wide range of stakeholders: doctors, such as the pathologists, emergency room physicians, anesthesiologists, and radiologists, who provide critical and often life-saving care for our friends, for our neighbors, literally for ourselves. Hospitals who continue to innovate and modernize their services and facilities to achieve better health care outcomes. Insurers, our community partners in building and strengthening advanced analytics and research to uncover healthcare trends and lower the cost of care. Families USA, the American Medical Association, the Federation of American Hospitals, and Blue Cross Blue Shield Association. We heard from insurance commissioners, ambulance companies. And in a city splintered by partisanship, those groups rarely, if ever, can agree on policy principles. But every single one of them told me the same thing. Take the patient out of the middle, hold the patient harmless. Patients like Sanji Wilkes, who received a $50,000 surprise bill. Remember, she testified before our committee, Mr. Chairman. Her son stayed 50 steps from her in the NICU for one night. Mr. Chairman, I know that was our driving force, our motivation for action, protect the families, the single moms, the couples, the young professionals, the senior citizens from New Jersey to Oregon, to protect Americans who, through no fault of their own, played by the rules but received unaffordable surprise bills. Hear me say this clearly. Surprise billing is not right. It's not fair. Frankly, in some cases, it's darn right deceitful. So if hospitals, doctors, and insurers mean what they say, that patients should be held harmless, then patients are not responsible, then hospitals, doctors, and health insurers are responsible. It's that simple. So today we improve on that shared responsibility, adding a pragmatic backstop to the median in-network rate. What the Ruiz-Buchan amendment does is simple. It says if a doctor, hospital, or insurance company thinks a payment higher than the $1,250 median in-network rate is unfair, you can challenge it through an independent dispute resolution process. In addition to the median in-network payment, the arbiter can take two things into consideration: the complexity of the patient's care and the quality of the doctor's services. And while I preferred the benchmark, like we have in Oregon, Mr. Chairman, I believe this strikes a fair and necessary balance. This should be true for doctors, hospitals, and insurance companies who told me they share my top goal. So, Mr. Chairman, I urge each of these groups to join us and hold patients harmless, and support this amendment and support this bill. And again, thank you for your efforts on this, and to all the colleagues on the committee who played such important roles, including the chair of the Health Subcommittee and the top Republican on the committee. We appreciate your great leadership and counsel as well. And with that, I'd urge support of the amendment and the underlying bill, and I yield back the balance of my time.
And I thank the ranking member for those comments. Does anyone else want to? Yes, the chairwoman of the Health Subcommittee, Ms. Escher, is recognized.
Mr. Chairman, I move to strike the last word. I support the amendment, and I want to salute each one of the individuals, the chairman, the ranking member, the authors of the amendment, people that have worked really hard on this for what they're bringing forward. I've said it before, and I'm going to repeat it. The hospitals, doctors, insurers, these are the stakeholders that have really created what I would call a mess, really. And we're the referees. So we're trying to fix this. And I think it's a great credit to the members for, as I said earlier today, for listening to each other and being willing to amend the legislation. And I think what we've done with this bill is, the most important thing is that we've taken the patient out of it. And that's exactly what the witnesses said we should do. Secondly, we've made sure that the bill's protections are strong enough so that no patient gets a surprise bill because of a medical emergency. I think we've achieved a delicate balance so that hospitals, doctors, and insurance pull their fair weight by combining the arbitration and the benchmark payment approaches. And obviously, this is, the debate is over money. So, like, what's new around here? As I've said previously, if doctors are charging inflated rates, then they're going to come down. If insurers aren't negotiating with doctors fairly, now we have a hammer to bring them to the table. If insurers save money from our bill, we're tracking those savings to make sure they're passed on to patients in the form of lower premiums. Really, I think the real winners in this are who we intended to be the winner, and that's the patients. So bravo to everyone that has worked so hard on this. And I think this is something that every single one of us can support, and thank you, and I yield back.
Thank you. Does anyone else want to speak
I do.
on the Ruiz-Bouchon amendment? Gentlewoman from Illinois, Ms. Schakowsky.
Let me just first say that this has been a very great day for this committee, and I'm proud to be a part of it. And I want to say these final words by first saying how much I sincerely respect both Dr. Weiss and Dr. Bouchon. But I have to say that I am very concerned that this amendment will not allow us to really address our skyrocketing healthcare costs. This bill includes a median benchmark rate that will lower healthcare costs by bringing rates down from the often astronomical numbers that we see providers making today, anywhere from 500% of Medicare rates to 1,500% of Medicare rates in some circumstances. But arbitration, in my view, which is used as the backstop, will not lower the healthcare costs. So I actually do disagree with this amendment. Arbitration actually comes with additional administrative costs and complexities, which could then be passed on to consumers in the form of higher premiums. And even as a backstop, I think that binding arbitration leaves a public interest, public health decision up to an unaccountable private decision maker. And I don't think that is a very progressive way to be dealing with the issue of pricing. So I just want to say I would prefer that this bill move forward without the amendment. And having said my piece, I will yield back.
Thank you. Does anyone else want to speak on this amendment? If not, we'll proceed. Again, this is an amendment to the Ains. All those in favor of the Ruiz-Bouchon amendment will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to. Now, we have no more amendments to the Ains, so we're going to go to the Ains. If there's no other discussion, all right? We will proceed to a vote on the amendment in the nature of a substitute, which was offered by myself. All those in favor of the amendment in the nature of a substitute as amended to H.R. 2328 will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute as amended is adopted. Is agreed to. Okay. Now, unless anybody wants to say anything else, we're going to go to the... Nobody, okay. We go to the bill. Question now occurs on agreeing to the measure as amended. So we're talking about now H.R. 2328. All those in favor of agreeing to H.R. 2328 as amended will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it. And H.R. 2328 as amended is reported to the full House.
Mr. Chairman?
Yes.
I asked for 2 days to submit additional views on the legislation considered by the committee.
So ordered. And without objection, the staff is authorized to make technical and conforming changes to the bill consistent with the actions taken by the committee today. The chair requests unanimous consent to enter the following into the record. This is a long list. A letter in support of consumer product safety bills from consumer groups, a letter on H.R. 3375 from the National Association of Federally Insured Credit Unions, a letter on H.R. 3375 from Electronic Transactions Association. Look, before I continue with this, because you can leave after if you want to, but I just wanted to thank everyone. really, I know everybody's been so great in commenting about what a good job we all did today, and I really think that's true. So I just want to thank the staff and both sides of the aisle. We really, I mean, to get through this list today in, what, about 6 hours is pretty amazing, and it really says a lot about this committee and how we operate. So thank you all again. I appreciate it. If you don't want to stay while I read this list, don't worry about it. The chair requests unanimous consent to enter the following into the record: a letter in support of consumer product safety bills from consumer groups, a letter on HR 3375 from the National Association of Federally Insured Credit Unions, a letter on HR 3375 from the Electronic Transactions Association, a letter on HR 3375 from the Credit Union National Association, a letter on HR 2328 and HR 2781 from the Association of American Medical Colleges, a letter on HR 3375 from AARP, a letter on HR 2328 from the American Hospital Association, a letter on HR 3375 from Consumer Bankers Association, a letter on HR 1058 from Consortium for Citizens with Disabilities, a letter on HR 2035 from the Consortium for Citizens with Disabilities, a letter on HR 2328 from the AARP, a letter on HR 2328 from American Academy of Family Physicians, a letter in support of Medicare and Medicaid extended provisions from the Federation of American Hospitals, a letter on HR 2781 from the Leading Age, a letter from the U.S. COPD Coalition, a letter on HR 3375 from Consumer Reports, a letter on HR 2328 from American Cancer Society, Cancer Action Network, American Heart Association, the American Lung Association, a letter on HR 2041 from the Alliance to Save Energy, a letter in support of Territories Healthcare Improvement Act from the Puerto Rico Hospital Act Association, a letter in support of Territories Healthcare Improvement Act from Congresswoman Jennifer Gonzalez Colon. Continue to next page. These are a number of letters from the Stopping Bad Robocalls Act, from the AARP endorsing the bill, from Consumer Reports in support of the bill, from the Credit Union National Association, from the National Association of Federally Insured Credit Unions, from the Electronic Transaction Association, from the Consumer Bankers Association, from Americans for Financial Reform, from Center for Responsible Lending, for Consumer Action, from the Consumer Federation of America, National Association of Consumer Advocates, National Consumer Law Center, Public Citizen, Public Knowledge, all these letters without objection, so ordered. And without objection, the staff is authorized to make technical and conforming changes to the bill consistent with the actions taken by the committee today. Thank you all. Committee stands adjourned. Phew.